Good afternoon, everyone. We will get started with this public hearing of the Finance, Revenue, and Bonding Committee today. As you all no doubt know, there's lots going on in the building today. And so I imagine we will have more people than usual participating remotely, but there are lots of people online. And we look forward to hearing from lots of people today on the bills in front of us. Mr. Co-Chair, any? Good. Okay, with that, we'll call our first speaker, Anne Marie Mosqueda Jackson. Okay, we'll go to number 2, Jade Thomas. No, we're cruising. Christopher Davis. Welcome.
Thank you very much. I don't think I've ever been first in this committee, so I appreciate it. I think I was 92 last week, so I really appreciate it.
You're only first by like disqualification, so I don't know if it really counts.
Coming in hot today.
I will take it any way I can get it, Senator. And to even further streamline things, I would also like to have my colleague Jenna Grasso join us remotely to testify on House Bill 5443. She was number 34, but she'll join me to kind of streamline that process as well, as I know the committee prefers that. And she is representing our Bioscience Growth Council on that bill.
Is she online?
She is online.
Great. Okay, please proceed.
Thank you. So my name is Christopher Davis. I'm the Vice President of Public Policy at the Connecticut Business and Industry Association, the state's largest business organization with thousands of member companies, and about 90% of our membership is less than 100 employees. Thank you for the opportunity to provide some comments on Senate Bill 84, an act concerning revenue items to implement the governor's budget. Also provide some comments on House Bill 5443, in addition to my colleague Jenna Grasso, who's joining us, as well as Senate Bill 85. In regards to Senate Bill 84, CBI strongly supports Section 5, allowing pass-through entities to earn the R&D tax credit. This is a critical modernization of Connecticut's tax code that better reflects how today's innovation-driven economy is structured. As outlined in this bill, this provision would allow pass-through entities with less than $70 million in sales to earn a 6% R&D tax credit, capped at $1.5 million per firm and $25 million statewide. It's important to note that this is very thoughtfully done in a fiscally responsible manner. We appreciate the way that it was proposed and structured, and that it has a $25 million cap. However, only about $5 million of that will impact general revenue funds, due to about 20 million of it anticipated coming through estimates and finals that will ultimately pass through to the volatility cap transfers. To give you a small example, a small advanced manufacturing firm makes a $2 million investment. They would be able to receive a credit of $120,000. And to a small business or a medium-sized business, $120,000 can mean a significant amount. Can mean hiring a new engineer, could mean reinvesting in additional equipment. It could make the difference between doing it here in Connecticut or doing it elsewhere in the country. Likewise, we support sections 14 through 28, eliminating the occupational licensing fees for high demand jobs, including nurses, electricians, HVAC technicians, mental health clinicians, and teachers. This is critical in trying to solve the workforce shortage. We currently have 68,000 job openings across Connecticut, and lowering the costs and barriers to having these high demand occupations will certainly help us in attracting and retaining talent here in Connecticut. We also are supportive of the approach taken in Section 1, although we would certainly like to mirror the federal legislation. We are very appreciative of the immediate expensing of research and experimental expenses going forward, starting in tax year 2026. We also have reservations about Section 2, which changes the treatment for qualified production property. Currently under the OBBBA, businesses would be able to immediately expense their qualified production property of their manufacturing. This means if they were to expand here in Connecticut, build out their facility, they would be able to immediately expense it. What's being proposed here is that they would revert back to the current system, which is a 39-year amortization table for those types of expenses. Section 3 of the hospital provider tax, I'll just say that we hope that the policymakers and the hospitals continue this dialogue to try to come to a solution on that and allow our member hospitals to discuss that a little bit later. And we do continue to have strong reservations about Section 8, adjustments to the volatility cap. I'll just say it mirrors very closely my testimony a couple weeks ago regarding the bill directly dealing with that. With House Bill 5443, we are supportive of the transfer to the tourism fund, which I think you're going to hear a lot of testimony about the benefit to that. So I'll allow that to come directly from them. And then I'm joined here by Jenna Grasso to talk about the importance of the elimination of the sales tax for biotechnology firms on their electricity bill.
Good afternoon, Senator Fanfara, Representative Horn, and members of the Finance, Revenue, and Bonding Committee. I am Jenna Grasso, Policy Director of Bioscience Growth and State Spending at the Connecticut Business and Industry Association. I'm also Director of our Bioscience Growth Council, and we represent biotech and biopharma companies, small and large, across the state. And together we develop strategies to fuel industry growth, produce timely introduction of new medicines and medical devices. So thank you for the opportunity, as Chris mentioned, to testify today. I've submitted written testimony on 2 bills this afternoon. Senate Bill 84 specifically pertaining to Section 5 and House Bill 5443 pertaining to Section 4. So briefly touching on Senate Bill 84, specifically against Section 5, I want to reiterate that the bioscience community strongly supports expanding the R&D tax credit to pass-through entities, which are S corporations and commonly identified as LLCs. Consistent with my other testimony today, this proposal does not create an entirely new incentive or program. Rather, it extends Connecticut's existing R&D tax credit structure to smaller
You reached the 5 minutes. You could please summarize.
Okay, well, then quickly moving on to House Bill 5443, I would just like to say our biotech sector, they use energy to operate on a day-to-day basis. They use at least 75% towards their manufacturing for all their biotechnology services. So we are supportive of the provision in this bill to eliminate the sales tax on energy costs for this sector, again, which is not a new proposal. Other manufacturers do already under Certification 129 are eligible for this exemption. So thank you, and I'm glad to answer any questions.
Thank you. You'll have to take it up with, we endorse your paneling up, but kindly share the time amongst the panelists so that one person doesn't have to sprint through their testimony.
Thank you.
I have one quick question with respect to the licensure fee removal proposal in the governor's bill, SB 84. We had a lot of testimony from healthcare professionals to the point that this would be very helpful to them for all kinds of reasons. We got no testimony from others on that list. I wondered if you have any sort of evidence that it would be helpful to those, that this matters at all to those professions, the ones outside the healthcare field that are listed there.
Sure, and I would anticipate you probably will still receive some testimony from some of the trades people, especially. There are several bills that deal with this topic, both this session and in previous sessions that did have significant amounts of testimony. So yes, it would be a powerful way to be able to attract them, especially with the licensed trades like electrician, HVAC, those individuals, because it gets not only people into the trade, but it also provides them ability to then become, say a master plumber or a master electrician or a master HVAC. They can then open their own business, which then any kind of reduction in that license fee and that cost will obviously be very helpful. And the just general principle of that you're paying on a yearly basis, in some cases 2 years, and others for your license to just continue to do your work. So I think there's a lot of concern from individuals that they're continuously every year of their trade having to pay a licensing renewal fee. That can obviously be something that makes it difficult for them to be able to continue to work in that field.
Thanks. And I want to just reflect that by no testimony, I mean, as of 9 PM last night. So of course, there's additional coming in. Senator Fazio.
Thank you, Madam Chair. Thank you, Mr. Davis, for your testimony. It was very helpful. First, I just wanted to say that I was very surprised coming here to not see OPM, the administration, on the list giving testimony when the governor's budget is on the agenda for a public hearing today. It is an extraordinarily important document to our state. It is perhaps the most important bill, most consequential economic bill proposed to the legislature this year, and to not have the administration testifying at the public hearing in favor of it raises questions and is very surprising. I did want to ask you two questions. First, how do you view the how do you view the acquiescence to the federal proposals about full expensing of research and development and then capital expenditures? I think the vast majority of economists, center left, center right, and in between, would say that full expensing of factory, of equipment, of property, and so on is very important to generating wage growth, especially for kind of lower to middle wage workers. And so I was a little bit surprised and disappointed to not see that included. So wanted to have your take on that, and and perhaps other, where you would like to see long-term economic growth strategy come from in this budget or in other budgets in the future.
Sure. Specifically to the immediate expensing of the qualified production property that was included in the OBBBA, CBIA is supportive of that immediate expensing. And the reason why is because it incentivizes businesses to grow right here in Connecticut. So they would be able to expense at the federal level due to that legislation, but unless they're allowed to expense it here, it doesn't give us the advantage that we actually currently have, because we would be coupled with it as of right now. So put that into perspective. Some of our neighboring states have already begun the process or have decoupled from that specific section of the bill. We have a competitive advantage by allowing for that expensing to happen, because now when a business wants to look at either expanding their footprint here in Connecticut or onshoring to Connecticut, or moving facilities from some other state to Connecticut, it could be seen as an advantage to be able to immediately expense those construction costs associated with that expansion. By taking that away, you lose that advantage. Now, I know there has been an argument that several other states have already headed in this direction. I would argue, why not have us be very competitive rather than necessarily having to match what other states are doing? So I would suggest that we do not decouple from that. However, I do understand that it is a revenue impact to the state. And I presume that that's why they're offering to do that. Now, I do understand as well that the businesses would still be able to expense it. It just would revert to the existing 39-year schedule for that type of real property expansion. So we are still appreciative of the ability to expense it over that 39-year period. Just the benefits that come with being able to do it immediately are quite clear and intentional to try to drive businesses to grow here in Connecticut and onshore their facilities here to the state.
100 divided by 39 is a much 1 divided by 39 is a much smaller number than 1. Thank you, Madam Chair, and thank you, Mr. Davis.
Thank you, Senator. I do just want to note with respect to OPM that yes, they are not here in person today. However, we did hold a hearing entirely on the budget when OPM presented to us after the budget was released. So it's not, they have presented to us before. Representative Paletta.
Thank you, Madam Chair. Good afternoon. I do have a brief question either for Chris or for Jenna. You kind of piqued my interest when we were talking about electric bills and perhaps exempting the sales tax. And I thought maybe one of you could expound a little bit more, because we had a bill last year in this committee that we heard. And unfortunately, we didn't see a ton of businesses across Connecticut come out and speak about this, in my opinion, very important topic, which would be eliminating the sales tax on electric bills, particularly for small businesses, because again, we know that price is ever rising rising here in Connecticut. So I'm wondering if you could just expound on that a little bit and what it would mean to the biotech industry.
Sure. If I could, Jenna, I'll start by saying that, yes, we are very supportive and have part of our policy solutions agenda this year to eliminate the sales tax for all businesses on their electric bills. We're one of the outliers in the region that still has that sales tax on the electric bills, and it could be a tremendous savings, especially for our small businesses across the state. I believe we'll have probably a further discussion about this on Senate Bill 2, which included that full exemption for all businesses in its bill. So we're waiting for that to be drafted in the public hearing on that to really have a number of businesses come out and talk about it. We did support it last year in the bill as well, and had dozens of companies testify in support of that as well. And I'll let Jenna speak to why it's so important to the biotech community as well.
Yes, so from the bioscience lens, especially it's across larger, more established employers all the way down to startups. They are unanimously asking for this relief because it is such a significant burden to expanding their business. And to that point, they convened and they said, well, other states, including Massachusetts, New Jersey, North Carolina, they all exempt the sales tax on energy, specifically for their electricity within this sector, when 75% of it goes towards biotech manufacturing. So we are thrilled to see that it's something gaining momentum this year. And like Chris said, it's a part of our agenda at large for the business community, but it is something significant that the biotech sector is pushing for specifically.
And Representative, I could add to that too on the biotech side, and this goes for all pass-through entities, the Section 5 of Senate Bill 84, the importance of allowing for pass-through entities to have that R&D tax credit, in addition to being able to reduce their energy costs, could be a game changer for a lot of these businesses to make those kinds of investments here in the state of Connecticut. And it would, as Jenna mentioned, would mirror us to Massachusetts, who allows pass-through entities to have the R&D tax credit, and does not have the sales tax on the electric bill for businesses that are less than 50 employees. So I think it would be important for us as a state to be able to be competitive and adopt those provisions.
Thank you so much. And I totally agree with you. I worked with my good co-chair there on the committee, Senator Fonfara, and others on that proposal last year. And I hope we can see it across the finish line in a bipartisan way this year. Thank you.
Thank you.
Thank you. Senator Fonfara.
Thank you, Madam Chair. Good to see you, Chris. Just general position, not to discourage anyone from being here or online to testify in any way. It's your right. But, you know, no one likes to pay taxes. And certainly tax reductions can be stimulative. But there's a room across the way that likes spending those taxes and that revenue, and that doesn't go away. And as a matter of fact, we had a very, very long hearing, probably longer than this one will be, I hope, regarding how to find more revenue, because many people believe that we have unfinished business needs in this state that need to be met. And so $25 million to small businesses that are not currently able to take advantage of a credit, no question, very likely would have some benefit. But that's $25 million that we have to find somewhere. Unless there's some folks who are going to come forward and say, no, take that benefit away from me. I don't want it anymore. So that's how you can find the 25. I don't think that's going to happen. So there's no free lunch in the end, Chris, and that's not just aimed at you, but others that, you know, make good arguments for why we should reduce a fee on a nurse or what have you. I get it. I think everybody here gets it, but that's not where that trail ends. So we have a responsibility in that context as legislators. For whatever that's worth, Madam Chair, Thanks very much.
If,
Well said, Mr.
if I
Clerk Chair.
could, Madam Chair,
Yeah.
just in response to that, Senator, I totally appreciate that. That's the struggle between having a finance committee and appropriations committee rather than a ways and means committee that kind of looks at both sides of it at the same time. I would argue, however, that this structure of the tax credit that's included in this budget proposal, I think is thoughtfully done in order to try to address that concern, in that it's really only hits about $5 million to the general fund, which would require the changes to the spending side potentially. And about 20 million of it would probably be impacting the volatility transfer later on. So the actual impact on the spending side, on the revenue side, is about $5 million. And I would argue that by having that type of credit available, as I outlined in the example of a manufacturer spending $2 million on new equipment and getting $120,000, now you have a new person working in that position, things start spurring and going from there. That $2 million purchase might have additional tax revenue associated with. So there is definitely that carry on there that makes a credit like this that much more powerful. And that's why I think you've seen several other states already adopt it.
Thank you. Seeing no further questions, thanks for being our first panelist. And I do want to note, we do encourage people to form panels. If you do form a panel, you will be given 5 minutes before the alarm bell goes off, as opposed to 3 as an individual. And for all of us on the committee, a reminder that we're all limited to 2 questions each. So
Appreciate it. Thank you.
thank you.
Thank you.
Next up, we have Bonnie Stewart.
Good afternoon. My name is Bonnie Stewart, and I'm CEO of the Connecticut Society of CPAs. And I have joining with me Alan Clavette, Board Emeriti and current chair of the CTCPA's State Tax Committee. I am going to ask Alan to give our remarks today because they're similar, and this way you'll reduce the amount of things you hear twice. Alan?
Thank you. Senator Fonfara, co-chair Representative Horn, and the rest of the committee, thank you for allowing me to testify. We're speaking in support of HB 5445, the act basically looking to simplify the treatment of non-Connecticut bond premium on tax-exempt bonds. I know it's a very technical topic. Currently, the way it is written, it is sort of a tax trap and an unfair treatment of how that works in Connecticut. We support the change because obviously it is a complex calculation. It is an error that many taxpayers make because they're not aware of that nuanced little adjustment that has to be made on a Connecticut return. None of the software that I have ever used, and nor have most of my colleagues used, provide any sort of an easy mechanism for tracking that. And hence it is something that creates audit issues and complexity and tracking issues for the practitioners and for all taxpayers. Under the current rules, these calculations just add to more time. And again, no one wants errors on these returns, and DRS does spend, I believe, a fair amount of time trying to track these errors down. What we're asking for really is an adjustment to be allowed for a bond premium paid on a non-Connecticut muni bond. So as you probably are well aware, non-Connecticut bonds are taxable to Connecticut. But what happens is that if you buy a bond, such a bond, and pay a premium for it, under federal law, you basically amortize that bond over the collection of the interest on that bond. Connecticut, if it's a non-Connecticut bond, again, Connecticut's taxing the full amount of the interest coming through, but is not allowing for any sort of a reduction in that interest for the premium that was paid on that bond, really just a financial calculation. And so right now the law as written only allows that for bond premiums paid if you are in the trade or business of the taxpayer. In other words, a bond trader. Again, that I'm sure the bond traders are happy to have that, but the individuals in the state get stuck with this all the time.
You
And
reached 3 minutes. Please summarize.
Okay, I'll wrap it up there. I'd be happy to entertain any questions.
Thank you. I will kick us off. So I will say personally, one of the reasons that I'm interested in this is some of what you have noted, which is to say that Connecticut's complexity here dealing with this issue, and that we are kind of the exception to the rule, does seem to be sort of causing good faith errors in a fair number of for a fair number of taxpayers. And it's kind of, if we can limit complexity to the extent we're able, I think that's a good thing to do. But could you comment on, apropos of my good co-chair's comment a minute ago, this is everything we do here is about taking resources from one place and maybe putting them in another. Who would if we were to make this change, do you have a sense of who would benefit from it?
I think anybody who is typically investing in muni bonds, that could be just about any taxpayer. Again, I see in my practice based in Newtown, we have taxpayers of all different income levels that invest in muni bonds. In many cases, they're buying muni bonds through mutual funds. What happens is you're basically paying a premium when interest rates require it, and you get basically an unfair treatment as compared to any other bond, including Connecticut. We don't object to the fact that Connecticut taxes non-Connecticut muni bonds, but the fact that you've paid for something that generates more interest by paying a premium basically is an unfair treatment. In the end, it's a hidden penalty for investing in those types of bonds. I think the average taxpayer is hit with this. It's not just the wealthy.
And so do you have any sense of how many taxpayers get caught up in this?
I don't. I mean, I have a small CPA firm based in Newtown. We probably handle about 500 taxpayers' individual returns. I would say that a good 40% of my client base, maybe even 50, will run into this sort of a situation.
Thank you. Any other questions? Seeing none, thanks for being with us.
Appreciate your time today. Thank you.
Thank you.
Next up is Laura Pryor. Online. I think I see her.
Good afternoon. Can you hear me okay?
We can. The floor is yours.
Okay, thank you. Senator Fanfara, Representative Horn, Senator Fazio, Representative Paletta, and members of the Finance, Revenue, and Bonding Committee. On behalf of Connecticut Advanced Practice Registered Nurse Society, thank you for the opportunity to provide testimony on Senate Bill 85, an act authorizing and adjusting bonds of the state and establishing a supplemental graduate student loan program. Connecticut APRN Society is in full support of this bill to provide funding to those wanting to pursue graduate degrees. Federal changes under H.R. 1 impose new caps on graduate loans that fail to reflect the true cost of advanced nursing and healthcare education. Without state action, these changes will restrict access to graduate preparation, weaken our faculty pipeline, and deepen workforce shortages across critical roles. Advanced practice registered nurses are registered nurses who have completed advanced clinical education at the master's or doctoral level and are licensed to diagnose conditions, prescribe medications, and manage patient care. Approximately 70% of graduate nursing students rely on loans to finance their education, and the cost of an APRN graduate program can easily exceed $100,000 depending on the institution. In Connecticut, APRNs practice with full practice authority, meaning they are licensed to practice independently without physician oversight. This autonomy significantly expands access to care within our already strained healthcare system. APRNs fill critical gaps in primary care, serve rural and underserved communities, and are essential contributors to healthcare delivery across the state. With approximately 9,000 APRNs practicing in Connecticut, our healthcare system depends on their expertise and accessibility. If Connecticut does not act to bridge this funding gap and sustain the pipeline of residents pursuing graduate education, the downstream consequences will be significant. Our healthcare workforce is already under strain, and further barriers to advanced education will only exacerbate workforce shortages and limit access to care. I appreciate your leadership and swift action to this urgent issue and respectfully urge your support for this legislation. Thank you.
Thank you. Seeing no questions, thanks for, oh, I'm sorry. Oh, Representative Farrar, excuse me.
Thank you, Madam Chair. Thank you so much, Laura, for being here. I know this has been a very significant topic as well in the Higher Education Employment Advancement Committee. I was hoping, in addition to you making the case as to why this is so essential for our workforce pipeline, I was hoping you could help us understand why there's a real need to act more urgently. My understanding anecdotally is that folks are making school decisions now, and I was curious if you had any other information to that, or why the action on our part in the quickest fashion is necessary for graduate students.
Well, I just think that the gap needs to be filled, as people will not have that support from the federal government anymore. And then it seems that, you know, a lot of the responsibility, financially at least, is being put on the states. So we have heard of people being discouraged from pursuing advanced degrees because of the financial burden that they could experience. And again, these programs they can be very expensive, particularly nurse anesthetist programs, that they are also very expensive. So it is really just about keeping people moving towards healthcare degrees and not making a different decision because they can't afford it, and just creating opportunity. Does that answer your question?
Yes, thank you for that. I think, to your point, just highlighting more fully that these financial implications really do affect someone's decision to continue with a program or to start a program. So thank you so much. And thank you, Madam Chair.
Thank you, Representative Rader.
Thank you, Madam Chair. And thank you, Laura, for your testimony today. Full disclosure, my oldest daughter is studying to be a nurse right now. So I have huge respect and admiration for the profession and for what you're doing, and grateful for your advocacy here today. And I want to ask you a question around the idea of pursuing a higher education, you know, a graduate level nursing degree. And you made a really critical point, is we are at a real dearth for healthcare providers in Connecticut and around the country. And a profession like nursing or APRNs are so vital to our healthcare system. And I'm curious if you see a real strain on the profession right now because there are a lack of APRNs and nurses currently available. And just if you could comment to that, and how you see this being able to support and increase that workforce.
So APRNs have been growing very steadily. I think they've almost doubled in numbers in the last 10 years, and that's projected to continue. And we are seeing some nurses, bedside nurses, leave the bedside and go on for graduate degrees for different reasons. So do I think that the lack of federal loans will cause the pipeline to diminish? It's possible. I think people definitely need to take loans out, and financial health is very important and drives a lot of people's decisions. I would potentially see the number of APRNs going down if they couldn't secure degrees. And that would be unfortunate, because I think the APRNs in general, which again, that's an umbrella term. For those of you who don't know, that includes nurse practitioners, CRNAs, CNSs, and certified nurse midwives. So as a profession, we continue to grow, but we don't know if we're growing because there's financial aid or what drives people's decisions. And we are a critical part of the healthcare team. And I think maybe everyone perhaps in this room has seen an APRN at some time. So, and I think they'll continue to be a very large part of the healthcare workforce.
Thank you so much. Thank you, Madam Chair.
I can't resist tagging onto that point. As somebody who represents a rural area, APRNs are a huge part of the healthcare workforce. And I don't think there's a person in my community who doesn't see an APRN on a regular basis. Any other questions? Seeing none, thank you for being with us today.
Thank you.
Next up, we have Paul Kidwell.
Good afternoon, Representative Horn, Senator Fonfara, members of the committee. My name is Paul Kidwell. I'm here this afternoon representing the Connecticut Hospital Association. Likely unsurprising to all of you, I will be focusing my testimony on the budget and revenue proposals in SB 84 related to the hospital tax. We believe there is a better approach to the tax than what is proposed in SB 84. CHA is eager to work with this committee, the Appropriations Committee, the Governor's Administration, legislative leaders, and members of the General Assembly to adopt an approach that would maximize federal resources to support patient care across Connecticut. This fiscal year, hospitals will pay $820 million in taxes. Of that amount, the state retains a little more than $500 million for its own purposes and uses approximately $300 million to draw down federal matching dollars to support Medicaid payments to hospitals. Under the governor's budget proposal, in state fiscal year 27, the tax will increase by $100 million to $920 million. Waterbury Hospital will become exempt from the tax, but will still be entitled to tax-funded Medicaid payments, and Connecticut Children's will be prohibited from participating in the program. If the provisions of SB 84 were implemented, the state would increase its gain by an extra $53 million. This is in addition to the $500 million it already takes annually. Of the $40 million set aside to support hospitals from the revenue generated from the tax increase, $15 million is designated for Waterbury Hospital, which would no longer pay the tax, and the remaining $25 million would be divided among the remaining 23 tax-paying hospitals. We believe a new perspective is needed on the hospital tax, one that views the tax as a method to maximize federal dollars for patient care and to chip away at the $1.5 billion annual loss that Connecticut hospitals face providing care to Medicaid patients, all while preserving the state's annual share of the existing tax. We think this is a perspective that can be shared and supported by the state and hospitals alike. Going down this path together would mean increasing the value of the tax to leverage the maximum amount of federal revenue available, using all the net proceeds of the increased tax to support patient care delivered by hospitals, ensuring that all hospitals that wish to participate in the tax program can, including Connecticut Children's, and reserving the benefit of the tax to only those hospitals that pay it, securing a 5-year deal with the federal government, and preserving the state's current $500 million share of the tax benefit while not expanding that share. We believe we are at a moment of significant opportunity that may not exist in the future. It is why we believe we should align quickly on a plan that maximizes federal revenue and uses that revenue to support patient care provided by hospitals in the state. I appreciate the time and happy to answer any of your questions.
Thank you. I'm sure there will be many questions. I will try to compact some of mine into 2 questions and limit myself to our own rule. I wanted to first start off with, so whatever plan we come up with, agreement, whatever, has to be approved by CMS.
That's right.
Federal. And so I wonder whether you, based on your own CHA's conversations with CMS, negotiations with CMS, what insight you could provide as to the likelihood of any of these plans being approved, and maybe with particular reference to the status of Waterbury Hospital and Connecticut Children's Hospital.
I appreciate the question. I think it's a really important one, given all of the changes that HR 1 made to the provider tax statute. And there is a great deal of uncertainty related to federal approvals going forward. That said, working with consultants and listening to other state hospital associations, we do think that there is a path to reapproval for our tax program. And specifically, what we are considering, one, would make sure that we're conforming with the new federal rules and that we're putting ourselves in the best position possible to make as few changes as possible. So what we're presenting to the federal government is basically an update to what they have already approved in the past. We think it's important not just to gain that approval, but to gain it over multiple years. I think for both the state and hospitals, understanding what the next 5-year horizon looks like is critically important, so that we're not having to go back to CMS every year wondering Did some policy change? Did a regulation change? Did Congress act? So we think that's a really critical importance. To your question related to Waterbury and Connecticut Children's, it's in the vein of make as few changes as possible. So for Connecticut Children's, what we're considering is they would come in on both sides of the equation. They both would be a taxpayer and a tax beneficiary. The same is not true for the governor's proposal related to Waterbury. They would not be a taxpayer any longer, but would continue to get the benefit of the tax, which would require us to explain to the federal government why we made that change. That creates some vulnerability that we, as an industry, don't think is necessary when what we're trying to do is be as consistent as possible and make the best case to CMS.
And again, with respect to the CMS process, what's your understanding of when, the plan needs to be submitted to CMS to avoid disruptions to hospitals?
We think it's important to get in as quickly as possible. So we think that in the next 1 to 2 months, we need to be seriously talking to CMS about what our plan going forward is. Our settlement with the state expires on June 30th of this year. So for us and for our hospitals, it's very important that we understand what happens on July 1st. This is a critical source of funding for not just the state, but for hospitals in the state. And so we really have been pushing the administration to, as quickly as possible, get to CMS and submit a plan that we think can be approved.
Thank you. Other questions? Senator Fazio.
Thank you, sir, for your testimony. I'll ask you a quick question that I might also ask the subsequent testifier. How much has the net tax increase that has been passed on to the hospitals? So the tax increase minus the reimbursement that the hospitals have seen been enacted since the first increase in 2019.
Yeah. So thanks for the question. So as you know, the history is for many years, the hospitals were net negative on the tax, and that the settlement created a path by which hospitals would become positive under the tax. So it wasn't until fiscal year 2024 that hospitals became positive under the tax. Since then, it has incrementally increased year over year. So this year, in this last year of the settlement, we are net positive by $124 million. We will, over the life of the provider tax, be net negative. The settlement allowed us a path to become net positive. And what we are asking for in the future is that we gain some incremental benefit to chip away from what is an annual $1.5 billion Medicaid deficit.
And to the other question, the main question is, how has that affected costs for your constituent hospitals, and thus the cost of healthcare that they've had to pass on to patients and insurance premiums?
That's right. So every year we face a $1.5 billion Medicaid deficit. We face an equal deficit in Medicare payments. We don't negotiate payments with Medicare or Medicaid. We negotiate payments with commercial payers. That $3 billion deficit must be shifted on to some other place, and it's shifted on to commercial payers through our negotiations. And you'll see, just via the hospital financial status reports over the last couple of years, even with some ability to shift with rising expenses, we are in a net negative position in most places. Our margins are 0.2%, generally our operating margin. That is not a sustainable path to a strong hospital system in our state. So the hospital tax becomes at least a vehicle to help continue to chip away at that. It will not solve the total problem, but it chips away at it.
Thank you, sir. Thank you, Madam Chair.
Thank you. Representative Farrar.
Thank you, Madam Chair. Thanks for being with us. I did want to follow up, especially on this point around the need for a plan submission. My understanding with the governor's proposal is that their office is suggesting a 1-year plan whereas I believe the association is suggesting multi-year. Can you help us understand why the multi-year is important from your perspective, especially given there's so many potential changes that certainly could occur over the next few years?
We think actually that is the reason for a multi-year plan, because we do have some uncertainty. So what the federal government is requiring over the next 5 years, or starting in 2028 and then pushing out, is that there are certain percentages in the federal law that are going to be ratcheted down over time. What we're suggesting is we should just go to the lowest percentage now. We create ourselves some stability over the next couple of years so that we don't get a 1-year deal this year and then we go back to CMS the next and they say, no, we're not doing that anymore because we've decided our policy has changed. The stakes are pretty significantly high for both parties in this agreement. And we think certainty is a really strategic imperative. We think a 1-year deal would make us vulnerable to changes at the federal level that we can't anticipate today.
Thank you for that, and just helping me, and I hope others understand the rationale. So appreciate more background on that. Thank you, Madam Chair.
Thank you. Representative Rader.
Thank you, Madam Chair. And I wrote this one down because I didn't want to forget it. So I'm just going to read it to you. How much state revenue is provided from the state hospital tax today? Because I think it's important for us to all understand that. And how would that amount change under the governor's proposal, if you have it?
Yep.
I don't want, and then to follow that up, when you think about that, how could that affect the quality of care in our state, like a rural hospital or something like that? So just to give everyone a sense of the scale of what we're currently doing.
Large. So today, this fiscal year, hospitals will pay $820 million in taxes. And of that amount, the state cordons off 500 million and says, we're going to use this 500 million for whatever we want. And then we're going to reserve about 300 million and we're going to use that to get federal match and send it back to the state. And we're going to disperse that revenue to the hospitals. Under the governor's proposal, they would increase the tax by 100 million, so to 920 million. But of that additional 100, of the federal return, they're going to keep 53 million. So they're the largest, the state would be the largest beneficiary of the increased tax. And then that reserves about $40 million to divide up among the hospitals. Under the state's plan, of the 40, 15 would go to Waterbury Hospital. And then the remainder would be available to the other 23 taxpaying hospitals. So it's about $1 million per hospital for the next year in context of a $1.5 billion deficit. I think to your point related to quality of care and access, our hospitals are striving to provide the best quality care that they can. And I think it is shown in national grades. We're providing exceptional care in Connecticut, but under significant financial strain. And if we don't sort of rethink the way we proceed with the hospital tax, that financial strain will only grow. And from our perspective, this is an opportunity to sort of rethink this, how we're going to proceed, set it for 5 years, and focus on some of the other financial quality access issues that we want to focus on. So I appreciate the question. It's a significantly large tax, and it creates, if in our view, not aligned properly with sort of our general goal of access and affordability and quality, will just create additional strain in the coming years.
Thank you for your answer. Sorry, my microphone was not cooperating with me. Thank you, Madam Chair.
Thank you, Representative. Representative Constantine.
Hello, thank you so much for all the information you're giving us. You mentioned earlier the change with the children's and you don't want to mess with CMS and the waiver. Could you explain if there's any contingency plans in case CMS does not approve the waivers?
Yeah, so if CMS were to say you can't have we have one waiver that we require in order for this whole program to work. We believe that so in guidance in November, CMS laid out some early policy related to HR1. And importantly, they acknowledged the existence of the waiver that Connecticut currently relies, right? So that was for us important, that they didn't say, we're not doing the waivers anymore, we're not going to change our regulations. They acknowledged that this waiver exists. We have shown that we can pass that test, and we believe we can pass the test in the future. If CMS were to say no, then we would all have to go back to the drawing board and really assess what is the future of the hospital tax? What is the future of the state's 500 million? What is the future of how these payments are made to hospitals? And so we think our focus today really needs to be on aligning as a state on what we think is an approvable plan, because we know we face a lot of questions at CMS. And so it would require us all coming back to the state and saying, okay, what is the future of the tax look like if we can't get that waiver?
Thank you.
Thank you, Representative. And Ranking Member, Representative Paletta, online.
Thank you, Madam Chair. And one brief question going off of Representative Constantine's question. And I thought she was going to take my question, but it's somewhat similar. Connecticut Children's Hospital, I know we heard you testify last time that they were exempt from the tax. And then I guess we wanted them to participate in it. Could you just shed some light on if that exemption was lifted, what that would mean for the rest of the hospitals that participate in it and what benefit they would get?
Sure. So, so a decision was made years ago that Connecticut Children's would be exempt from the tax, but they would also not then get any of the benefit related to the tax. I think as Connecticut Children's has viewed how the tax program has worked over the last 7 years, they've decided that participation in the tax would be an important for them to do. We support that. To your question related to, well, how does that sort of change the program? It means that Connecticut Children's would be taxed at the same rates as every other hospital on their net patient revenue. And as all hospitals share in the revenue that's returned, they would also be part of the benefit of those tax payments. So for the other hospitals participating, it's a neutral proposition. For Connecticut Children's, it's an important opportunity to help them see some benefit from the tax while being treated exactly like every other tax-paying hospital.
Thank you so much. Yeah, it was a little confusing the first time I heard it because we're hearing an entity say they want to pay the tax, but once you shed some light on it and say that there's a benefit to it, it becomes more clear why they're asking for that. Thank you.
Thank you.
Thank you, Representative. Representative Constantine for the second time.
Thank you, Madam Chair. Kind of continuing from the last couple questions. Could you explain if CMS approval is delayed forever, for weeks, for months, what would happen to your cash flow or hospital cash flow?
So we, depending on how the scenario plays out, right? If the governor's budget as is was approved, we would assume that then the state would then seek new CMS approvals going forward. Again, our testimony is we think there's a better path and we should all work together for that better path. We think the governor's proposal will put us in a worse financial position than we are today. At the end of the settlement, the agreement was that once the settlement expires, it basically goes on autopilot until sometime as something changes. The governor is seeking changes, right? So autopilot is not in the cards any longer. So if the governor's proposal were to pass, again, we would be in a worse financial scenario than we are today. And we think they would seek CMS approval for the new plan.
Thank you. Mr. Co-Chair, Senator Fonfara.
Thank you, Madam Chair. Good afternoon, Paul. Could I just try to create some perspective here for myself, and you can tell me where I'm off.
Sure.
But so the hospitals provide service. Anyone who walks in the door, you're required to do that.
That's right.
Your compensation for that is less than your costs.
Certainly for Medicaid patients, it is.
This process, I won't use the word that I want to use, but this process of being taxed by the state and then reimbursed, compensated somehow by the federal government, that helps, but it doesn't get you to at least zero.
That's right.
So you pass on some or all of that uncompensated cost to the commercial payers.
That's right.
Which has created an untenable situation in many respects. I suspect driving some people out of that market, either becoming self-managed or going on Husky, which continues the cycle. So the state takes 500 million of that federal reimbursement. Is that accurate?
That's right.
I think you've said a few times. And uses it not to lower your costs so that the commercial payers have to pay less, but we use it for other things that manage the government.
That's right.
I'm glad, I don't know how we'll settle this issue yet, but I'm glad that the proposal that you're bringing to us is maximizing or attempting to maximize federal dollars. I thought we should have done that back prior to the settlement, but that wasn't supported. But in the end, that's not the answer, is it?
It's not. It's not the answer. It can't be the total answer. There has to be more.
Yeah, and we as a body, not necessarily this committee, but in general, have a responsibility to recognize that obligation, that if we are going to care for people in Connecticut who don't have insurance through their employment or are unable to obtain a satisfactory insurance, then we have a responsibility to address that, not by shifting those costs and acting as if there are no consequences to that. I find it grossly irresponsible. And this problem will only continue to get worse. I'll just say, and it's not the right form for it, but when we focus care at the back end as opposed to the beginning, that increases costs dramatically. And that's an area that we should all get behind as a way to manage these costs. And I'll just say lastly, Madam Chair, there will be people coming up soon that will argue for their hospital to receive a portion of this, of these resources. And that's additional pressure on this that would not have to be if we were addressing these costs in a more responsible way. You have a chance to respond if you care to.
Senator, I appreciate the comments related to focusing on all of those factors that contribute to someone's health and keeping them healthy so that they're not seeking acute care if they don't need it. But very much align the hospitals in the state related to the hospital tax is an important part of the solution. But if we are successful in working together to align on a plan that makes sense for all of us, we will still continue to face an underpayment in Medicaid. And that will continue to strain hospitals in the state. And so we think this is a really important part of the conversation, but it's not the end of the conversation.
Thank you. Thank you, Madam Chair.
Thank you. Yes, Representative Yacarino.
Thank you, Madam Chair, and thank you for being here, Paul. I don't really have any questions. I do have some comments, though. We went through this back in the past administration as far as the uncertainty for hospital taxes, and I think we need a strong hospital system. I know I live in North Haven. I had cancer a few years ago. Neil was just in St. Ray was terrific to me, but they're the second largest employer, I believe, in the state. And they pay a lot of a lot of income tax rather. But I think we need to be consistent. And at the end of the day, we need a strong healthcare system, strong hospitals. I just think that this administration should look carefully as far as how do we administer the hospital tax and keep our hospitals strong. That's really, it's just something we have to look at, the jobs, the healthcare, and the importance of a strong system. So I don't know if you want to comment.
That very much.
That's all I have to say, Madam Chair.
I think Chris O'Connor from Yale New Haven Health will follow me, and he can talk about their work in the community that they serve. And you're right, we hospitals employ over 100,000 people in this state, and are responsible likely for another 100,000 because of the investments that we make. We think residents of Connecticut demand good quality care from their hospital systems, and that's what we're trying to provide. But we need partners in it because a significant part of the revenue base is state funded, and we can't meet the mission without a strong partnership with the state.
Thank you, and thank you, Madam Chair, and thank you for being here.
Thank you. Seeing no further questions, we will let you get on with your day.
Thank you very much. Appreciate it.
Chris O'Connor. Continuing in a theme, I would assume.
Yeah, I was saying we should have done a panel.
Yes. For anyone else listening, yes.
Too late. So, Madam Chair and members of the committee, it is really a pleasure to be able to, well, I shouldn't say that. I am grateful for the opportunity to speak to Senate Bill 84. I should, though, before I get into Senate Bill, wholly endorse as our submitted written testimony does Laura Pryor's advocacy for the advanced practitioner component that she spoke to so eloquently just a few moments ago. So I'm Chris O'Connor. I'm the Chief Executive Officer of Yale New Haven Health. Yale New Haven Health is the state's largest Medicaid provider and among the largest employers in the state, as it was noted. We employ over 30,000 employees, have 7,500 medical staff members. The system includes hospitals in Bridgeport, Greenwich, New London, and New Haven, as well as numerous other entities that support the continuum and integrated delivery services of the system. As it was stated earlier, our sole mission is to provide care to the communities that we serve. Unlike the portrayal on some of these news shows, we don't differentiate by what insurance you have when you present to us at our emergency departments or in our ambulatory centers. Our commitment to meeting a diverse community need is paramount to us in our mission. As Paul said very eloquently, the state hospitals pay $820 million in tax for this fiscal year. SB 84 will increase that tax by a proposed $100 million, with only 25 million net new dollars coming back to 23 tax-paying hospitals. As Paul said, $50 million is to be directed to the UConn Health Waterbury Hospital acquisition that is transitioning to tax exempt. But of that, and I really want to emphasize, on top of the $500 million that Paul noted of the original tax structure that is pulled out and used for other purposes, it adds another $53 million to that total. On behalf of Yale New Haven Health System, I want to say that we are fully and wholly aligned with the Connecticut Hospital Association and their efforts to maximize the opportunity for Connecticut hospitals. We do that in a unifying way that means there are winners and losers as part of that distribution, but at the end of the day, we stand stronger together. Yale New Haven has about a $430 million shortfall from Medicaid, and it covers only about 56 cents on every dollar.
Please summarize.
On 56 cents on every dollar of Medicaid spending. In addition, we have a $270 million shortfall from Medicare. So this continues to put pressure on our hospital and continues to strain our operations in its current structure. So again, we stand here urging the administration and the legislature to convene, think about an alternative structure than the governor's proposed budget. Thank you for your time.
Thank you. And I just want to note, I especially appreciate the support for CHA, not as a substantive matter, but it'll make the process a lot easier if we are not picked off individually in negotiating individual deals. So thank you.
Fully agree.
Any questions? Seeing no questions, thanks for joining us.
Thank you.
Next up, we have Rhiann Chilton.
Hi, thank you, Senator Fanfara and Representative Horn and members of the committee. My name is Dr. Rhiann Chilton. I'm a licensed psychologist living in New Haven. I'm also a member of the Connecticut Psychological Association. I'm here to respectfully ask the committee to include psychologists in the licensing fee reductions proposed in sections 14 to 28 of Senate Bill 84. So currently, Connecticut has the highest annual licensing fees for psychologists in the entire country at $570 annually. I'm personally currently at the end of my training. I've earned my PhD. I've spent the last year and a half at the VA in West Haven and Yale, specializing in treating individuals with PTSD and substance use disorders. I had planned to obtain a license in Connecticut so that I could set up a private practice, see patients here with PTSD and substance use disorders. But when it came time to make this decision, I was coming out of having spent 6 years in graduate school, making about $25,000 a year on average. And while I've spent the last year and a half during postdoc making a bit more than that, I'm still on a trainee salary, about half of what I can expect to make when I'm fully in the workforce. So the current licensing fee at $570, that's a fee I need to pay on top of the thousands of dollars that I had to come up with for my licensing exam, my study materials, and saving for the cost of setting up a private practice. Connecticut is training top-tier psychologists that have to make a critical decision about where to get licensed while they're still getting paid very little. Despite very much wanting to be licensed in Connecticut, I simply could not justify the cost. And so I got licensed in New York, which was a fraction of the cost, $229 every 3 years, so about $76 a year compared to that $570, where I'll just see patients virtually while I continue to live in Connecticut. This fee is more consistent with what medical doctors tend to pay for their license, despite the fact psychologists get paid much less than medical doctors do. It's an unnecessary barrier, not only to new psychologists coming out of training, but also to psychologists who choose to offer low-cost services so that patients have access, all patients have access to this critical care. Please consider including psychologists in the current proposal. They are currently left out to increase the mental health workforce in Connecticut and make it more sustainable for psychologists to offer affordable services. Thank you so much for your time.
Thank you. Do you have a sense on with respect to your licensing fees, sort of where, and you may have said this, where Connecticut maps out relative to other states?
We are the highest in the country. So New York is $229 every 3 years. Massachusetts is, I think, coming in about the same. It's $270 every 2 years. So comparable states around us are charging around $135, anywhere between $75 and $135 a year, whereas, Connecticut is by far the highest.
Thank you. Representative Rader.
Thank you, Madam Chair. Thank you for being here. I had a quick question for you, and if you don't have the answer, that's absolutely understandable, as I'm kind of putting you on the spot. But in terms of the revenue the state takes in terms of this licensing fee, do you have an understanding of the scale of what is collected right now?
Yes, so there is just under 3,000 psychologists licensed in Connecticut. So I'm not sure the math of that, but somewhere around 1.7 million, I think. Somebody please check that math. So we're expecting though that the lost revenue there would be offset, at least in part, by more psychologists being enticed to get licensed here.
Thank you. Thank you, Madam Chair.
Thank you. Seeing no further questions, thanks for joining us today. Next up, we have a panel of Jason Mancini, Frank Burns, and Rufus Jerome.
Good afternoon, Madam Chair, members of the committee. We're part of a coalition representing more than 1,000 arts, culture, and tourism organizations in the state. My name is Jason Mancini. I'm the Executive Director of Connecticut Humanities. We're a nonprofit, nonpartisan, statewide affiliate of the National Endowment for the Humanities and a principal funder of cultural organizations in the state. I'm here to testify in support of HB 5443 and strongly encourage investment in the state's cultural sector. We are at a crossroads. Our citizens and our cultural organizations are under attack. Without a doubt, food security, healthcare, and housing are urgent priorities, but none of that is fixable without systems of support for civic and cultural infrastructure that uplift our values and cultivate our citizens and our civic health. With few exceptions, public and private funds for arts and humanities is evaporating. For too long, level funding and even reduced funding has been our reality. Libraries and museums feel the cuts acutely. For generations, these institutions have been a bedrock of learning and access in our American democracy. They are spaces of curiosity, knowledge, civic engagement, and understanding. Early last year, the threats from Washington, D.C. were abstract, but since April 2nd, 2025, for us, they became real. DOGE's federal funding terminations have taken a toll on our state, and the resources meant for Connecticut have been redirected towards other partisan projects elsewhere. And to this date, and for the first time in 50 years, we remain unfunded by NEH. In this environment, our cultural organizations are more challenged than ever. We recognize the need for some strategic reorganization and consolidation, even as the same organizations continue to serve as community anchors, small businesses, and tourism destinations. At Connecticut Humanities, we're working to change our business model. And while we pursue private funding, we also need public investment. Our mission is to fund, convene, and advocate for Connecticut's cultural organizations. We prioritize access and accountability and cultivate fertile ground for ideas and creativity for the future. We have a high quality of life in Connecticut, and it is a place for entrepreneurship and innovation, but that doesn't happen by magic. It requires vision, funding, and stewardship. Thank you.
From the arts point of view, the National Association of State Arts Agencies puts the economic impact of the creative sector in Connecticut at $13.9 billion. That's 4% of the GDP. This is larger than transportation, construction, utilities, educational services. It also supports over 53,000 jobs. The Arts and Economic Prosperity Study looks at the economic and cultural impact of the nonprofit cultural sector specifically. They found that a person going out to an event spends on average $30 into the community. That's not at the event. That's like taking taxi, going out to a bar after a show, going out to dinner, per event, per person. We also bring in about 10 million people into our downtowns on a yearly basis. And the nonprofit sector alone supports about 16,600 jobs. And this is a direct economic spend into our community of about $954 million. And again, that's just nonprofits. And then SMU Data Arts just released their Arts Vibrancy Index. Connecticut's usually pretty far down in the numbers because we haven't been funded at a level since our economic crisis in 2008. But we did jump a historic 18 spots from number 18 to number 3, and 6 of our towns and communities made it into the top 100 communities in the country, including New Haven at number 7. This is directly because of the increased COVID recovery funding that went into our sector during this time. So that's the economic impact, and then there's all the social impact. We in our sector increase the direct positive benefits across every indicator of social indicator of health. They bring neighbors together, they decrease polarization, they increase civic engagement, they increase volunteerism, it helps veterans, it reduces recidivism, it reduces crime, it increases pride in place. Like, I could go on. There's ample evidence that this investment is investment in the legacy of Connecticut.
Thank you. I'm Frank Burns. I'm the Executive Director for the Connecticut Tourism Coalition. And I'd like you to think of our 3 sectors a little bit differently. We're the make you feel good and
You've reached the 5 minutes. Please summarize.
All right. And based on everything I've heard so far today, all of you could use some feel-gooding and a little more happiness in your lives. All right. To that end, we are supporting HB 5443, looking for an additional increase in funding. I've sent all of you to the Tourism Economic Report, which many of you back to me and reviewed. In conclusion, we'd like to see the 2 caucuses get together and make this a priority and take it to leadership in the hopes that we can kind of get this done. We've talked about it a long time, and this is the year in which we'd like to see it happen. Thank you.
Thank you. I wonder whether, given, as Rufus just noted, the sort of relatively historic, I don't know what this is, low level of funding in recent years.
That's a good term.
Whether you could give us a few specifics about what that actually feels like for you and what's happening on the ground in terms of the organizations that funding supports.
What we're seeing, what I'm hearing from our members right now is that, business for 2025, the first 9 weeks of the year has been okay. It's not been great. Certainly we've been impacted by what's happening a lot at the federal level. And we feel that if the state would kind of invest more monies in promoting art, culture, and tourism, then we would have an opportunity to kind of bring people into the state and kind of lose our reputation of being the drive-through state. So I think there's opportunities here. The Tourism Economic Report kind of indicated, which I shared with all of you, that, we're an $11 billion business here in Connecticut. We generate $1.5 billion worth of sales and local tax. We employed 125,000 people. And if you didn't have tourism, your property taxes would be $1,058 more than what they currently are for every property in the state. So I think there's lots of good reasons. More importantly, in talking a little bit about what the governor and DEC are always pushing is to get people to come to Connecticut, we need to give them a reason, and part of that is the quality of life. And I think what the 3 of us are selling in our sectors is that kind of thing. All right, if people feel good, all right, they'll come here. One of the interesting things that we heard from the president of the University of New Haven was that he needed arts, culture, and tourism in order to bring in his freshman class. All right, but without that, they're not competitive. He can't compete with the other schools that they compete with. So I hope that answers your question.
Yeah, I think for the nonprofit side of arts and culture thing, there has been staff reductions, reductions in force. Again, like the number, the 53,000 jobs, those numbers are from 2022 because our federal government has killed the Bureau of Economic Analysis report that I rely on to get those numbers. So the answer is what it's doing right now is we don't really have a clear insight, but we have seen several arts organizations announce reductions in force, putting staff on furlough, going to part-time. We've seen reduced programs being put out into our community. Times are really pretty tight because as in the nonprofit world, local philanthropy tends to follow like the failure of federal philanthropy leads to the less state dollars going out, and then that leads also to a reduction in local philanthropy as our community foundations are overexerted trying to answer for health and human services and critical community needs. And the arts tend to get left out, even though I think they're the fifth column of community health. But that's my little drum to beat.
Yeah, we've seen this directly. The loss of staff, the reductions. We're concerned deeply about how communities are not being served as funding evaporates. With funding, we see lots of opportunities to build a cultural infrastructure over the next 10 years as we think about Connecticut 400 in 2036, and that might be a bit of a long run, but this is the kind of investment that we are thinking about. How do we get from here to there? This time will evaporate, and this is our moment and our opportunity to really invest in our future and build this sort of infrastructure, educational, civic, cultural, and so on.
Thank you. Representative Rader.
Thank you, Madam Chair. It's good to see you all. I'm grateful for your advocacy. I'm the product of an arts education and an art educator as a mother. So I have full gratitude for what you do and the advocacy you have here before us. If you could think, Jason, you touched on this a little bit. So if this were to go through and the revenue was there for you, have you been smart about a strategic plan of what this would look like? And Frank, you touched on the educational piece, because I think is really important for all those listening and paying attention to this, is the educational impact that your work and the work of arts have on our youngest people in our community and state to our oldest, but and how I really want to make sure we reinforce that. But I'm just curious, pie in the sky, this all works out. What do you see that looking like? Because I think it's important to know that.
I think for us, we've already begun to adapt our operating model. Sorry, for us, we've already begun to adapt our operating model, thinking about mergers and acquisitions and how we can consolidate some resources. But in terms of where we begin to focus our energy, we're thinking a little bit more like a community foundation, a community cultural foundation, if you will, with impact areas around capacity, sustainability, and resilience. So we're already building this into the work that we're doing and the support and the professional development that these small organizations need to run as healthy, strong businesses in our communities so that they can become anchor organizations. We're focused on the intersections of education, where we provide these resources around Connecticut's history and culture in our communities, schools and libraries. We think a lot about civic and community learning, as well as community vibrancy. So Rufus mentioned our main streets, our downtowns, our cultural districts. These are all part of the economic and cultural vibrancy that we imagine is deeply centering the quality of life that we all really know and love in Connecticut.
From my conversations with the Office of Tourism, if we were to receive additional monies, a couple of things we'd like to see happen. One, obviously, we'd like to kind of reach out and go into markets that we're currently not in. For example, Philadelphia, Albany. We used to talk about going into Canada, but given what's happened with all that, that's not a viable market anymore. The second thing, and to your point, is from an educational standpoint, we've talked about workforce development and how important that is, not only for the hospitality, but also for the arts and culture standpoint. So we think that that's kind of critical. And then lastly, from the tourism side, we don't have a presence out there in the real world. And I'll give you an example. It's a month ago, the American Bus Association met in Lake Tahoe, and every New England state was there except for Connecticut. We had no presence. Obviously, bus tours are coming in and out of here all the time, but we're forcing them to do it to kind of drive through. And there have been other trade association meetings where, again, we just don't have the funding to send anybody. And it's critical that we do if we're going to, again, remain competitive. We're looking at the other New England states is spending, and they're outspending us. Rhode Island 7 years ago was ranked last in the country at 700,000. They're spending at $7.5 million. Even Vermont, it's got a budget of $6 billion. It's going to spend $14 million this year. All right. And they're kind of eating their lunch. They're driving people there when they should be coming here because we're the best kept secret on the East Coast. All right. And we kind of want to change that. Again, I want you to look at us as being the happy, good feel pieces of the budget. All right. And, that's kind of what we want to do. And that's why we're here. And that's why we're asking to support 5443. Got the caucus together. Let's make an issue. Let's get this done and let's start talking about it. Okay. Thank you.
Thank you. Thank you, Madam Chair.
Thank you, Representative. Any more questions for the panel? Seeing none, thank you again.
Thank you all. Appreciate it.
Next, we are going to call Rob Roos, who I believe is in the room.
Thank you, Madam Chair, and appreciate the opportunity to submit testimony on Senate Bill 84, an act concerning the revenue items to implement the governor's budget. I am Dr. Rob Roos. I'm the president of our community hospitals for Trinity Health of New England, which includes St. Mary's Hospital in Waterbury, Connecticut, and Johnson Memorial Hospital in Stafford Springs, Connecticut, as well as our mobile healthcare organization and emergency medical services. I'm joined here by Dan Keenan, our Senior Vice President for Government Relations and Advocacy as well. I did want to state that Trinity Health of New England is eager to continue working with members of this committee, the governor's administration, legislative leaders, and members of our General Assembly to adopt an approach to the hospital tax program that would indeed maximize the federal resources to support patient care across Connecticut. That's important. We do oppose, however, provisions of the proposed budget related to the hospital tax as it is drafted. Trinity Health of New England is a significant provider of healthcare services in Connecticut, including St. Francis Hospital and Medical Center and Mount Sinai Rehabilitation Hospital in Hartford, St. Mary's Hospital in Waterbury, Johnson Memorial Hospital in Stafford. And we also have a clinically integrated network, physician practices, home health, and post-acute services. We are comprised of nearly 9,000 healthcare providers committed to the communities that we serve. Trinity Health of New England is unique in that St. Mary's Hospital and St. Francis Hospital have among the most challenging payer mix in the state and are two of only 4 hospitals with more than 30% of the patients that are served covered by Medicaid or without any coverage. We are truly a safety net for the communities we serve, and we bear a disproportionate share of the financial challenges of the inadequate reimbursement from Medicaid and Medicare that was discussed earlier. The financial performance that results from having a disproportionate burden of Medicaid patients and also inadequate commercial rate reimbursements has left Trinity Health of New England with significant operating losses, and it puts an enormous strain on our ability to ensure access to care. These challenges are compounded by a hospital tax system that has not strengthened, but rather significantly weakened safety net providers like St. Mary's Hospital and St. Francis. To that point, in the state's fiscal year 24, Trinity Health of New England hospitals paid in approximately $86 million in hospital taxes and received approximately $48 million back in supplemental payments, a deficit of more than $38 million. These supplemental payments returned only 56% of the taxes paid to our hospitals.
You've reached 3 minutes. Please summarize.
Compared to the average hospital receiving approximately 67%. And so this creates a unique and unexplainable structure for a hospital system like St. Mary's and St. Francis that are serving the most vulnerable. So we believe a new perspective is needed, one that views the tax certainly as a mechanism to maximize federal dollars, but also one that can preserve and support safety net hospitals like St. Mary's and St. Francis. We appreciate the interest and the support of our policymakers in helping us create a stronger healthcare system.
Thank you. Representative Paletta online has a question.
Thank you so much for that testimony. And I know that when we spoke in person, there certainly is little bit of concern now that the state and UConn have teamed up with Waterbury Hospital. I've no secret supported that. I thought it was a great deal for the city. But with that being said, we have to keep in mind that St. Mary's also needs attention, especially in terms of the reimbursement. I was wondering if you could just shed a little bit of light on what that might mean. One, because of the state takeover of UConn, of Waterbury Hospital now combined with UConn. But two, what it could mean if St. Mary's can't keep up, because again, I'm being told, and I think I'm correct in saying that Waterbury cannot sustain with just one hospital.
Thank you, Representative. And I think the important point is that the two hospitals in the city of Waterbury are treated equitably. We serve the same population of residents, the very similar payer mix, and suffer from the same types of challenges. And so there are ideas and opportunities for us to look at that to ensure that there's a level playing field. The hospital tax program, however, as was articulated earlier by some of the other testifiers, does not do that. It specifically actually calls out Waterbury Hospital to no longer to be exempt from the tax, but to continue to receive supplemental payments. And so that would create an unequal playing field. There are opportunities and ideas in how we could restructure the tax program instead to provide supplemental payments to those hospitals like Waterbury Hospital and St. Mary's alike that do serve a disproportionate portion of Medicaid patients with an increased amount of supplemental payments. And that would be one avenue to help ensure that both hospitals are sustainable into the future.
Thank you. And I agree 100% that we need to be sure that we're cognizant of the fact that while we've done some good things at Waterbury Hospital, we need to make sure that St. Mary's can be sustainable so that way the people of Greater Waterbury can receive access to great health care. So thank you so much for your testimony.
Representative Napoli.
Thank you, Madam Chair. Dr. Roos, thank you so much for being here and thank you for your testimony. Can you speak to the percentage of Medicaid patients that the hospital sees compared to other hospitals around Connecticut?
Absolutely. Specifically in regards to St. Mary's Hospital, St. Mary's is one of three hospitals that serve the largest proportion of Medicaid patients in the entire state, along with Waterbury Hospital and Connecticut Children's. And so of acute care hospitals that are serving an adult population, St. Mary's and Waterbury Hospital serve the highest proportion of Medicaid patients, which is in excess of 22% of Medicaid and approaching over 30% when including Medicaid and uninsured patients.
Great, thank you. And certainly, thank you for being here to testify on these important issues. The greater Waterbury community certainly does need two hospitals. St. Mary's has a strong history of serving the Waterbury community, and we are grateful for your efforts and those who work there. Thanks.
Thank you. Proud to serve.
Thank you, Madam Chair.
Thank you, Representative. Seeing no further, excuse me, Mr. Co-Chair, Senator Tom.
No, I was a late entrance into this. Thank you. Your testimony is clear, I think, with respect to the proposal that's in the governor's budget, but you heard testimony regarding CHA's approach. Are you supportive of that? Do you have another view than what CHA is offering?
We believe that we are supportive of many elements of that, specifically including ensuring that we maximize the value from the federal revenue, specifically ensuring that all of the net proceeds go back to support patient care, securing a 5-year deal. But we do believe that safety net hospitals should be considered in a way that would help support their sustainability for the long term.
Which you don't believe the CHA proposal does right now?
There are some opportunities, I think, to look at how that distribution is calculated to best serve all the hospitals, including safety net providers in Connecticut.
Thank you. Thank you, Madam Chair.
Thank you, Senator. Now actually seeing no further questions. Thank you for joining us.
Thank you.
Next up, we have Carmen Lanche. No. Okay. Kebra Smith Bolden. Yes.
Hello.
Welcome.
Thank you. Good afternoon. Thank you to the chairs, Senator Fanfara and Representative Horn, vice chairs, ranking members, and all of the members of the Finance, Revenue, and Bonding Committee. My name is Kebra Smith Bolden. I am a registered nurse, longtime cannabis advocate, and the founder and owner of Lit New Haven, a licensed adult use cannabis dispensary in New Haven, and I am testifying in support of HB 5109. For more than a decade, I have advocated for safe and responsible cannabis access in Connecticut. Today, I am speaking not just as a business owner, but as someone deeply committed to community health, economic opportunity, and building a regulated cannabis marketplace that actually works for customers. Connecticut worked hard to build a legal cannabis industry. Legalization was meant to bring customers into a safe, regulated market, create legitimate businesses and jobs, and repair some of the harms caused by prohibition. But right now, our tax structure is making that mission harder to achieve. Connecticut currently uses a potency-based tax system, and depending on the product, consumers can pay up to 35% in taxes. That creates several problems. First, our prices become significantly higher than neighboring states. As a result, Connecticut is losing an estimated $150 million to $160 million in potential legal market revenue to surrounding states, where consumers can purchase the same products at lower prices. Second, the potency-based tax structure is just way too confusing for customers. Many customers do not understand why the same product category can have very different tax amounts depending on potency levels. Moving to a flat tax rate of 10.65%, consistent with Massachusetts, would make cannabis taxes simpler, clearer, and more predictable for customers. Customers would better understand the process, and that will help to build trust. From an operational standpoint, the current system is extremely burdensome. Licensed operators already have to navigate one of the most highly regulated industries in the state, and the person hours required to calculate these taxes adds unnecessary complexity. And God forbid you make a mistake with the input, it can be really a huge burden to a business. Lowering and simplifying the tax structure will help Connecticut retailers compete and bring more customers into the regulated market and ultimately increase both sales and tax revenue for the state. And beyond economics, this is also about community impact. Businesses like mine hire locally, invest in our neighborhoods, and operate within a transparent, regulated system where products are tested, tracked, and sold responsibly. When the regulated market is able to compete, everyone benefits businesses, consumers, and the state of Connecticut. If we want Connecticut's regulated cannabis market to succeed, we have to make sure it can actually compete. Thank you for the opportunity to speak today.
Thank you for being here. I wondered so we did get a little testimony on this proposal. I get the overall business, we have committed to having a cannabis industry, and this seems to be counterproductive. But
Yeah.
we did get a little bit of testimony, just noting the fact that some of the high potency cannabis products are increasingly tied to some significant health risks. And I wonder how you see that issue, whether that should impact our decision on taxes.
I'm so glad that you brought that up, because I actually was in the hearing, and I was followed by a doctor who represented a mental health focused hospital, and the testimony was around youth. And the first thing I'd like to say is that what we have here is an adult use program. We do not serve to minors, as a matter of fact, because of the highly regulated oversight that we receive. No one can even come into our dispensaries that do not have proof of age and are over 21. Secondly, most of the products that they are speaking of, again, so if someone's underage and purchasing a product outside of a regulated dispensary, retail cannabis retailer, then we're going to be getting products that aren't safe, that aren't tested, that aren't regulated. So increase or decreasing the tax and making it more clearer will give consumers the ability to purchase from a licensed establishment where the products are tested and where we will not be serving minors, and that we'll be able to pretty much guarantee that these are healthy, clean products to consume, and reduce the issues that we have when we have people purchasing in an unregulated market just because they can't afford it.
Thank you. Representative Paletta.
Good afternoon, Kebra. Thank you for being here. I just have a quick question for you in terms of the taxing structure here. So I was wondering if very briefly, I do realize we have a long day. If you could just talk about what the other states are doing and how perhaps going to a flat tax might actually help our small businesses and some of our local business owners, because, as Chair Horn said, we did pass the cannabis bill a few years back. We are taxing on potency, and perhaps while in the very short future we may see a revenue loss, long term we may see revenue gain if folks are leaving the state because of our higher taxes.
Absolutely. One of my colleagues actually did research to show that, as I said in my testimony, about $150 to $160 million of cannabis revenue is leaving the state and going to Massachusetts. In addition to having a plethora of products, they also have the reduced flat tax rate. So this would allow us to be more competitive. This will give consumers one less reason to go across the state lines and purchase elsewhere. And again, to really make it more simple for consumers. Like, one of the things that this is a very new industry and a pretty controversial product that we're selling in cannabis, and we're having to educate our consumers and really help them understand. And this adds a layer of confusion for them to not really be able to understand exactly why they're being charged more. If the science and all those other things don't kind of add up, and I think this will help us to begin to build that trust with local consumers. And for our, previously it was testified, we had the tourism department testifying. I mean, I do believe that this will help with, again, being able to attract tourists here and make it so that they want to purchase, as opposed to saying, "I will just wait till we get to Mass."
Thank you. I appreciate that. I'm certainly looking, eager to learn more about this topic, especially when it relates to the taxing component of it, because so many times on this committee we talk about how Connecticut is unfairly taxing certain items or things, and perhaps we lose business to other states. So definitely looking forward to continuing the conversation. Thank you, Madam Chair.
Thank you.
Thank you, Representative. Senator Fonfara.
Thank you, Madam Chair. Kebra, good to see you. I hear the testimony about competitiveness with other states. My interest has always been how the regulated market is competing with the unregulated market in Connecticut.
Mm-hmm.
You have any information on that?
Well, not really statistics, but I can share practical,
Sure.
experience that I've had, in that people want to know what we have an adult use market. Adults want to know what they're putting in their bodies. They want to know how to consume it. They want to be educated. When they are purchasing from the unregulated market, they're not getting that level of transparency necessarily about the products and the education to go along with it, because people don't really know what they're selling oftentimes in the unregulated market. So, with the ability to attract people to purchase from adult use retailers, is really affording us the opportunity to retain customers, to build customer trust, but most importantly, to have the ability to educate our consumers and welcome them into the regulated market. I don't think that, it's a us and them kind of situation. But I do believe that if you offer people an educated option, an option that is healthier and safer and affordable, where the taxation comes in, then they will choose the product that they feel is safer, that and being sold by people that they trust, with transparency and everything from pricing to seed to sale information.
I appreciate that. My question though is maybe more directly, how much of the unregulated market continues to operate, if you have a sense of that?
Oh, it operates very strongly, especially, I live it every day in New Haven. We have smoke shops still appearing on almost every corner, and many of them are carrying unregulated products. And because of the fact that they don't have the overhead and the responsibilities that we have, they are able to have their, prices much lower. And of course, they aren't paying taxes to the state. So, they are remaining a viable option until we are able to make purchasing from a regulated retailer more streamlined.
I probably could go on for quite a while on this, Madam Chair. I won't, given the day, the time, and the number of people to come along, but I think it's a real issue of how no question you need oversight, but when you're competing against a market where somebody says, I've had these customers for 10 years and I deliver directly to their home and I don't have to pay taxes on this, that's a hurdle that's real. And wondering how well the regulated market can adapt to that competitiveness. Thank you, Madam
Well,
Chair.
and I can use my business as an example. I hired the people who were working in the unregulated market, the local street pharmacists now work in my dispensary and are being able to engage in the regulated market. And so taking those skills that they learned and translating them to our new industry. And I believe that's a great, that's a great thing to be able to bring it full circle. And so for us to have social equity licensed operations that are viable and able to continue to encourage people from the unregulated market into the regulated market, giving them certificates, saying that they are part of this industry has been really transformative for a lot of them. And they appreciate the ability to engage in the legal market.
Thank you, Senator. Representative Winter.
Thank you, Madam Chair. Thanks for being with us and thanks for your testimony. I wanted to
Sure.
ask about if you can summarize how customers, do they perceive the potency-based tax currently? Is it labeled in some way, or is it what's the experience like for the customer with the current tax system?
Sure. Our receipt prints out our 3 different taxes. So our local tax, our state tax, and our potency tax. And a customer can purchase something, the same size or amount, so 3.5 grams of cannabis, and it'll be 2 different products. So one potency may be higher and another would be lower. And they're like, well, why the last time I purchased something that cost the exact same amount, I had to pay about 30% in taxes, but this one is 20% in taxes. And people who are paying attention, they rightfully should. We want consumers to be knowledgeable and know what they're purchasing. But, it's very confusing to even have to translate that to them and help them do the math and kind of figure it out and make sure that we're charging them accurately. So it's extremely confusing, but it is written out. And when people ask, we have to like do a whole algebra lesson.
Thank you. Thank you, Madam Chair.
Very good. Any other questions? Seeing none, thank you.
Oh, can I just also add, I just want to support the testimony that was brought forth earlier by the Connecticut Advanced Practice Registered Nurses Association. And I'm a real live example. I was in school pursuing my advanced degree, and my federal funding was cut off abruptly, and I was unable to continue moving forward with the program. And a person like me with community visibility and impact could make an extreme impact as an advanced practice registered nurse. And so it's affecting people who can really make a difference in communities. So I am in complete support of the provision that they're working towards.
Thank you. Thank you very much.
Thank you.
No other questions? Ben Zacks?
Hello. Chairman Fonfara, Madam Chair Horn, Ranking Members Fazio and Paletta, and the members of the Finance, Revenue, and Bonding Committee. Thanks for the opportunity to testify in support of House Bill 5109, which Keeper just spoke about. I'm Ben Zacks. I'm the Chief Operating Officer of Fine Fettle. We are from Connecticut, based in Connecticut. We have 175 employees in the state across 9 dispensaries, as well as a cultivation facility and a DIA. We've invested $35 million in capital investments since 2023, when recreational cannabis started. We've created tens of millions of tax revenue, and in many of the towns in which we operate, we are the single highest taxpayer in those municipalities. And we're proud of what we're building safely in Connecticut. Additionally, I have a store right over the border in West Springfield, Massachusetts, so I know a piece of this quite intimately between the two states. And as noted previously, I believe that the tax issue in Connecticut is a major hindrance that is holding back the success of the legal market, thus propping up the illegal market, as well as our neighboring states. Additionally, it's an operational burden and nightmare. We spend about 10 hours a month computing the tax, and for every discrepancy that comes through on the potency with DRS, it's about another 30 minutes to an hour. And so for us, for nine stores, this can be cumbersome. It's gotten better, and I do wish DRS was testifying on the pain that this can cause just operationally for state employees as well as our team. Customers also can't completely comprehend the tax because we have products that have the same name with different testing. The exact same seeming product can have totally different cost structures, which creates a lack of trust in the market that is supposed to be trusted. And it's incredibly difficult for us to then compete on any level of scale. We think that simplifying the tax structure in this state can help us against our neighboring states. It can help us against the illegal market, and it can grow jobs, investment in Connecticut, which the cannabis industry has not seen like was expected at the beginning of recreational cannabis. And so we do, hope you support this bill with one minor change, going from 10.75 to 10.65 in the excise tax, so that we can match our neighbors in Massachusetts. Thank you for the time and, for this work. And we need this to be safe. We need it to come through us, and this can help get there. Thank you.
Thank you. Representative Luxembourg.
Thank you, Mr. Chair, and thank you for your thoughtful testimony. I know you've got a store in my hometown of Manchester, and West Springfield is, which you referenced in your thoughtful testimony, is only 20 minutes away. I'm wondering maybe if you could give me a little insight about the competitive advantage and disadvantage of Massachusetts to Connecticut, because you might be in a unique position to advise the committee on that, because it's only a 20-minute drive to West Springfield from Manchester, and you've got stores in both. Do you see, and I guess what I'm really looking for specifically is, do you see people in the greater Manchester, Enfield, that part of the state like shopping at your Massachusetts outfit as opposed to your Manchester outfit because of that competitive difference in tax structure.
Yeah, because today's the first day of the Big East tournament, I guess I'll say that that's a layup for folks from Enfield and Manchester. We see people from West Springfield to West Springfield coming from all over the state. About a quarter of our business in West Springfield are Connecticut residents. And so that's substantial. And we're just one store right on the border. There's about 30 stores in Massachusetts that are right on the Connecticut border, whether you're going off of a highway or not. And, you know, at the beginning of recreational, we had huge pricing disparity between Connecticut and Massachusetts. And now we've seen more investment, we've seen more operators, there's more cultivators, there's more products. We're still not fully there with pricing parity, but when we have tax, that can be 15% higher on a relative cost basis. It's just an additional reason to go. You know, it's worth the gas money. It's getting less worth the gas money, I guess, how oil prices are going, but it's worth the gas money to go up to make a purchase and essentially break federal law and come back down. And so we see that from across Connecticut. And it's not just our store, it's a lot of other stores. And that's been the case. When folks were, and a lot of the data, you know, the two biggest stores in all of Massachusetts from basically 2020 to 2025, when this data was more readily available per store, were on the New Hampshire border and the Connecticut border. And then the Connecticut border generally represented like 5 to 10 of those next highest stores. And, you know, everything that creates price parity is going to do that. And we think the cannabis tax as structured does that now. You know, and again, that's just one side of it. I think Chairman Fonfara, you asked a really good question before to Kibra about, you know, what about the illegal market? And I don't know exactly how their facilities are built, but I doubt as many cameras. I doubt as much regulatory oversight as we have. And candidly, we have a store right off the Route 7 connector in Norwalk. And when you come into Norwalk, there's a store that's been shut down 3 times right down the road from us selling illegal products. Well, they just opened. It's a cost. That's their cost of doing business. And so if we can do things that, again, help create and lower that price parity and ensure that people understand, and honestly, people do things with their wallet at the end of the day, if they can, you know, see the benefit of and not have to pay significantly more, you know, it makes us more available, which makes us safer, which limits kids from having availability and access because of our packaging, because this is not a liquor store. No, a kid's not allowed in our building. It's not like, hey, you can walk with your parent and go check it out. And so all of these things we think compound to help do all of the good that legalizing is supposed to do, even if there are, you know, questions and problems with our industry as a whole. If the toothpaste is out of the tube, we might as well make sure the toothpaste is good.
Thank you, Mr. Chair. All set.
Thank you. Anyone else? See no one online. Ben, short question, short answer.
I'll try.
This train, when we passed this, it wasn't the traditional way in which we do things here. It didn't come through the finance committee where we said, here's what the tax will be. This was decided separately as part of a package. What was the thought process of not even so much the issue of potency, but just recognizing what our border states are doing, and it's not it's an issue that is being played out in other areas here in this building this year. So I don't know if you have any insight into this as to, you know, was there any consideration given to your ability to compete from a tax perspective?
I don't think that was in the original consideration. I think the concept was prices are going to come down. And if we have a piece of the tax about potency, as prices come down, we can actually keep the tax revenue that's sort of expected at the beginning. And so I think it was an idea to sort of normalize the growth curve and also sort of keep a flat expectation in a budget of what cannabis tax would bring into the state. That's the conversations that were had there. I like to joke, my very good friend, Representative Ritigliano, who I think sits on this committee as well as general law, would have better comment there because he's been seeing that. And he actually questioned the tax structure up front, even as this was going on. And so, I think that that's probably a question for them of how they were thinking about the budget scenario over time. Originally, I will say New York did also have a potency tax. They legalized at the same time as Connecticut, and they did away with theirs about a year into the program and built a flatter tax. They actually came in even lower. But I think that was sort of the concept, and seeing other states change it and seeing Connecticut, potentially doing so, we think is a good thing, and we think it sort of does better overall around safety, the competitive nature, et cetera.
I just say I'm not surprised that you folks are back here now, because I get it, the drive to get legalization for so many years, the challenges of that you sort of look the other way on somebody saying, here's the kind of revenue we want to get from something that hasn't even started yet. If that isn't Connecticut, I don't know what is. But anyway, that'll be another conversation. But thank you, Ben. Appreciate it.
Thank you all.
John Heath.
Co-chairs Fanfara and Horn, vice chairs Cabrera, Miller, Constantine, and Rader, members of the Finance, Revenue, and Bonding Committee. Thank you for the opportunity to speak with you today in opposition of certain provisions of House Bill 5443. My name is John A. Heath, a Connecticut native, and I grew up in Hartford like the chairman. I am the Senior Manager of Government and Community Relations for Turo, the world's leader in peer-to-peer car sharing. Sections 1 and 2 of HB 5443 in new subparagraphs G2 impose a 3% tax increase on Connecticut residents by subjecting peer-to-peer car sharing to the same tax level as big rental. Many of you are students of history, and as we prepare to celebrate the nation's 250th birthday, it was unfair taxation that sparked the flame of independence. The British government tried to gain revenue without factoring the impact on those in the colonies. And so we rise in opposition to the language in sections 1 and 2 for several reasons. First of all, Connecticut residents who share on peer-to-peer car sharing platforms are already required to pay sales tax when they purchase vehicles, whereas big rental have a huge tax exemption to the tune of about $88.7 million that the state does not receive. Secondly, Connecticut residents also pay property tax, and unlike rental car companies, they have no ability to avoid paying that tax. By increasing taxes on peer-to-peer, it negatively impacts constituents who are already struggling with high costs and certainly the cost of living crisis that we're dealing with, or many in Connecticut are dealing with. And then lastly, according to a study commissioned by Enterprise Rental Car itself, it determined that raising taxes on car sharing and car rentals has a significant negative impact on low-income communities and certainly communities of color minority households. And so at the end of the day, this legislation furthers an unfair tax advantage for large corporations while burdening Connecticut residents. Thank you for the opportunity to testify. And I also have a colleague, Aaron Smith Bennett, who is joining me, our Ledge Counsel, virtually for any questions you may have.
Well, could you tell us, you just heard the testimony about cannabis and its abilities or inabilities to compete fairly. How does the tax structure, or one that is suggested here to be imposed on your company, advantage you or disadvantage you vis-a-vis how we're taxing larger rental companies?
Sure. So the difference, Mr. Chair, is that When that tax is assessed, it's not on us as a company. We don't pass it off on, or at least our attempt is not to pass it on to the consumer or the host. The hosts are the one that pay that sales tax on that vehicle when they purchase it. Whereas Big Rental does not pay tax on cars that they purchase. And so when this NCOIL model bill was developed, and then when we passed it here, colleagues around the country, insurance legislators, looked at this along with members of the industry, and they came with that tiered system. Since Big Rental was receiving this tremendous advantage of tax exemption, then for those in peer-to-peer, since they pay that tax up front, would then be taxed at the lower rate.
Thank you. Questions? Thank you very much.
Thank you, sir.
Mary Ann Mahoney.
Good afternoon, Senator Fonfara, Representative Horn, Senator Fazio, Representative Paletta, Senator Cabrera, Representative Miller, and other esteemed members of the Finance, Revenue, and Bonding Committee. Thank you for the opportunity to express my support for HB 5443 that would provide 0.5% of the existing meals tax to the Tourism Fund and thus provide support to Connecticut Humanities and similar organizations in Connecticut. And I hope my testimony answers one of the questions that the committee had about some of the on-the-ground things that Connecticut Humanities does. My name is Mary Ann Mahoney. I live in Canton, Connecticut, and as the director of the Latin American, Latino, and Caribbean Center at Central Connecticut State University, I've been the project director on 6 small grants from Connecticut Humanities. I'm here today with Melody Lozano, who is also registered, but we're going to do a panel together to save your time. Anyway, I cannot emphasize enough how important Connecticut Humanities support has been for the LALCC and our programs. CCSU's LALCC is an academic and cultural center that promotes the understanding and the appreciation of Latin American and Caribbean societies and of Latinos in the United States. Each year, we organize programs related to our mission and of import to the Connecticut public. Recently, with Connecticut Humanities support, these programs have included the role of Latino literature and poetry in American history and Latino art identity through art. For these programs, we've worked with the New Britain Public Library, the New Britain Museum of American Art, and the Spanish community of Wallingford. Visitors and speakers at Connecticut Humanities-sponsored events have donated books and important pieces of art to the LALCC that would have been otherwise difficult to acquire. We're now planning a program on the history of U.S. citizenship and immigration law as it relates to Latin American, Latino, and Caribbean communities. Each year, between 15 and 20 paid student interns help to organize our programs and apply skills from their majors to tasks such as design, budgeting, library management, preparing our newsletter, and staffing conferences. And some of you may have been the recipients of our emails. Our success in Connecticut Humanities peer review competition has earned us respect statewide. This contributed in 2023 to the appointment of a full-time administrative trainee for the center, Melody Lozano, a 2023 magna cum laude CCSU graduate of Peruvian descent. Receiving Connecticut Humanities grants has allowed me to train Ms. Lozano and our more experienced undergraduate interns in grants management. She'll talk more about that. Connecticut Humanities funding has been a catalyst for all of these positive developments, and I urge you to pass HB 5443. Thank you.
Good afternoon, everyone. My name is Melody Lozano. I'm a resident of South Windsor, Connecticut, and I am proud to add that I'm the first person in my family to graduate from college. I'm currently employed as the coordinator of the Latin American, Latino, and Caribbean Center, LALCC for short, at Central. Connecticut Humanities support has been vital not only to the LALCC, but also to the broader Connecticut public we serve. Their funding has allowed us to present programs that tell a fuller and complete Connecticut story for all residents. Through 3 quick grants from Connecticut Humanities, we have been able to organize and offer a range of public humanities programs that connect communities across the state with Latin American, Latino, and Caribbean history and culture, and welcome guest speakers from across the country who have shared their expertise and research with our community. Working on these projects has also played a significant role in my own career development. When I graduated from Central, I was unsure how to move forward professionally or which, if any, master's degree I wanted to pursue. I participate in brainstorming project ideas that connect the Connecticut public with humanities topics in Latin American, Latino, and Caribbean studies. In addition to helping generate these ideas, I assist in shaping them into competitive grant applications. Through this work, I have gained hands-on experience in grant writing and grant administration. I also help coordinate public events and complete final reports that reflect on the impact and implementation of each grant-funded project. Because of these experiences, Connecticut Humanities funding has played a meaningful role in my decision to pursue graduate studies and a career in public history. Today, with the skills and experience I have gained through this work, I'm eager and will be prepared to continue serving the state of Connecticut when I complete my master's degree in 2027. I urge you all to pass this bill so that Connecticut Humanities can continue its work and allow more young people like me to have these experiences. Thank you.
Thank you. Senator Honig.
Thank you, Mr. Chair. A question for Mary Ann. Nice to see you here. Appreciate all that you're doing for Connecticut students. Could you, I guess, talk a little bit about your background and tell me like how many students are impacted by these types of programs?
Okay, so as people will probably gather, my background is not Latino. I was raised as an Irish Catholic in Massachusetts. Yeah, but I moved to Connecticut to get a PhD in Latin American history at Yale, and I've now lived longer in Connecticut than I have elsewhere. And Dr. Toro asked me to take over the direction of the center here, and we have done something that I think is exceptional across the country. Most centers like ours are either based on research or student support, but we've been trying to do both by engaging students to participate in developing public programs that both help the students find their calling, and so we hire work study students, we get grants, and if we're able to, we use the grant money, not the Connecticut Humanities money, to fund them, and then we use Connecticut Humanities funding and other funding we've been able to obtain to bring nationally recognized scholars in that the students then get to meet and help to coordinate the programs. And most recently, that involved bringing the couple based in Texas, Gilberto Cardenas and Dolores Garcia, who are the owners of the largest single collection of Latino art in private hands in the world, to campus. And they've given us 17 pieces of art. And in October, we're going to be hosting a public exhibit here on campus with the art that they've donated. And so it's going to be open to the entire public. So not only the 15 or 20 students who work in the center while they're here, but everybody on campus and the entire region, and you're all welcome to come. So thank you for the question, Senator Honig, and thanks for being here, everyone.
Thank you, Mary Ann. Thank you, Mr. Chair.
Thank you. And if I want to take a moment to tell the committee about Dr. Toro, who heads up Central, came from a family of lawyers, decided to become an engineer, and went on from that to be the dean of engineering. I'm forgetting the school, a college in the Midwest. And at that school, she established a program where her students would go into the local high school to teach children, particularly Latino children, about engineering, math, etc. And she's done that here in New Britain as well in her role as the head of Central, a really dynamic person who is exposing communities that otherwise would not be, historically are not, opportunities. And she's, in my view, a real unsung hero. And I'm glad that some of her work is ending up here today. So thank you both very much for your testimony.
Thank you.
Thank you.
Next up is Leland McKenna. I'm going to press the button in front of you there.
Good afternoon, and thank you to members of the committee. I am pleased to be able to give this testimony on behalf of Middlesex Health. My name is Leland McKenna. I'm the Vice President of Planning at Middlesex Health. Middlesex Health is a independent hospital in Middletown, Connecticut, primarily serving residents of Middlesex County, but contingent towns as well. And so we have submitted written testimony, so I'm not going to regurgitate that. Middlesex Health is 100% aligned with CHA and the testimony that they provided earlier. We think that there's a tremendous opportunity. And first, let me start with the logistics. We support, Middlesex Health supports the provision of Senate Bill 84 that goes towards eliminating occupational licenses. So that's the portion of the bill that we support. The portion of Senate Bill 84 that we are opposed to is the hospital tax. We agree with the Connecticut Hospital Association. We think that the time is right, that there's a better deal to be struck, not only for the state of Connecticut, but also for the patients and for Connecticut hospitals. And we think there's an urgency to that. And that's why I'm here today testifying for Middlesex Health. It is one of our top issues this legislative session. It is so critical to the way that we operate. What happens not only with the provider tax, but what happens with Medicaid rates moving forward, and everything is connected. So just a little bit of a different approach so that I don't, again, kind of repeat what my colleagues have mentioned. Let me give you a little bit of kind of a day-to-day of what's going on with Middlesex and why this is important. So we are in the middle of a strategic planning cycle. And in that strategic planning cycle, there are 20 to 25 things that we're trying to accomplish. And those things are improvements to outpatient behavioral health, investments in our women's health and OBGYN practices, continued investments in primary care and urgent care, not only from an access perspective, but also from a recruitment and a retention perspective. We are making investments in AI and technology, and that capital expenditure is just going to grow as the years go on. And so for an independent hospital like Middlesex, this discussion and the provider tax and really maximizing what we can get back from the federal government is critically important to us. And so I'm here today to again, let everyone know that Middlesex is fully aligned with the Connecticut Hospital Association's testimony, and we think that there's a better deal to be had. And thank you very much for listening to me today.
Thank you. Questions? Thank you.
Thank you.
Lisa Scales.
Good afternoon, Madam Chair, and all of the esteemed members of the Finance, Revenue, and Bonding Committee. I appreciate the opportunity to speak in support of raised Bill HB 5443, which strengthens the tourism fund that is the primary source of operating support for arts, culture, and humanities across Connecticut. My name is Lisa Scales, and I live in Danbury. I have had the pleasure of serving as the Executive Director for the Cultural Alliance of Western Connecticut for 19 years. We are a 501c3 nonprofit based in Danbury and a designated regional service organization for the Connecticut Office of the Arts. Our region covers 10 towns and includes hundreds of small arts and cultural nonprofits and creative workers. These are tiny organizations with lean budgets, small staffs, and a whole lot of heart. They show up for their communities every single day, but the system that they're working in is fragile. In all of my years leading this work, I've watched how unstable funding holds communities back, and only recently how real support allows these communities to thrive. Stable operating support really does matter. It's the difference between programs that barely survive year to year because the infrastructure is not there, and programs that actually builds cultural vibrancy, civic health, and attract private investment. For us at the Cultural Alliance, operating support from the Office of the Arts is singularly the very foundation that lets us serve as a regional backbone, coordinating, convening, carrying the administrative load that small organizations simply can't bear alone. When that support is steady, our partners can focus on impact instead of survival. And so can we. We're leading several key initiatives right now with long-term impact, like the Arts Hub feasibility study with the city of Danbury. This project requires deep coordination, multi-sector planning, community engagement, and communications across city staff, residents, creative workers, and contractors. Without stable operating support, long-term projects like this stall out. They drift. With stable support, we can not only keep this work going, but deliver a public asset that boosts foot traffic, supports small businesses, attracts investors, and creates a place where people actually want to spend time together. But we can also develop it. These are the building blocks of a healthy local economy. And here's the part that should really, really matter for the state. Even with unstable funding, our region's art and culture sector still generates tens of millions in economic activity and over 1,000 jobs every year, just in our region alone. Imagine what that looks like with dependable support instead of the stop and start funding model that we have right
You've
now.
reached 3 minutes. Please summarize.
HB 5443 strengthens the tourism fund in a way that finally gives us that stability. It creates that foundation that we desperately need to turn our current output, impressive as it is, into consistent investable growth for the state. I want to thank you for your time and for your service and for considering this bill.
Thank you for your testimony. Questions? Thank you very much. Megan Butler.
Good afternoon, Senator Fonfara, Representative Horn, Ranking Members Fazio and Paletta, and members of the Finance, Revenue, and Bonding Committee. My name is Dr. Megan Butler, and I serve as the Executive Director of the Connecticut Psychological Association, representing licensed psychologists across the state. I am here today to respectfully request that licensed psychologists be added to the professions included in the licensing fee reduction language in sections 14 to 28 of SB 84. As you heard earlier from my colleague, Connecticut has one of the highest annual renewal fees for psychologists, almost 5 times higher than our neighboring states. I want to briefly share with you a few stories from psychologists in Connecticut that illustrates how licensing fees affect the mental health workforce. One psychologist who wrote to us is one of the only bilingual Turkish-speaking providers in Connecticut. She accepts both Medicare and Medicaid, which means she intentionally chooses to prioritize access to care over higher reimbursement rates. She explained that the annual licensing fee becomes another financial burden layered on top of business costs. For clinicians serving vulnerable populations, those costs can make it harder to sustain their practices. We also heard from a pediatric neuropsychologist in the northeastern part of Connecticut who evaluates children with learning disabilities, attention deficit and hyperactivity disorder, and developmental conditions such as autism. She described how families in her region often wait months to find a specialized psychologist with availability. In many parts of the state, the need for specialized child mental health services far exceeds the number of providers available. The example we hear the most frequently comes from early career psychologists. Many of these clinicians train at institutions like Yale, UConn, and the VA here in Connecticut. But when they decide where to become licensed, often while still earning the trainee salaries, they compare licensing fees across states. And because Connecticut's fee is significantly higher than surrounding states, some choose to become licensed elsewhere. And with telehealth, these psychologists can live in Connecticut and practice remotely in other states in which they're licensed. So they live here in Connecticut, but they cannot serve Connecticut patients without a license here. And finally, some of our most experienced psychologists who have practiced for decades would like to gradually reduce to part-time work rather than retire completely. But when they weigh the cost of maintaining a license for a limited number of patients, some choose to retire altogether, meaning we lose decades of experience at a time when the demand for mental health care remains extraordinarily high. We appreciate the committee's leadership in addressing licensing fees for healthcare professionals and would welcome the opportunity to work with the committee to ensure psychologists are appropriately included in the provision. Thank you for your time and for your continued efforts to improve access to mental health care for the residents of Connecticut.
Thank you for your testimony.
Thank you.
Questions? Thank you. Rebecca Moore.
Good afternoon, Senator Fonfara, Representative Horn, and all members of the Finance, Revenue, and Bonding Committee. I am Rebecca Moore, a resident of New Haven, the Program Director for the Arts Council Greater New Haven, which is a 501c3 that supports artists and small nonprofits, as well as Cultural Affairs Commissioner for the City of New Haven. I am submitting testimony in favor of Raise House Bill number 5443, specifically the provision dedicating a portion of the meals and beverage tax to the Tourism Fund to support arts, culture, and tourism programs across Connecticut. As the third most vibrant state for arts and culture in the country, as Rufus has mentioned, it is imperative that we sustain funding that will continue to allow this sector to flourish. As an avid supporter of the arts through my professional career, but as an artist myself, I have seen just how impactful the arts are. I've seen vendors and visitors travel from out of state to enjoy experiences like the Black Wall Street Festival that has activated thousands of people and our community in ways I never imagined. Or business owners like Jasmine Nicole, who's been able to represent our great state at the Harlem Fine Arts Show in New York City recently with her visual art. As a Cultural Affairs Commissioner and my role as Program Director, I've been able to assist in the business development of a number of artists. Being able to enhance their full-time careers within the arts has proven that being an artist no longer has to be seen as a hobby or a side gig. Excuse me. It is a profession that provides housing, food, and other necessities to many families. Thriving businesses, because they are far from small, are generating economic dollars. And Rufus attests and said, mentioned how the arts sector and culture has raised over $13.9 billion and is an impactful industry. When art teachers were threatened to be cut due to educational cuts here in the city of New Haven, I was proactive in planning to get arts organizations to adopt schools in the community to still provide artistic opportunities for these children. If it had went through, thankfully it did not. But organizations can't show up in times of need with lack of funding. The world is looking at us. The world sees us. Let's show them why we are indeed so vibrant. Thank you for your time, and please consider supporting this bill.
Thank you, Ms. Moore. Questions? Thank you. Katiana Smith. Jennifer Chadwickowitz.
Good afternoon, Senator Fonfara. Representative Horn, I think, stepped out. Ranking members Fazio, Poletta, and the esteemed members of the Finance, Revenue, and Bonding Committee, thank you for the opportunity to testify today. My name is Jennifer Chudukowicz. I'm the Chief Strategy Officer for the Southeastern Council on Alcoholism and Drug Dependence, SCAD. I am also a woman in long-term recovery, and I'm a resident of Cromwell, Connecticut. I'm here today to respectfully request the Finance, Revenue, and Bonding Committee consider including $12 million in bond funding for SCAD's Lebanon Pines campus in Senate Bill 85, an act authorizing and adjusting bond funds for the state. The requested bonding would allow SCAD to construct a flood-resilient secondary emergency entrance, ensuring that emergency services, staff, and essential operations can reach the campus under all conditions for generations to come. SCAD's Lebanon Pines campus is the largest, oldest residential substance use disorder treatment center in Connecticut. For nearly 60 years, SCAD has provided treatment and recovery services to your parents, wives, husbands, and children across the state of Connecticut. Located on 66 acres in Lebanon, the campus serves approximately 2,000 individuals yearly, operating 24 hours a day. We employ 240 employees and residents of Eastern Connecticut. We provide residential treatment, trauma treatment, vocational training, primary care treatment, hepatitis C treatment, medication-assisted treatment, and comprehensive recovery supports. The Lebanon Pines campus has a critical vulnerability, though, with only one entrance, and it's located at the confluence of the Yantic River and the Sherman Brook. As precipitation patterns intensify, future flooding poses a risk to emergency access, critical deliveries, safe evacuation if needed. SCAD commissioned and went to great extent to fund a comprehensive engineering analysis of the entire property by H&H Engineering, which confirmed for us that the entrance roadway and culvert system are increasingly overwhelmed by the changing river and precipitation conditions. Constructing a flood-resilient secondary entrance will mitigate these risks and ensure the campus remains accessible for years to come. Lebanon Pines is licensed by the DPH and supported by the Department of Mental Health and Addiction Services. If access to the campus is compromised, it could jeopardize the safety of residents and staff and could disrupt a critical component of Connecticut's behavioral health continuum. Ultimately, this is about protecting critical healthcare infrastructure that the state of Connecticut relies on every day for life-saving treatment. And now SCAD is here to rely on you to ensure this critical resource remains accessible, resilient, and able to serve the people of our state for decades to come. I can answer any questions that you might have, and I thank you for your time and your continued support of recovery, resilience, and public health in Connecticut. Also, I do have a couple of maps that I wanted to upload. However, I'm sure you're aware that the upload feature for testimony is not working right now. I'm going to keep trying, but I can answer any questions. Thank you so much.
Thank you. And rather than field questions today, there are members of this committee that are on the bonding subcommittee, and that's the group you really want to reach out to.
Thank you, Senator.
Some are here today. Others are watching online, and that's your best bet. It's not that, I mean, this committee will ultimately adopt the recommendations of the subcommittee.
Thank you.
We could modify them, but traditionally we don't. But that work is done, and I encourage you to get from the clerk at some point a list of those folks. Then I think
I surely will.
your
Trust
efforts
me.
will be more focused.
Thank you so much. I appreciate
But thank
that.
you for your testimony today.
I appreciate that very much.
The clerk has got to make this list a little bit bigger. So people whose eyesight was never a problem, but now is. Joyce Rio?
Yes, hello, good afternoon. I'm Dr. Joyce Rio, representing the Connecticut Occupational Therapy Association. I'm here to briefly supplement our written testimony on Senate Bill 84, specifically the provision proposing to eliminate licensure renewal fees for certain high-demand positions, including occupational therapy. First, I want to thank this committee for your leadership last year in eliminating initial licensure fees. That change has been a tremendous win for our students, really helping new graduates, many of whom are carrying significant educational debt, helping them enter the workforce and focus on patient care before their first paycheck. We share the goal of reducing financial barriers for professionals. However, after reviewing the bill, our association believes there is a more balanced and sustainable path. That is right-sizing licensure renewal fees rather than eliminating them entirely. When discussing this internally as an association, I kept hearing my mother's voice saying, "Nothing in life is free." And it really is very simple advice, but it reflects a policy reality. Licensing systems, professional oversight, and practitioner support programs all carry real costs. The question is how we structure them fairly, transparently, and sustainably. And I'm sure it may seem very unusual for someone to come before you and say not to eliminate a licensing fee, but here's our thinking. Currently, Connecticut is a regional outlier in renewal fees. So a modest reduction or adjustment would bring us more in line with neighboring states while still maintaining the programs that protect the public. It could also move Connecticut toward more of a revenue neutral structure where fees actually reflect the actual cost of administration rather than simply going into the general fund, therefore promoting more transparency and accountability. Our licensure fees also support a program called Haven Connecticut. This is a confidential program providing mental health and substance use supports for healthcare professionals. Just $5 from each renewal helps sustain this critical safety net for practitioners while safeguarding patient care. And I also just need to give a plug that in addition to fee reform, Connecticut will need coordinated solutions to sustain our workforce. For occupational therapy, that includes modernizing our nearly 50-year-old Practice Act, joining the occupational therapy licensure.
You've reached 3 minutes. Please summarize.
And addressing student loan gaps that affect the occupational therapy workforce pipeline. So we are making the recommendation to right-size our licensure fees. But if elimination of renewal licensure fees move forward, we certainly don't want to take occupational therapy off the list. So thank you all.
Thank you. Questions? Thank you very much.
Thank you.
Vita Muir.
Good afternoon. I wish to thank the Finance, Revenue, and Bonding Committee for hearing my testimony today. My name is Vita Muir, and I'm the founder, artistic, and executive director of Litchfield Performing Arts, which is celebrating its 45th year this year. We are also the producers and presenters of the Litchfield Jazz Festival, Litchfield Jazz Camp, and many, many arts education programs over the years and currently. We are probably one of the largest in terms of revenues of the freestanding not-for-profit organizations. Our revenue last year was about $1.1 million. We have an advantage over other people in that we're the only festival, for instance, that has an educational arm. And so we have many avenues to go to that other people who are just presenters don't have. They have ticket revenues and donations and perhaps not a lot more. The funding that happens to, I love to quote this particular stat. A number of years ago, I asked people, how much money do you think the city of Berlin spends every year on supporting the arts. Well, I told them that we at this time spent about 160 million. NEA gave 160 million. I'd like to ask you to guess, but you can't answer through this system. So I'm going to tell you, they spent 800 million. These numbers have not really changed, except that I suspect that the amount of money that's being spent in places like Europe and Canada has gone up, and I know the amount of money in the States has gone down. And the current administration threatens constantly to eliminate the National Endowment for the Arts, which is the only government agency that gives money directly by competition, by granting, but gives directly to the arts. This is not a great situation for people to be in. So I'm very enthusiastically supporting the idea of the 5443 bill that would allow the restaurant taxes to filter into tourism and culture. I'm not sure. I'm making this presentation largely to support the people around us because I don't even know if our organization can benefit from it themselves. We do have been able to get for a number of years direct local funds.
You've reached 3 minutes. Please summarize.
Yeah. That kind of money excludes us from getting any other monies from the Office of the Arts. But I really, really feel that other people need this money, organizations that are smaller than ours, who are doing everything they can to keep arts going in this state. Thank you.
Thank you. Questions for Ms. Muir? Thank you much. Peter Gistelink. Kim Sandor.
Good afternoon, Senator Fonfari, Representative Horn, Senator Fazio, Representative Paletta, and distinguished members of the Finance, Revenue, and Bonding Committee. Thank you for the opportunity to testify today on Senate Bill 84 and Senate Bill 85. We have uploaded our testimonies. You can get the whole kit and caboodle by looking through some of that. And I would just like to take a minute to highlight some of the points that we have included there. My name is Kimberly Sandor. I'm Executive Director of the Connecticut Nurses Association, and we represent nurses across all specialty areas and practice setting. Nursing is a huge profession. We currently, the state currently issues 91,094 nursing licenses. This is for RNs, APRNs, and LPNs. This is more than doctors, policemen, and even educators in the state. So there's a lot of us. Senate Bill 84, an act concerning revenue items to implement the governor's budget, specifically Section 14 related to the removal of occupational licensing fees. Who's going to be upset with that, right? It's a welcome proposal. It's celebrated. As the previous testifier, Joyce, mentioned, nursing, like other professions, is out of alignment with what's being charged in the other states, and it's at an annual frequency. So the rate is quite high. Our nurses are often the primary wage earners in this family, so it would be great. But we do want to just highlight the unintended consequence of this, and that's the loss of funding to Haven. And Haven is a very important program for all licensed healthcare professionals. So every single licensed healthcare professional that we're removing occupational licensing fees, that means that's $5 less going to Haven. Haven supports the mental health needs of our workforce, and this is a time where we should be investing in it. So we just really ask you to take a look at ways that we can provide sustainable funding to Haven. Joyce is part of a coalition we have. You probably heard us as it related to Senate Bill 8 and the higher education CHESLA degree and the upcoming 85 that I'll mention. But we have a whole group that represents 82% of the healthcare workforce. And we've been talking about the importance of Haven. And we had hoped to get a letter in front of the governor's office before today, and we will do it as a follow-up, offering the importance of Haven and that ongoing, reliable, sustainable funding, even if it has to come from healthcare providers. Senate Bill 85, enthusiastically support this. You've probably been following along everything in higher education and the the attempt to mitigate the impact of the federal bill HR 1 to limit access to graduate loans. This is an urgent need. We've already heard folks are not thinking about nursing, not thinking about becoming APRNs. The state has made incredible investments in our workforce, our healthcare workforce, due to these shortages that we know we have, and not having access to loans is just going to make it all worse. And so this is an urgent need. The federal bill goes
You've reached
into
3
effect.
minutes. Please summarize.
You bet. If students can't finance graduate education, our enrollments will decline. Fewer students means fewer graduates just intensifies shortages. So it impacts faculty as well as who create the existing workforce, as well as those providing direct patient care. As always, happy to chat more offline or answer any questions.
Thank you very much, Kim.
You bet.
Questions? Thank you. Ashley Weiss.
Good afternoon, Senator Fanfara, Representative Horn, Senator Fazio, Representative Paletta, and other distinguished members of the committee. My name is Ashley Weiss. I'm a respiratory care practitioner representing our state society, and I'm also a 10-year respiratory therapist within the state working at Hartford Hospital. I'm here to offer comments on Senate Bill 84, an act concerning revenue items to implement the governor's budget. Section 14 to 28 removes license and renewal fees for select professions that include physical therapists, dental hygienists, occupational therapists, and others. We unfortunately are not included in this license relief, but believe we are just as deserving as this, as are the other professions. Respiratory care practitioners are vital members of the healthcare teams across the spectrum of acuity. We help identify and treat cardiopulmonary disease with specialized therapies and diagnostics. We work in the ICUs and emergency departments and hospital wards, in outpatient offices, and even in the home care setting. Our patients range from neonates all the way to the elderly. Governor Lamont stated the action recognizes the need for more individuals to join these high-demand professions. We agree, but we face a vacancy rate that exceeds 30% across most hospital systems as respiratory therapists age out into retirement or move on to careers elsewhere. In 2024, the legislature created a working group to look at ways that we can improve workforce development for respiratory care and two other professions. One of their recommendations was to remove the initial license fee as well as the annual renewal. Doing so would save our members $190 and $105 respectively. The costs related to obtaining licensure after graduating from accredited degree programs have been identified as a barrier to entering the workforce. Even without the initial state license fee, graduates of respiratory care programs can expect to pay upwards of $300 for test preparation and $400 for the exams themselves. Eliminating the $190 licensure fee would remove an additional financial hurdle and ensure that these much-needed reinforcements are able to enter the workforce and begin delivering much-needed care to our communities. The Connecticut Society for Respiratory Care asks that you amend Senate Bill 84 to add respiratory care practitioners to the list of professions who will receive a break on their initial license fee, the annual renewal fee, or both. Thank you very much for your time.
Thank you. Questions for Ms. Weiss? Thank you. Sky Cornell.
So sorry to interrupt. Sky Cornell, right, and I, Ava Bermuda Zimmerman, are testifying jointly. She's trying to be bumped up as panelists, but I think her screen name is a different name. She was just texting me now.
She's joining now.
Awesome. Oh, I can see Sky. Awesome. Just for point of clarification, Sky is going to be on in support of any additional questions that you may have. I am also listed, Ava Bermuda Zimmerman. We signed up to go on together, so I will give my. Okay, awesome. Hello there, honorable members of the committee. My name is Ava Bermuda Zimmerman from Child Care for CT. We're an organization that represents over 26,000 individual members, as well as 70 different nonprofits throughout the state of Connecticut. I'm wearing our very well-known yellow fixed child care shirts, and I wanted to kick it off with childcare isn't fixed. We recognize the work that this committee has done, as well as the governor has done in the past few years in trying to fix childcare with the creation of the endowment. The precursor to that was the Blue Room Panel. But in order to have success in the endowment that was created, you need to allow for compound interest. That money that is compounding throughout years then will be able to be drawn down in order to have slots through the Early Start program and create opportunities for families for affordability or low cost care. The compound interest that was promised, or the initial investment to allow for that compound interest that was promised, was $300,000 in discussion with legislature and the governor. And what we have discovered through Child Care First UT, as well with our partners, social impact partners, in researching, is that the amount that is needed in order to support the parent fee, that difference so that parents have affordability, is a lot more than just the $300 million that is promised. In our initial conversations with this committee in previous years, I'll go back to 4 years ago, even before the legislative proposal of the endowment was even entered in, we sat here and testified for $1.5 billion. And some members of the committee laughed and said that was absurd. There was no way that we were ever going to get $1.5 billion for early care investment. And now 4 years later, here we are. No longer people are laughing. People are taking the issue of early care and education seriously. But it doesn't change the conversation that $300 million installments is nowhere near enough money in order to make it affordable for parents who need access to childcare. We are really hoping to aim to get to that minimum amount of $1.5 billion through that continued investment yearly of the endowment. And we do recognize and ask this committee to understand that more money up front, the quicker the ability that we have to draw down from it and then create the slots. The scenario we have now is that the governor's proposal, SB 84, that we right now as written oppose, is if you commit to the 129 million that OPM suggested, we will never get to the significant amount of money in the endowment that will ever be drawn down for. How can we propose an idea, especially how can legislators support an idea during an election season that doesn't see actual results for families? Right now, we need to make sure that this investment, this promise, is truly kept. That means that we have to have that money up front. We have to commit to the 300 or more, and then see a pathway to allow that compound interest to germinate, to really bloom. So I'll pause there. I'm assuming you might have questions about the assumptions that we have in our studies. There's more of my testimony that I submitted. We also have a diagram that we submitted with it, walking some of these assumptions out of how we can get to the necessary amounts to support families. And I really do hope that we can have a conversation.
Questions? Representative Farrar.
Thank you, Mr. Chair. Thanks, Ava, for being here and for certainly highlighting the steps we've taken and the steps we have to continue to take. I appreciated you highlighting the mechanism unto which we use to establish the endowment, which was the use of surplus dollars. Last year, that was $300 million. When we started this fiscal year, that was anticipated for this fiscal year to be approximately $300 million. And we've seen that estimate continue to decrease. I believe the comptroller's estimate was closer to 77 million. And thank you for sharing the concerns you have in regards to the current governor's budget and how that would be lower than the 300 million. I was hoping you could articulate for us what you kind of view as the real consequences if we do not fulfill at least the originally projected $300 million deposit into the endowment this year.
So the original projection gets us, and I'll backtrack for members of the committee that might not know the details of this program. So the endowment is the pocket of money that then funnels to support Early Start programs that are subsidized throughout the state. And that commitment came with the commitment of free childcare for any family making less than $100,000, and then low cost childcare or capped childcare to 7% of a individual or family's household income for everybody else, right? So if you're making $300,000, if you're making $200,000, you know, stable middle class, regardless of that income, you're capped at 7% of your annual income as to what you pay for childcare. And that was the federal recommendation in the Biden administration, and still a recommendation made from national experts that no family should pay more than 7% of their annual income. That commitment, and I start there because that commitment of paying on behalf of the lowest income families in the state of Connecticut to pay the parent fee, that difference, because they truly cannot afford to pay a dime out of their pocket for the necessary childcare. They are just surviving. If we do nothing, if we literally do not add money into this endowment, that commitment is gone. It's blown out of the water. That means that the promise to support the families most in need, those families who do not necessarily qualify for other programs like Care for Kids, the lowest of the lowest income for a childcare program, would then be looking at this program and saying, where's that difference? Where is that support? And we have to say with a straight face, oh, sorry, we did not invest enough early and we do not have money to actually pay for this program on your behalf. You now have to figure it out, despite the fact that promises are made and plans are made. If you do more, right, if you put more money in the endowment than the original 300, then we can get into the scenario and the situation of covering that family fee. And then I will pass it to Sky Cornell to talk a little bit more about that impact of the family fee. So if Sky, if you can take a little bit more details to that family fee and what that means for the 300 million.
Sure, thank you. And thank you for that, Ava, and for that question, Representative Farrar. Good afternoon to the members of the committee. I'm Sky Cornell. I am a Director of Early Childhood Provider Growth and Strategy at Social Impact Partners. And we have been working closely with Child Care for Connecticut and advocates in the coalition with the goal of trying to answer the question about what are the needs to be able to address that affordability for families that is written into the legislation for fiscal year 28, and what would it look like to be able to hold the providers harmless through that family fee change, because we know that, and I can show a little bit more in some slides that I have, but as we've been working on these questions with Child Care for Connecticut, we know that if providers are not held harmless to this change, then that family fee is a lot of revenue that is currently in the system that providers will not be able to have coming into their programs any longer. And we estimate that this is about $40 million starting in FY28. And if that were to be, as I said, removed from providers, it would really cause a significant issue. You would see that providers would not be able to keep their doors open. Many of them, we already know that this is such a low margin, business for providers. And Ava, I'm happy to share a slide that goes into a little bit more detail. Okay, so the other question that we were working with and analyzing with Child Care for Connecticut was about what would it look like in order to in the endowment fund to have enough money to be able to, meet those needs for providers, addressing that family fee gap, but also to maintain the other investments that have already been made from the Early Childhood Endowment Fund. So the scenario I'm about to show, and if I can just go to the slide here to share this. What we did was just run two scenarios here, just keeping this, very simple, because the analysis that we did and showing what it would take to maintain really showed that about $100 million essentially would be needed in order to hold providers harmless through the family fee change and to maintain the other investments, programmatic investments, et cetera. And so looking at two different scenarios at the disbursement rate of the statutory cap, you can see this first one here shows $375 million in FY27 and $375 million in FY28. And then that would address those estimated needs in FY28, although it would not support, as Ava said, that more meaningful expansion and to families or increased provider rates that would be necessary to enable that expansion. And then another scenario looks at $300 million in each of those 2 years. And you can see that at about $85 million falls short.
Sky, I'm
Mhm.
sorry. Do you mind wrapping up the
Yes.
answer to that?
Yep. So that falls short of those estimated distribution needs. And so although there are other things that you could look at in these scenarios, what we were thinking about and running these through were the deposit amounts, the distribution rates, and then, of course, you need to take into account the return on investment.
Thank you, Sky. I just saw that you all submitted testimony, so I'll definitely look at that more closely, which I think includes that, and appreciate the thoroughness. And I'm sure anyone could reach out with further questions. So thank you. Thank you, Mr. Chair.
Thank you. Questions further? Seeing none. I just want to, from my own perspective, while I'm very supportive of more funding going into childcare, but the term childcare versus early childhood education concerns me. One is paying to reduce the very high cost of childcare. And then there are many children, many of whom I represent and others in this committee represent, who never get into preschool, never get a start at all. And I'm not hearing a lot about that aspect of this investment. And that would be a tragedy on top of a tragedy if that's allowed to happen.
So I guess for the simplification, and I guess this is doing us a disservice, and we can change our rhetoric, of course, 'cause we never want to undermine the advocacy and the importance of early education. We do simplify this issue into the phrase childcare, because childcare, when we're referring to it, it's public school programs, it's home-based providers, it's childcare centers. There is a multitude and variety. What I will assure you is that this program, connected to the endowment, Early Start, requires that every single slot that is given through that endowment money is guaranteed high quality education. It's very rigorous markers. The locations, be it a school, a childcare center, or even a home educator, has to provide proof to the Office of Early Childhood, not only licensing, but they have credits and points based on how much of a degree they have. So if they have a master's degree, they are more likely to be given allotted slots. So quality is here.
That's not my issue. My issue is there are children who don't even make it across the threshold of these facilities, whether it's cultural, whether it's moms are just working, maybe they haven't had a quality education themselves and therefore not appreciating what preschool can do for a child. And all you have to do is look at the entrance assessments that every child in Connecticut has when they enter kindergarten. And you can see in our cities in particular, the number of children who are coming in with substantial need in terms of childhood readiness, many of whom have not been in any preschool at all. And if you start behind, and you know this better than anybody, very often your chances of finishing behind are great, not just in terms of education, but in your life. So I pray that this program, and I'm one person, but from my standpoint, if we don't address the needs of those children and making sure that they do get into quality preschool, I'm not questioning the quality of the preschool. I'm questioning whether or not we have a commitment for the children who come from the most disadvantaged backgrounds being exposed to early childhood education.
Senator, it sounds to me that you're in complete alignment with the coalition's mission to support those families who need it the most. So 100% agree with you. And I really do hope that other legislators can see that families can't afford it, businesses can't afford it, providers can't survive like this. And the path forward is creating programs that give an opportunity for a multitude to have access to quality and affordability.
I don't want to beat this drum anymore, but that affordability is a real issue. But getting there is a major issue that I'm not certain I'm hearing in the testimony today or in my examination of this program in general, and I'd love to be proven wrong.
Just a point of clarification of the getting there. Is it in regards to access for additional spaces for childcare providers because we don't have enough slots in general?
I think it's best that this conversation continue outside of today because it could go on for a while, but it is getting children there, and there are many reasons why they're not.
Thank you, Senator. We will definitely be available
Thank
to take this on offline and set
Thank
up a
you.
meeting directly with you.
Thank you very much. Nick Teeling.
Good afternoon, Senator Fonfara, Representative Horn, Senator Fazio, Representative Paletta, and esteemed members of the Finance, Revenue, and Bonding Committee. My name is Nick Teeling, and I'm testifying today on behalf of Connecticut Voices for Children, a research and advocacy organization working to ensure that one day Connecticut is a thriving, equitable state where all children achieve their full potential. With me today is Dr. Patrick O'Brien, who's available to answer any questions. Connecticut families are currently caught in a perfect storm. Between the federal fiscal shifts of the One Big Beautiful Bill Act, rising costs due to tariffs, global instability, our residents need more than temporary fixes. They need a tax system that's fair, predictable, and robust enough to backstop the near $1 billion loss in fiscal year 2027 to public benefits. We are here today to support House Bill 5444 and offer options that may strengthen the bill, as well as provide supportive recommendations for Senate Bill 84 to ensure our state has the resources to protect its most vulnerable children and families. First, regarding Section 1 of Senate Bill 84, should the committee choose to address the tax conformity proposal as outlined, we recommend also expanding it. We offer that decoupling from additional federal provisions, specifically the qualified small business stock exclusion and the federal estate tax exemption, are equally important. More importantly, we ask that the Department of Revenue Services be required to publish a provision-by-provision analysis of the One Big Beautiful Bills Act's impact on Connecticut. Policymakers cannot make informed decisions about revenue without a clear estimate of federal change costs to our state. This transparency is vital to preserving revenue and improving fairness in our tax system. Section 8 of Senate Bill 84 proposes a temporary adjustment to the volatility cap. We recommend a more structural shift, moving to an inflation-adjusted moving average of covered volatile revenue. Based on a 5 or 10-year moving average, this design could unlock more than $500 million in fiscal year 2026. If adjusted, this revenue has the potential to fund a permanent child tax credit and continue to bolster the early childhood education endowment without requiring broad-based tax increases. And at a time when federal funding is retreating, we must use our most progressive revenue sources to fill these gaps. Regarding Section 6 of Senate Bill 84, the governor proposes a one-time sales tax rebate. While we appreciate the intent, a one-time payment of $200 to $400 is only a year's solution to a multi-year crisis. We recommend instead to establish a permanent, fully refundable Connecticut child tax credit of up to $600, similar to that's proposed in Senate Bill 103. However, if the committee moves forward with a one-time rebate, we would suggest it be redesigned to provide more support for low and middle-income families. The current proposal excludes non-tax filers, effectively leaving out 158,000 of our poorest residents, including over 22,000 children. We should not be sending relief checks that bypass the families that need the most, especially when they're impacted by the federal cuts to food assistance and healthcare. Finally, we support House Bill 5444, which would index the personal income tax to inflation. Currently, as the cost of living rises, families are pushed into higher tax brackets, even if their standard of living hasn't improved. This bracket creep functions as a hidden automatic tax increase that disproportionately harms low and middle income families. To be effective, this must include all core components: the personal exemption, tax brackets, and the personal tax credit. This change ensures that our tax system remains fair and doesn't penalize families for simply keeping up with inflation. The One Big Beautiful Bill Act and the current economic climate have created an unprecedented financial challenge for Connecticut. We have the tools to respond, but we must be thoughtful. Our main hope and reasoning for testifying today is provide policymakers with as much information as possible as they navigate the broad impacts of the new federal laws and executive orders, with the hope that this session will result in hardworking families receiving the financial relief they so desperately need as they confront rising costs due to tariffs and now an emerging war in Iran. Thank you for your time and commitment to Connecticut's families, and we would be happy to take any questions.
Representative Menefee.
Thank you. And through Mr. Chair, I appreciate it. It was very thorough, and I've been taking a look at Mr. O'Brien's written testimony as well. But I was hoping that you could tell us a little bit more about the importance of the tax conformity issue for this, the all states, but for this state in response to 2025's HR 1, especially regarding issues not addressed in the governor's bill.
So thank you for the question. Yeah, so the governor included some issues involving tax conformity applied to the corporation tax. We just wanted to lift up two additional examples. One is the qualified small business stock exclusion. And just to give a little bit of overview of that, essentially, if you buy stock directly through a C corporation, through a business that's considered relatively small, so in this term, by under $50 million, you can essentially, if you hold on to that stock for a few years, you can sell it and have zero capital gains. So we had a $10 million limit on that. They've increased it to $15 million. So if you were, let's say, making $2 million in Connecticut, and you bought several years ago, $10 million, you bought $500,000 in stock in a California tech startup, and now you're selling it for $10 million, you're going to pay zero federal income tax at the federal level, and that's going to pass through to the state level as well, and you're going to pay zero state level income tax on that. And so at the federal level, that's a big problem in large part because over 90% of the gains go to households making over $1 million. But at the state level, it really is highly problematic because there's no requirement that it even involves a Connecticut business. So like, again, for the example, you could be living in Connecticut, you can invest in a business in California, and then you're paying zero tax dollars on $10 million in investment income, whereas a family in Connecticut maybe that makes $100,000 a year and buys an S&P 500 ETF and makes a few $1,000s in capital gains, they're going to be paying on that. So that's just one example of a tax expenditure essentially that has existed at the federal level and has been expanded with the One Big Beautiful Bill Act, and it wasn't addressed in the governor's bill. Another example that we lift up is that we've tied now to the federal estate tax exemption. And so before the Tax Cut and Jobs Act of 2017, our state estate tax exemption was about $2 million. So if your estate was worth less than $2 million, you weren't getting applied to the estate tax. Now it's because we're tied to the federal estate tax exemption, it's $15 million in 2026. And so no estate below $15 million is paying any tax on that. But another big problem essentially is if you are a $20 million estate, you're not paying tax on that first $15 million, you're just paying it on the $5 million. So it's even a problem for some high value states that are still paying the tax. And so we would recommend, for example, primarily decoupling from the federal exemption so that state policymakers can have more control over how the state estate tax works, especially from a revenue perspective. We also include a couple options, essentially, that if there's not support for decoupling from the federal estate tax exemption, there are ways, for example, of actually taking advantage of being coupled to it. And so we lifted up two examples. One, you could do a state estate tax recapture, similar to what we have with our personal income tax. You could also do an estate alternative minimum tax, limiting the the percent at which a state pays for the estate tax. So basically set a floor, for example, that, you know, no $1 billion estate should pay less than 2% in the state estate tax. And the thing to lift up with that is essentially the federal government subsidizes 40% of our state estate tax. So if we remain coupled and we're to do some of these workarounds, the federal government is essentially paying for 40% of that. So there's a couple different options there. But so we're just lifting up 2 examples, but again, there are several issues with tax conformity, and really to make the most well-informed decisions, we think the DRS should, as soon as possible, have a section by section report that they give to you all, explaining to all these different tax conformity issues and also providing cost estimates.
Thank you. And if the chair would, do you know if cryptocurrencies or digital currencies fall under one of those, I guess, loopholes or exemptions on there?
We didn't look at that, but that would be a great thing to have more information on if we had a report on it.
Thank you.
Questions? Senator Fazio.
Thank you, Mr. O'Brien, for your testimony. As always, I appreciate your comments in support of indexing of the income tax brackets. You know, it seems like it would be in the long run more helpful to people on the lower end of the income ladder than not, but help a lot of people. But can you also discuss, obviously, we're dealing with trying to balance budgets here, and we can't be reducing revenues too much in this budget cycle. But for this policy in particular, from your analysis, wouldn't be affecting the current budget balances that much or at all. It would really be out into the future, and so probably more of a realistic policy to advance in this budget cycle based on your analysis.
Yeah, so I didn't include cost estimates in this. We did it in a previous report last year. I want to say off the top of my head, I think it's roughly 60, 70, $80 million for if it was about a 2 percentage point change. We can give you the numbers on that. It was in the report. The average inflation over the past 20 years has been a little over 2%. And so we're doing some modeling of that. So it's not a huge cost up front, but the problem is it just compounds over time. And so just for example, we're talking about what to do with potentially this $500 million that the governor has proposed to do a tax rebate with. And so for example, with that $500 million, you could establish a Connecticut child tax credit, you could inflation index the Connecticut income tax, and you'd have some money left over that you could increase the early childhood education endowment or use it in other ways. I just do want to lift up though for people that aren't quite as involved in the inflation indexing conversation of just how important a policy this is. So we go back to the 1990s, since we created a broad-based income tax, we have not inflation indexed it. So every single year that we pass a budget, we have a broad-based tax increase on low and middle income households. And we included 2 figures in the report, figure 1 and 2, so you can visualize this. Since we have a relatively highly progressive income tax system, you phase in very quickly on the effective tax rate. And so what it means is it really hits the lowest income households the hardest, it hits middle income households the next hardest, and it barely touches very high income households. And so we even gave dollar amounts. So we're talking about over a 10-year period. You would have somebody who's making a little over $30,000. The tax increase that would result just from inflation indexing during a period of normal inflation would be over $500. And that represents a 1.4 percentage point increase in their effective tax rate. So that means they're paying 1.4% more of their income to the state, even if their ability to pay just stays the same over 10 years because they're getting cost of living adjustments. So it's a really important tax increase that kind of is operates under the radar, but it compounds quickly over the time. So we're talking about a lot of money when it talks to basically hitting low and middle income families.
That's an excellent explanation. Thank you, sir. Thank you, Mr. Chair.
Thank you. Anyone else? Thank you.
Thank you.
Will Herschel.
Good afternoon. Can everyone hear me?
We can.
Thank you very much for your time this afternoon, honorable members of the Finance, Revenue, and Bonding Committee. My name is Will Herschel. I'm the CEO of Verigy, a Connecticut-based solar energy company with a focus on commercial industrial and front of the meter installations. We have over 60 employees, the vast majority of which are located here in the state of Connecticut. I'm here to speak about a very narrow issue with regard to HB number 5442. Specifically, I believe that this bill aims to correct an error that was made in the passage of Public Act 25-173 last year that created the uniform capacity tax. And in particular, it tries to deal with a situation where projects that would otherwise be subject to a uniform capacity tax are in fact exempt for a period of time from the passage of the act last year in July until July of 2026. I propose two things with regard to this individual bill. The first is from a practical perspective, town assessors and municipalities have been working with developers essentially to enforce the uniform capacity tax as if it existed for the projects that would be subject to that uniform capacity tax. And so from a practical effect perspective, there hasn't been really any change from, I think, the intent of the legislation from last year. And then secondly, if a corrective action is needed on the language of Public Act 173, I would propose a very different change that doesn't encompass many other projects into this potential quagmire of debate as to what is and is not exempt. And specifically, what I would propose is just changing the applicability of the uniform capacity tax to July 1st of 2025 versus its current language, which is July 1st of 2026. So a very narrow issue here, really trying to make sure that there isn't any retroactive tax imposition on projects that would otherwise be exempt or subject to the uniform capacity tax. But that's the purpose of my testimony today, and happy to answer any questions. And I really appreciate your time.
Thank you for testifying. Questions? Thank you, sir.
Thank you.
Mindy Gold.
Good afternoon, Senator Fonfara, Representative Horn, Ranking Members Fazio and Paletta, and honorable members of the Finance, Revenue, and Bonding Committee. My name is Mindy Gold, and I am here as the parent of 2 young children to urge this committee to strengthen the investment in the Early Childhood Fund included in SB 84, ensuring the Early Childhood Education Endowment is fully funded to expand access to affordable childcare and fair wages for early educators. I never set out to be an early childhood advocate, but I became one because of the endless stories from parents who cannot afford or access quality childcare in Connecticut, and because I know the cost of care firsthand. Last year, I paid $26,250 for childcare for my 2 children at a center right across the street from you guys in Frog Hollow. Families across the state are doing everything right, working hard, picking up extra shifts, trying to build stable lives, and childcare is the barrier that keeps knocking them back down. At the same time, I see early educators, the people who hold our babies, teach our toddlers, and make all other work possible, leaving the field because they cannot afford to stay in it. I see directors running programs on impossible margins, turning away families on waitlists because there simply aren't enough providers left. And I see what happens to children when that infrastructure is unstable. The developmental delays, the family stress, the ripple effects that schools and employers and communities for years. And as a Board of Education member, I know how much this matters for kindergarten readiness. The governor's early childhood endowment was a meaningful promise that childcare is public infrastructure, not a private luxury. Like roads and bridges, our economy depends on it. When fully funded, this endowment would deliver approximately 12,000 new preschool spaces and over 7,500 extended day slots by 2032. But a promise only matters if we keep it. All projections to reach those outcomes are founded with a $300 million deposit in year 2. Not $129 million, not $190 million, $300 million in year 2. This plan relies on compounding interest. Any time lost is money lost, and money lost shrinks the entire future impact of this endowment. I think about Jasmine, a city bus driver who lives here in Wethersfield. Her shift starts at 5:30 a.m. She couldn't find quality care that opened early enough, and when she did, she couldn't afford it. Overtime meant more childcare at earlier hours at higher costs. This is not a personal budgeting problem, it's a systems failure, and the person who loses out most is the child. So thank you so much, sincerely, to everyone who has been in this fight for longer than I have. I'm grateful to be here in coalition and solidarity with you all. Thank you.
Thank you, Mindy. And I can attest to Mindy's commitment. I was given a tour of the facility right across the street and seeing the great work that they're doing there, and learning the immense cost that not only your children, but many other children from a very, very poor community are coming from. So thank you for all your work. Questions for Ms. Gold?
Thank you, Senator Fonfara.
Thank you. Justin Fritz.
Good afternoon, members of the committee. My name is Justin Fritz. I appreciate the opportunity to speak today. I am CEO of the White Oak Bridge, a licensed cannabis operator, transport operator in the Connecticut market. I'm here to speak on Bill 5109 and the efforts to reduce Connecticut's cannabis tax structure. While Connecticut has made significant progress towards building a regulated cannabis market, our current tax structure puts us at a disadvantage compared to neighboring states. I strongly suggest the committee set a maximum rate of 10.5% to make us a little bit better than our neighboring states competitively. As the Office of Cannabis Ombudsman has noted in earlier testimony to your committee, reducing the tax burden will not only benefit medical patients who continue to face affordability challenges in our state, but it will also help bring back adult use business into Connecticut. Right now, many consumers are still crossing state lines, as others have testified earlier, to Massachusetts and New York, where total prices are often lower than they are here in Connecticut. Between lower tax rates and lower prices, Connecticut is losing out on a meaningful amount of sales activity that we could keep here in the state. And I've heard it's upwards of $100 million a year. So, and I can certainly help the committee get access to those data. Aligning our tax structure with our neighboring states will help recoup those sales and strengthen our long-term sustainability of the Connecticut regulated market. I would also encourage the committee to reconsider tax treatment of hemp-infused beverages as part of this discussion. The current tax structure for these products are significantly higher than comparable alcoholic beverages, even though they're sold in the same spaces. In practice, the tax structure adds roughly $4 in taxes to a typical 4-pack, which makes the product significantly more expensive for consumers and is slowing down growth of what could otherwise become a promising new tax category for the state. Bringing the treatment of the tax of the hemp-infused beverages more in line with alcohol would help the category grow while still generating tax revenue for the state. Reducing cannabis taxes and modernizing our approach to the emerging hemp beverage market will help Connecticut remain competitive and supports patients and consumers and keeps more commerce and tax revenue within our state. I thank you again for your time, and I urge you to support HB 5109.
Now look at that, under the 3 minutes. It can be done.
I've had lots of practice with general law.
Uh-huh. Questions for Mr. Fritz? Seeing none. Thank you, sir.
Thank you so much for your time.
Senator Joan Hartley.
Good afternoon, Mr. Chair and Madam Chair, and to all of the, to Senator Fazio and Representative Paletta and the distinguished members of the Finance, Revenue, and Bonding Committee. Wait, can you hear me?
Please proceed.
Okay, thank you. Thank you. So for the record, my name is Joan Hartley, and I represent the 15th Senatorial District, which is Waterbury, Naugatuck, and Middlebury. But I first of all want to recognize the leadership of this committee and its members. I appreciate your long hours and the diligence with which you approach your work as the stewards of the taxpayers of the state of Connecticut. And I am going to appear before you today with the CEO of the Stay Well Health Center, Don Thompson. And I speak also on behalf of the Waterbury delegation with regard to our comments. Originally, the bill was SB 158. It was an act concerning bond authorization, a $2 million bond authorization for the Stay Well Health Center in Waterbury. But today, we are going to direct our comments towards SB 85, which is the overall bonding bill. Chairman, Chairwoman, and members of the committee, Stay Well Health Center is as you would imagine, a nonprofit community health provider focusing on the greater Waterbury area. It's especially focused on the underserved, the uninsured, and those who are underinsured. And it provides quality health care without regard to the ability to pay. It's been in our community for well over 50 years, providing these services to vulnerable populations with a culturally diverse staff of about 240 employees. And they service about 125 plus patient visits a year. The bill before you is talking about capital improvements, and we're not talking about building rooftop gardens or any enhancements. We are talking about bare bone structures. We are talking about the ages of the buildings and the equipment that is servicing them, which is now quite old and taxed. There is interruption of services as a result. There is services that actually have to be canceled when equipment breaks down. And we are actually, at the time that I visited with the delegation, we were walking around pails for catching water that was coming in from the roofs. So we literally are talking about the roof over their heads. And I'm going to leave the rest of the comments to the CEO, Don Thompson, who can talk more specifically, but I'm very grateful to have this opportunity and also for your careful consideration of this request. Thank you, Mr. Chairman and Madam Chair.
Thank you. Senator Hartley, is Mr. Thompson going to be speaking?
Yeah, he's supposed to be on with me. Is he on?
Yeah, I'm upper left hand.
There he is. Okay.
Okay. Thank you.
Hi, Don. Thanks.
And John, thank you very much for the intro. As John mentioned, we're discussing Senate Bill 85, which would help us quite well. I'm Don Thompson, the President and CEO of Stay-Well Health Center. I'm proud to say I'm born, raised, lived, and still live and raise my kids in the city of Waterbury. I've been at Stay-Well for 40 years. And we've, I respectfully request support through state bonding funds to address critical, long-deferred facility upgrades, essential maintenance, replacement of aging dental equipment, and implementation of a modern electronic health record system. These investments are no longer discretionary. They are necessary to sustain access to care in Waterbury and the surrounding region. For instance, at our behavioral health site at 1309 South Main Street, we have numerous building leaks when it rains. It doesn't leak when it's not raining. We've had some of the Waterbury delegation visit, and they've seen the condition of the floors, the walls. The total request is $2 million. For more than 54 years, Stay-Well Health Center has provided essential community-based health care for Greater Waterbury residents.
You've reached the 5 minutes. If you could please summarize.
Okay. In essence, we have 31,000 visits in dental for 11,000 patients. We are it as far as dental. And over the years, both Waterbury and St. Mary's Hospital have closed down quite a few of their clinics, and those patients have come to us. I just want to summarize, too, in a short period of time. Despite our issues, we have Gold Tier Center Quality Leadership Award from HRSA. We're the only health center in the state of Connecticut to attain this. We also earn multiple community health quality recognition badges. And I think I'll stop there because I know you guys have a long day. But please, we could really use your help. And I appreciate the Waterbury delegation visiting and joining today.
Thank you both for your testimony. I'll just say that you couldn't be in a better place than having Representative Napoli being the co-chair of the bonding subcommittee. I think you're in a good place in that regard. And there are other members here today that are on the bonding subcommittee who are listening. So your message is being received. Thank you. Questions? Thank you all very much.
Okay, thank you.
Thank you, Mr. Chair. Thank you.
Thank you. Miriam Sutton.
Hi, good afternoon, Senator Fonfara, Representative Horn, and all the esteemed members of the Finance Committee. My name is Miriam Sutton. I'm Chief Operating Officer at Friends Center for Children. We serve over 150 children under the age of 5 and their families throughout 3 neighborhoods in New Haven. I'm proud to be a part of Child Care for Connecticut, a coalition of more than 26,000 parents, providers, and also employers working to strengthen Connecticut's early care and education system. I'm here today to urge you to strengthen the investment in the Connecticut Early Childhood Fund, which is included in SB 84. Last year's creation of the endowment, the Early Child Education Endowment, was a very important step toward building a stronger early child care system. It created a long-term strategy to expand access to childcare and improve wages for early educators, and also the funding in SB 84 was included, but it's not sufficient to achieve all of the goals. Across Connecticut, childcare programs are struggling to recruit and retain qualified educators, which would support with the expansion of bringing on more slots for families to have access. Wages are just too low, and many educators leave the field for higher paying jobs, even though they love working with young children. The endowment was designed to help address these challenges by building a stable, long-term funding source for childcare access and also educator compensation. However, without stronger investment now, the endowment will not grow fast enough, to our understanding, to make the meaningful improvements our system needs. So if Connecticut wants to expand childcare access and build a stable early childhood workforce, the endowment must be funded at a level that can actually support these changes. I respectfully urge the committee to increase the funding in SB 84 so the Early Child Education Endowment can deliver real progress for providers, families, and children. Thank you for the opportunity to testify today.
Thank you for your testimony. Questions, Representative Rader?
Thank you, Mr. Chair. Hi, Miriam. It's good to see you, if not in person, virtually. And I've had the opportunity to visit your centers in New Haven. Miriam, I want to just ask a question because I think it's really important in light of your testimony and I just spent 3 days at a policy conference on this. When we talk about educating our earliest, and I know you mean this in well-intentioned, is that we talk about it as in terms of early childhood education. And I'm sure you agree with that versus just child care. And so what I want to ask you is to elaborate on what you do at your center, because I think it's really innovative. And I hope in light of your testimony, you can explain why this legislation is so important, because I think models like yours really amplify that this is about educating our youngest minds in a really critical phase of their brain development, and how absolutely we need to support our educators, our early childhood educators, and what you're doing to support them. Because I think it's very, again, innovative, and it's not just about throwing dollars at a program, it's about really creating that innovation. So could you elaborate on that for me, please?
Sure. So at Friends Center for Children, we have a philosophy that is rooted in relationship building. Early education is not just about children having only academia or access to literacy or access to math. It's play-based learning. It's really about building brains, making sure they have the emotional responsiveness of their educators and caregivers to support them with growing all of the emotional intelligence that goes along with making sure that they are ready to learn. And so when we think about the representative who talked about why children don't show up and cross the door and all of those barriers, our program looks at all of those things as serving the child and their entire family. So we have an emotional well-being program which really looks at how families have different experiences and backgrounds that lead them to our door, that require us to know how to respond to those needs. So it could be being unhoused, or it could be having loss of employment. It could be racial or socioeconomic challenges. And so our emotional well-being program is responsive to that in ways such as having dedicated staff members who are going into classrooms, supporting individual children with different needs, also being there for families who may need additional support and resources that they need to be connected to outside of our center in order for their families to thrive. And the other thing is really thinking about the educators who are coming and showing up to do the work every day, and that they have the things, their basic needs met. And so our teacher housing initiative is one of those pieces from our emotional well-being program that it really has lent us the opportunity to provide wages to our educators that are dignified and that actually support their cost of living while they're doing the work that is supporting building the brains of our future generations. So those just briefly are, I would say, pieces in our program that speak to innovation, but also what has been successful in our service of families and children.
Thank you so much. Yeah, I just wanted to highlight that because I think it's really important when we're thinking about this endowment that we're making sure that we're empowering programs like yours to do the very best by our youngest learners and the educators that serve them every day. So thank you. Thank you, Mr. Chair.
Thank you.
Additional questions? Thank you. Dr. Michael Isikoff.
Sorry, we're gonna, yeah, thank you. You need to put your mic on, if you don't mind starting again. Sorry, we missed.
Start over. Sure. Good afternoon, Senator Fonfara, Representative Horn, and members of the committee. My name is Dr. Michael Isikoff, and I'm a pediatric oncologist and the physician-in-chief at Connecticut Children's Medical Center, the only independent children's hospital in our state, and where 56% of our patients rely on Medicaid. I have lived in Connecticut for more than 20 years, and my wife and I are proud to have raised our 5 children in Simsbury. I am deeply grateful to call Connecticut home, and I am proud to represent the children and families throughout our state who depend on Connecticut Children's. The state budget enacted last year removed our exemption from the hospital tax. This was a change we advocated for to improve our financial sustainability while also generating more federal revenue for the state. It's worth noting that Connecticut Children's is the only independent children's hospital in the nation that does not participate in its own state's hospital tax. Connecticut Medicaid payments cover 62% of adult hospital costs, but at Connecticut Children's, Medicaid payments cover under 51% of our costs. This underpayment threatens our organization's sustainability and ability to meet the needs of our state's young patients and their families. Our participation in the provider tax will allow the state to offset a portion of our Medicaid underpayment and while simultaneously leveraging additional federal dollars. Connecticut Children's needs state leaders to raise our Medicaid revenue so that our costs are covered at the same level as adult hospitals. Additional Medicaid funding would allow Connecticut Children's to hire more clinicians in high-demand specialties, expand services in our various locations across the state, and bring care closer to home for more families. Recently, we opened only one of 2 neonatal intensive care floors in our new tower because our low operating margin makes staffing on both floors unaffordable. Since opening the tower, we have had to turn away more than 50 babies who needed neonatal care because we did not have available space. Those families felt the impact of our low Medicaid reimbursement at a critical moment in their lives. The bottom line is, kids deserve better. When we underinvest in children's healthcare, we are making the decision to underinvest in our state's present and future. Every day at Connecticut Children's, we care for children with some of the most serious and complex issues, including children with cancer, sickle cell disease, and many other life-threatening conditions. Our participation in the hospital tax would help ensure that children across Connecticut, especially those covered by Medicaid, continue to have access to the specialized care they deserve without the need to leave the state for their care. I stand before you today not only as a physician and hospital leader, but also as a Connecticut resident and a parent. Please consider that the children we care for do not choose their insurance. They simply need care. And our shared responsibility is to make sure that care is available when they need it. Thank you again for the opportunity to speak to you today.
Thank you, Doctor. Questions? Co-chairperson Horn.
Thank you, Mr. Chair, and thank you for being here. I wondered whether we had conversations about including Connecticut Children's in the hospital tax last year. And my understanding at the time is that that was supported by this, CHA and hospitals in general. Is that your understanding?
That is my understanding, yes.
Thank you.
Thank you, Madam Chair. Doctor, a little bit off target, but with respect to your testimony, that tower was a great addition to not only your facility, but also to putting us on the map nationally. But did you not know that the Medicaid reimbursement would not support a second floor or level that you just described?
Yeah, thank you for your question. So I think it's important to recognize that the tower was critical to provide the care that children in the state need. And as you said, it will help put us on the map, but most importantly, will provide access to certain levels of care that we previously couldn't provide. That need must be covered by philanthropy and would not be covered by the operating margin of the hospital, in part because of the underinvestment from Medicaid. So we truly rely on philanthropy support to be able to build the tower.
Your testimony was that because of, you related the reimbursement level to the full utilization of the tower. Am I wrong in what I heard?
Right. I think the expectation is that over time that we'll be able to close some of that gap, but we need your help to be able to do that. At the time that we invested in the tower, we expected that we would be able to open in a staged process the different floors of the tower. I think that the challenge comes in the low operating margin that we currently have. We had hoped would start to close that gap so that we can open more of the floors as we proceed. What I think we didn't expect is the number of children that more urgently and more recently have needed our expertise, especially in the NICU setting, so that we ideally would move forward more quickly.
Thank you. And look, I'll just say that I couldn't agree with you more that we need to step up our game with respect to reimbursement on Medicaid for several reasons, some of which you've mentioned.
Thank you.
Thank you. Any other questions? Thank you very much. Lou Rinaldi.
Good afternoon, and it's a pleasure and an honor to be here speaking with two women who represent the town where I come from, Guilford, Connecticut. Thank you, Senator Cohen and Representative Rader. My name is Lou Rinaldi, and I am here to testify on Bill 5109, the tax adjustment for cannabis. Back in January, I authored a piece for the Hartford Courant talking about the need for this and putting forth some case studies based on other more mature markets, including the direct comparison to New York and the changes that they've made. Long story short, I do support this initiative. I think it's long overdue. I wish we were able to get it done sooner so that we could have saved some of our local businesses. I think it's time that we stop treating cannabis as something that needs to be addressed in a paternalistic and prohibitionist way and begin to acknowledge the fact that we have greenlit an industry here in the state. Obviously, nobody wants these products getting into the hands of children, and we have, as we've heard previously from Ben Zacks, we have strong measures in place to prevent that from happening. We also heard from Ben Zacks that he wants to match the tax rate of Massachusetts, and we've heard a lot about funding gaps. I would contend that as long as we're copying Massachusetts, we may as well copy the millionaire surtax that they have recently implemented. They have a 4% surtax. We could even get by with a simple 1% to 2% tax to fund not only education initiatives, but also transportation, roadways, those sorts of things. The pushback that you always hear is, well, what about the tax flight? What about if they all leave? And the data from Massachusetts shows in the years since they have passed their 4% millionaires tax, the population that it is applicable to has actually increased. So I think it's long overdue for us to start talking about this. Yes, even in an election year, I think it is vital for us to begin talking about more equitably funding the public good here in Connecticut. There's also a couple of loopholes in this bill that I'd like to point out. Unless I'm misinterpreting, I believe Section 1B2D explicitly exempts sales made by a delivery service to a consumer. I'm wondering if anyone who was involved with the drafting of this bill can speak to that, because by my reading, it looks like a loophole that incentivizes consumers to bypass traditional brick and mortar retail. I just want to get to some clarity on that. Another thing is a gross receipts valuation loophole. The tax is assessed on gross receipts without strict definitions for mixed retail transactions. So
You have reached
potentially
3 minutes. If you could please summarize.
Yeah, I'm getting there. Retailers could easily bundle premium cannabis products with high-priced non-cannabis merchandise to artificially deflate the taxable value of the transaction. And finally, there's a very strict no refunds clause. Section 1G explicitly prohibits the commissioner from issuing any refunds. And this is an administratively hostile provision that legally bars the state from returning refunds in the event of an audit proving overpayment, a simple mathematical error, or a valid customer return, inviting unnecessary legal risk. So yes, simplifying the tax code is the right move. Introducing heavy-handed mandates filled with structural loopholes is not going to yield the stable market that Connecticut deserves. And as I noted in my column for The Current, if we're serious about turning our currently moribund cannabis industry into the significant revenue engine it was promised to be, we need a hard reset. This requires more than merely tweaking tax rates around the edges. It demands a hopeful, holistic revisiting of cannabis regulation as a whole. So thank you for your time and consideration. I'm happy to answer any questions or if anyone has any clarification on that delivery exemption.
Thank you, sir. Questions? Thank you very much.
Okay.
Anthony Yoder.
Good evening. My name is Dr. Anthony Yoder. Professionally, I'm an internal medicine physician providing primary care in the North End of Hartford. I appreciate the opportunity to testify this evening. Good evening to Senator Fonfara, Representative Horn, ranking members, and honorable members of the committee. I came to Connecticut and completed my internal medicine training in 2015, and 2 years ago came back to UConn Health as an assistant professor of medicine after working in a federally qualified health center. This is to highlight that I've dedicated my career to the privilege of treating underserved populations, but also to advocate for policy which will support equitable access to healthcare for all residents of the state. I provide this testimony today in my capacity as a member and on behalf of the UConn Health chapter of the American Association of University Professors. Today, we ask the committee to strongly consider including in your revenue package the elimination of annual license renewal fees for physicians working at UConn Health, Connecticut's only public hospital, and for physicians working in other state agencies such as Corrections, Public Health, and the Department of Mental Health and Addiction Services. Much of the reason that I returned home to UConn Health is because of its mission to provide care to all residents in need, and I have been deeply gratified in the organization's ability to do this. Unfortunately, this is not without limits, as the recruitment of physicians, particularly for primary care, is difficult with patients waiting 6 months or more for primary and specialty care. I continue to experience the difficulty recruiting physicians to meet this need firsthand as a lead physician, seeing repeated applicants cancel interviews with or to turn down employment from UConn Health in favor of more favorable opportunities. While it may seem small, employers cover licensing costs in most physician contracts. As a result, UConn Health must compete with these private health systems, which often offer higher salaries with fewer administrative burdens. Elimination of license renewal fees would be a small but meaningful incentive that supports physicians who choose public service. Not taking steps to address shortages of highly trained physicians to lead healthcare teams leads to sharply decreased access with untenable increases in patient loads. It contributes to burnout and increased turnover, and in turn forces reliance on costly per diem or locum tenens clinicians, all of which disrupt the continuity of care. Waiving license renewal fees is a simple but cost-effective way to support workforce stability and growth. Additionally, medical student debt is rising. More than 70% of medical students graduate with debt averaging $250,000. And uncertainty in existing and future federal loan programs adds another level of instability. Connecticut currently ranks an abysmal 46 out of 50 states in retaining residents who have completed training. Covering licensing fees is a modest but meaningful form of support for physicians beginning their careers as we try to reverse this trend. The fiscal impact of the state would be limited. UConn Health employs approximately 450 physicians at $575 per physician annually. Eliminating these fees would reduce state revenue by roughly $260,000.
Your 3 minutes are up. If you could please summarize.
Sure. In closing, state-employed physicians provide essential care to vulnerable populations, including incarcerated individuals, patients with serious mental illness, and medically complex populations. Supporting and stabilizing this workforce strengthens the continuity of care and the public health across the state. Thanks for your consideration.
Thank you, Doctor. Questions? Thank you, sir.
My pleasure.
Francis Pollock.
In the interest of time, two of us have joined a panel together to be efficient for everyone.
If you both could identify yourself, that'd be great.
Hi, my name is Frances Pollock. And I'm Hope Chavez.
Thank you. Please proceed.
All right. Hi, everyone. My name is Frances Pollock, and I am here to support HB 5443. I'm the director of the Cultural Innovation Lab at Yale Ventures. The Cultural Innovation Lab is not an institution that is located in a traditional arts sector of the university. The Cultural Innovation Lab is located in the tech transfer side of the university. So it's also located in the profit center of the university and the side of the university that understands that public investment in infrastructure is the best way to wean individuals and institutions off of public subsidies. So you've heard today, and you'll continue to hear today, that we know that the arts are struggling. That alone is not a reason to invest in this bill. What is a reason is that this state is responsible for an incredible amount of incubation of some of the most powerful cultural brands globally. And they are brands that we actually have heard of. So this would be Annie, which was cultivated at Goodspeed, Sound of Music, cultivated at the Schubert, Oklahoma in the Heights. Even Hamilton was cultivated and incubated here in Connecticut. These brands have gone on to generate billions of dollars in revenue over decades. And there are theaters in Connecticut that were savvy enough and thought ahead to attach themselves to this type of upside. And as a case study, Goodspeed Theater has barely had to fundraise for 50 years because they attached themselves to Annie as a brand in 1978. So just 2 weeks ago, we at the Cultural Innovation Lab at Yale Ventures signed a contract with the Department of Economic and Community Development to invest in a program that would transition struggling nonprofit infrastructure into incubation hubs, which would institutionalize programs or institutionalize the model that Goodspeed piloted with Annie. DECD awarded us $1.7 million over 5 years to pilot this program. So you should not invest in this bill because the arts are struggling. You should invest in this bill because the arts are struggling and looking for a sustainable way to take care of themselves. Think about this bill as a catalyst for long-term sustainability in the arts and culture sector with the same logic that you would invest in any other high-growth, high-profit sector. We at Yale Ventures believe that the arts can be as much of a profit center as tech, healthcare, or manufacturing. And we intend to partner with you to create sustainable solutions for our cultural ecosystem, so long as there is a belief that we can count on the same support as other profit-generating sectors. Our current funding gives artists and theaters Business 101 training, but that's not enough. What this funding could be used for is to grow global brands that actually scale here in Connecticut. We have cultivated a mechanism for nonprofit infrastructure to stay attached to highly scalable for-profit IP. And this is a way for us to wean ourselves off of public subsidies that we have grown to eager to continue. So again, I'm eager to see this bill pass, not as a bailout, but a way of liberating nonprofit art sector from an over-reliance on public subsidies. Because we are powerful, we can take care of ourselves, but we do need support in transitioning our infrastructure so we can build the same sustainability found in other sectors. Thank you so much.
And I'll just jump in. Dear esteemed Finance, Revenue, and Bonding Committee members, it's good to see a lot of you again. I'm Hope Chavez. I'm the Executive Director at the Arts Council of Greater New Haven, which is a regional arts service organization, which is a lot of language that means we support the ecosystem of the 16 towns of Greater New Haven in Southern Connecticut. I'm testifying also to urge you to support HB 5443, specifically the section that would basically take roughly $50 million a year for the tourism fund. That $50 million a year would come out of the existing 1% meals and beverage surcharge. I want to reinforce this is not a new tax. It is not a tax increase. It's just a really smart allocation of existing collections today. So first, I want to tell you how that money gets distributed, and then second, why it's so smart to tie the meals tax to our sector. So once the bill is passed, I'm sure you all will agree.
So Hope, I'm
that
going to jump in here and just say, you're going to come up against the 5 minutes pretty soon. So consider this a question to you,
Sure,
but don't take advantage of it. Just
understood.
either speak very quickly or amend your, so you don't hear the clerk or the committee administrator admonish you that you're up against the clock.
I appreciate that.
Thanks.
I appreciate that. So the funds will go to the two agencies within the Department of Economic and Community Development, which are tourism and the arts, and then it will go to CT Humanities as well. This $50 million basically ties the sector of food service industry, which is greatly benefited by the arts and culture sector, which drives a lot of money towards them and allows a reinvestment of that tax back into our sector. We know that last year, or in 2019, sorry, that the tax generated over $100 million a year. And this kind of funding would radically transform and stabilize these agencies and Connecticut Humanities, which have had federal funding cuts, which are critical ways of getting not only investment into creative entrepreneurs, but also grants to artists, grants to arts nonprofits. And it's just a really savvy way to tie these two sectors together. So I urge you to vote in favor. And I'm happy to answer any questions you may have.
Are there questions? Seeing none, thank you both.
Thank you.
So before I call the next witness, I'll just say that, and this is not aimed at Francis or Hope, but sort of is. So as my very esteemed co-chair indicated earlier today, that if the first person uses 4 minutes of the 5 minutes, it's not helpful for the second person that they're cut off from their very important message. So we just say, split up your time in advance if you can, and give everyone a chance to be heard. Including the last person who will be on the list today. Cece Arcega, I'm sure I did not do that last name justice. Nope, okay, they didn't hear it then. Joseph Sokolovic.
Hello. Hello?
Yes.
Okay, greetings, members of the Finance, Revenue, and Bonding Committee. My name is Joseph Sokolovic. I serve as Vice Chair of the Bridgeport Board of Education. I'm testifying today mostly as an individual, and if you I express, I'm mostly my own. I'm here today to urge you to reject Senate Bills 84 and House Bills 5444, and to reject the governor's budget as it is currently funded, because they all reflect the same dangerous choice: protecting wealth at the top or shifting costs onto municipalities, school districts, and working families. Let's be clear, passage of bills, revenue bills, and budgets are a moral statement. And that statement is this: the governor and this Democratic majority will keep an unfair tax system in place if they vote for this bill. These proposals do nothing to fix our inequitable tax structure. They refuse to strengthen the one tool designed to be fair, the income tax. These bills fail to address preferential treatment of wealth and capital income. They fail to generate the revenue needed to meet the state's constitutional and moral obligation to fund public education equitably. In plain language, they lock today's inequity into law. Then comes the political sleight of hand. A one-time rebate, a temporary check, is not reform. It doesn't stabilize property taxes. It doesn't fund special education. It doesn't hire reading specialists. It does not bring back librarians. And it doesn't undo decades of chronic underfunding. What it does do is create an election year headline to distract from the governor's and potentially this body's reluctance to do the hard work of revenue reform. And the worst part, this gimmick is paired with real ongoing cuts to municipal sports. to the municipalities this body represents. Cuts to revenue sharing and the elimination of grants for our cities were counting on. For Bridgeport, that's estimated at roughly 1.6 to 1.7 million over the next 2 years. This is a city already strained by high poverty, a limited tax base, and rising costs. That is not fiscal responsibility. That's smoke and mirrors designed to fool the voting public. When state support disappears, municipalities are forced into two choices: either rise property taxes or cut essential services. Either way, working families pay first and students pay the most. There is no serious path to education equity without revenue reform first. The Bridgeport Board of Education supports bills that create new, sustainable, recurring revenue sufficient to fully fund the ECS at a level that begins to reflect real student need, starting by raising the foundation to at least between $16,500 and $17,000 immediately, and then indexing to inflation. That's why the Bridgeport Board of Education supports HB 5187, the fiscal guardrails 5133 to increase the highest marginal tax rates, SB 101 to establish a statewide property tax on high-income properties, SB 104 the capital gains surcharge. These are not radical proposals. They would create recurring revenue, enable real ECS reform, stabilize municipalities, and reduce our dependence on regressive property taxes. So the choice before this elected Democratic-dominated body is clear. You can protect the wealthy and advance SB 44 and HB 5444 and deepen inequality, or you can stand with the great majority of the voters in your districts who put you in those seats. It's time to take a stand. Who will you stand with? Thank you.
Thank you. Questions? Thank you, sir.
Have a great evening.
You do the same. Josh Hurlick.
Good afternoon, committee co-chairs, ranking members, and members of the Finance, Revenue, and Bonding Committee. My name is Josh Sherlock, Deputy Director of the Connecticut Higher Education Supplemental Loan Authority, also known as CHESLA, and I am here today to support Senate Bill 85. For over 40 years, CHESLA has helped Connecticut students and families access cost-effective education financing, and now also provides scholarship opportunities and financial literacy resources. CHESLA's mission has always been rooted in offering cost-effective financing options that promote responsible borrowing and support access to post-secondary education. The federal Grad Plus loan program is being eliminated effective July 1st. As institutions finalize financial aid packages and enrollment deadlines approach, graduate and professional students are facing uncertainty about how they will finance their education. Absent a reliable alternative, many students may turn to higher cost private lending options. Senate Bill 85 provides a targeted, fiscally disciplined approach. The bill authorizes up to $10 million in state GO bonds to allow CHESLA to stand up the Supplemental Graduate Student Loan Program established in Section 23. This authorization will let CHESLA deploy predictable fixed-rate student loans using its existing underwriting, servicing, and compliance infrastructure quickly and with accountability, so graduate students can make enrollment decisions based on affordability and stability, not uncertainty. In short, Senate Bill 85 equips CHESLA to deliver an immediate practical response to a pressing need, keeping graduate education within reach while maintaining strong fiscal oversight. Importantly, this legislation would position Connecticut to be the first state to implement a structured state-level response to the elimination of the Grad Plus loan program. It reflects a measured and proactive approach to maintaining access to graduate education financing. Senate Bill 85 preserves continuity for students, supports workforce development, and builds on a financing model that has served Connecticut residents responsibly for decades. While we strongly support Senate Bill 85, CHESLA respectfully requests that Sections 9 and 23 be made effective upon passage. Advancing the effective date will allow CHESLA to stand up critical program infrastructure immediately, including systems, servicing integrations, compliance frameworks, and outreach, so we can meet the upcoming graduate enrollment cycle and offer the program to Connecticut students without delay. and upon passage effective date for these two sections ensures that the state GO bond authorization for Chesla in Section 9 and the program's legal establishment in Section 23 are actionable now, enabling us to proceed with the technical build.
You've reached 3 minutes. You could please summarize.
Thank you. Enabling us to proceed with the technical build, vendor readiness, and borrower communications on the timeline students and institutions so desperately need. Thank you for your time, and I'm happy to answer any questions.
Thank you. Chair Horn.
Thank you, Mr. Chair. I wondered whether you could quantify the loss of the federal program here, what that means for students in Connecticut. What's the amount of funding that's being
So
lost?
the annual Connecticut Grad Plus loan volume is about $100 million. There is a grandfathering with the Grad Plus program. So anyone that has received a Grad Plus loan prior to July 1st can receive a Grad Plus loan to complete their education. Internally at Chesla, we have estimated an initial first year need of $30 million, in which $20 million would be a Chesla bond financing, and then supplemented with $10 million of the state GO bonds.
Great, thank you. Thanks very much.
Thank you.
Thanks, Mr. Chair.
Thank you. Any other questions? Thanks very much.
Thank you for your time.
Margaret Ann Tokushevsky.
Good afternoon, Senator, members of the committee. Greetings from the pizza capital of the United States, the city of innovation and invention, home of the Amistad story of resistance and resilience, and the most beautiful street in America. My name is Margaret Ann Tokushevsky, and I'm the executive director of the New Haven Museum. I'm submitting testimony today in favor of House Bill 5443 with respect to the need for increased investment in the tourism fund. A vibrant center for exploring the people, places, events, and ideas that shape and define the Elm City and its region, the New Haven Museum has been the go-to place for local history since 1862. In addition to our downtown museum, we are the stewards of the historic Party Morris House on the city's East Shore. We are proud to present nearly all of our programs for free. The museum preserves and shares the city's rich history through exhibitions, education programs, a research library, extensive photo archive, and community engagement. Our current exhibition, pronounced Abits, has brought in visitors from here and abroad who are exploring Connecticut's pizza trail, as well as locals who grew up within walking distance of the best pizza. New Haven's more than 75 pizza-making establishments provide residents with thousands of jobs, generate over 100 million in annual sales, and feed more than 2 million customers. Their stories are written into the fabric of this city, and we are grateful to our pizza royalty for allowing us to share the artifacts and stories behind those pies of family, love, immigration, and tradition. The museum is also a proud member of the Connecticut Freedom Trail, with our exhibition Amistad Retold centered on the experiences of 53 individuals who fought to achieve their freedom, and highlighted by the iconic portrait in our collection of their leader, Sangbe Pie, also known as Sinke. At the Party Morris House, famously burned by the British and later rebuilt by the Morris family, we tell the story of the development of New Haven's East Shore neighborhoods. So we are defined by our partnerships. Last month, we welcomed in the Year of the Horse with the El China Association at Lunar Fest, the state's largest celebration. Last Sunday, with the Jewish Historical Society of Greater New Haven, we celebrated Jewish women in the labor movement. This week, more than 100 fourth graders from New Haven Public Schools are experiencing our exhibition, Invitation to Engage, 60 Years of Long Wharf Theater and Beyond, learning the history of our regional theater and the excitement of making a production. It takes courage to run a history museum. Time and again, Connecticut Humanities has recognized this with support from the Cultural Fund during COVID, successive quick grants for our Amistad programs, a museum makeover grant for interpretive signage, and now an implementation grant for our America 250 exhibition, New Haven's Unfinished Revolutions, which will serve as a foundational space for K-12 school programs and lifelong learners. I urge you to pass this bill to make it possible to increase support for Connecticut Humanities and Connecticut Office on the Arts. Thank you for your time today.
Thank you for your testimony. Questions? Thank you much. Patrick Charmel.
Senator Farfara, Representative Horn. I'm Pat Charmel. I'm the president and CEO of Griffin Hospital. I have the privilege of serving as the chairman of the board of the Connecticut Hospital Association. Thank you for the opportunity to speak to you today. I did submit written testimony, which is fairly detailed. I'll just highlight a couple of points and I'm available to answer any questions that you have. I am speaking in opposition to the provider tax provision in SB 84. As you know, the current hospital provider tax has a disproportionate benefit to the state of about $508 million for the state and $124 million to Connecticut's hospitals. That's not consistent with the intent of these programs from the federal perspective that actually makes additional federal funding available through this mechanism to allow states to provide hospital payments that cover the cost of care. So clearly, Connecticut hospitals are disadvantaged about the way Connecticut currently implements this program. Now, there are some opportunities for us to work together to adjust the tax program to leverage more federal funding. I want to point out that 33 states have taken advantage of a mechanism that's now been eliminated called directed payment, where hospitals in those states are being paid Medicaid rates close to the average commercial rate, which in our state is more than 3 times what our current Medicaid rate is. The consequence of us and our underpayment is about $1.5 billion to hospitals, and the underpayment to physicians is another $250 million. Hospitals attempt to shift that shortfall to commercial payers, which is a burden for the state's employers and ultimately to consumers because employers are pushing more and more of the cost of private insurance to employees who can no longer afford it. In addition, again, this worked just barely, but look what we're facing now. Because of H.R. 1, Connecticut expects to see half of the expansion population, up to 150 Connecticut residents, losing Medicaid coverage come the first of the year. That means there'll be a problem with access to care, which is, from a public health standpoint, a travesty, but it will result in more uncompensated care for hospitals. Could be as much as 2% of revenue when hospitals in this state are barely breaking even from operations now, and many are losing money. And that's just one of many things that we're facing. Also, because of the enhanced tax credit being lost, even though the state is stepping in, on the exchange, we see more and more consumers stepping down to lower level plans that they
You have 3 minutes. If you could please summarize.
They might have a lower premium, but they have more out-of-pocket expense. And the consumers who are trading down to protect themselves from higher premiums don't have the ability to pay those higher out-of-pocket requirements in those plan designs. So that means, again, barriers to access to care and more bad debt for hospitals who can't afford it. So again, in summary, we have an opportunity to work together. The window is closing. The federal government is looking at provider tax programs. They already shut down the ability for new directed payment programs, which would have been a boon to us. And the administration was working with the industry to try and exploit that. That's gone. We have an opportunity to increase the take from the federal government to be able to provide fair and appropriate payments to hospitals. We can't let this opportunity pass. Thank you for the opportunity to speak to you.
Senator Cabrera.
Thank you, Madam Chairwoman. Pat, how are you?
Very good, Senator. Nice to
It's
see
so
you.
good to see you. Thank you for coming and testifying today. I know you're testifying in your capacity as chair of the association, but I was wondering if you could tell me a little bit about how this would impact a hospital your size in Griffin in Derby, which, as you know, compared to the other providers we're used to seeing, is a lot smaller. But mighty. I know you guys tend to punch above your weight, but serve a very a population, an ALIS population in my district that has high needs, and how certainly this would impact you on the ground.
Yeah, Senator Cabrera, thank you for that. I mean, Griffin sits on Division Street in between Ansonia and Derby. The residents of those two towns, 50% live in households that can't afford their basic living needs. So the things that I talked about with this shortfall in government payments, not only from Medicaid, but from Medicare as well, and actually Medicare Advantage is even worse, right? We don't want to be in a position to be able to have to shift costs to commercial payers because we know the people that we serve can't afford it. That's one. Again, what we're seeing is because of these shortfalls, hospital margins are shrinking. We are not making money from operations this year, which means we have to dig into our limited reserves. But we've lost independent hospitals in this state. Just in the last 5 years, we've seen hospitals become insolvent, right? And they're required either the state to take them over or to join another system who promised them the resources they need. That hasn't worked out necessarily for those hospitals. So you're right, independent hospitals, especially smaller community hospitals like ours, are probably more challenged, but this is something that cuts across the industry. And the proposal that we have to work with the state to leverage more federal dollars, we want the benefit to be proportional. We want to help every hospital in the state because each has its own unique circumstances, but they all are struggling right now and need support. So thank you for the question.
Thank you, Pat. I appreciate your testimony today. Thank you for lending your voice today. Thank you, Madam Chair.
Thank you, Senator, and thank you for being here today.
Thank you.
Next up, I think we have Willie Medina online. I can see you online, Mr. Medina, but I can't hear you.
Are you guys
There we go.
speaking to me? I'm not sure. I'm not you guys.
You are on now. We can hear you, and the floor is yours, sir.
Thank you very much. Good evening, Chair and members of the committee. I am here testifying against HB 5444. Physical guardrails should not guide our budget, but they should never should guide our budget, but they should never handcuff our ability to invest in children, cities, and the future of our state. That is why I urge you to oppose HB 5444 and reject the governor's budget as currently framed because both fail to confront the racial and income inequities that continue to divide what many have called the separated of the unequal Connecticut. HB 5444 is described as a neutral extension of the state's physical guardrails, but it is anything but neutral. It does nothing to add higher rate to the top, and it locks today's unequal tax structure into law. It guarantees that Connecticut's wealthiest residents, including the governor, continue to avoid paying their fair share, while working class and middle class families, like most of us, continue to shoulder the burden through regressive sales and property taxes. Connecticut already relies too heavily on taxes that fall hardest on renters, homeowners, seniors, and low-wage workers. The income tax is one of the only tools designed to ask more from those with more. Refusing to implement progressive reform simply entrenches a system that favors wealth while harming students and communities. That same class imbalance is embedded in the governor's re-election year gimmicks. One-time sales tax rebates are portrayed as relief, but they are temporary and politically convenient for him. A short-lived $200 check does not fix rising rents, soaring property taxes, or chronically underfunded schools like in our city in Bridgeport. For my part, I will support legislation this session only if it creates new, sustainable sources of revenue necessary to fully fund the educational cost sharing formula, not just for at today's inequitable level, but as a level that allows the ECS Foundation to be raised immediately to $17,000 and an index to inflation each year so that funding reflects real student needs. The Bridgeport Board of Education, which I'm a member, supports several proposals that move us in that same direction. HB 5187, HB 5133, SB 101, and SB 104. Together, these bills ask those with the greatest ability to pay to contribute more fairly while generating the recurring revenue necessary to support our students in our community. Those proposals are not radical. They are responsible.
You've reached the 3 minutes. Could you please summarize?
Thank you very much. You can advance HB 5444 and a budget that protects wealth while underfunding education, or you can reject the path and instead pursue equity using the bills already before you to raise the ECS foundation, strengthen municipalities, and invest in the students and our leader with his Bible and the communities that have been asked to wait far too long. Luke 12:48 says, we are reminded that to whom much is given, much is required. A fair tax system should reflect that simple truth. Those who have the most should contribute the most so that every child has a fair chance. Thank you very much. Revenue reform first, educational equity next, municipal responsibility always. God bless you.
Thank you.
I think
Seeing
Go ahead.
no questions, again, thanks for being with us.
Have a great night, guys. God bless you.
Thank you. You too. Next up, we have Hope Ledford. Nope. Nancy Tracy. No Nancy Tracy in the room or remote. Nope. Elaine Carroll. Okay.
Good evening. Thank you, Senator Fonfara, Representative Horn, Senator Fazio, Representative Paletta, Senator Cabrera, Senator Miller, Representative Constantine, Representative Rader, and the distinguished members of the Finance Review and Bonding Committee. I'm Elaine Carroll, CEO of the New Haven Symphony Orchestra, as well as a board member of the Arts Council of Greater New Haven. I appreciate the opportunity to share my strong support of HB 5443, dedicating 50% of the revenue generated by Connecticut's existing meal tax and beverage tax to the tourism fund is a smart investment in arts, culture, and tourism programs. By dedicating a recurring revenue stream to the arts, this provision will create stability throughout the cultural ecosystem that makes Connecticut a great place to live and to work. Using the New Haven Symphony Orchestra as an example, public funding makes possible our family concert series, which brings free performances to Ansonia, Middletown, New Haven, and Shelton. This spring, we are partnering with the Beardsley Zoo so that each concert can feature live animals, and there'll be a special performance at the zoo. This project introduces thousands of children to live music, many attending a concert for the first time. Public funding also supports NHSO's nationally acclaimed Diversity, Equity, and Inclusion Fellowships that provide opportunities for underrepresented musicians, conductors, arts administrators, and board directors. The fellowships create jobs for young professionals and bring national funding into Connecticut while ensuring that our symphony stage reflects the diversity of our community. NHSO also brings national funding to Connecticut for our America 250 concerts, which amplify historically marginalized voices as America looks toward her next 250 years. Your symphony takes pride in collaborating with Connecticut arts organizations and artists to create concerts that authentically represent our community. Sharing the meals tax on an ongoing basis will create an environment where the arts thrive. It will make deeper collaboration and multi-year program planning possible, and thereby our performance more inclusive and inspiring. When arts funding is cut, HB 5443 will guarantee that Connecticut's creative sector does not have to absorb such losses alone. Economically, the New Haven arts sector generates over $160 million and supports more than 3,000 jobs. Every dollar the state invests in the arts returns at least $7 in economic activity, while also improving quality of life and helping to attract new businesses to our state. The added investment included in HB 5443 dedicates an existing income stream as an investment to support growth and vitality in the economy in an important new way. We want to put these funds to work for Connecticut's creative communities. Bringing joy to Connecticut citizens is what the arts do best, and this funding will amplify our impact on the community, serve to educate youth, and foster a vibrant cultural environment. I respectfully urge you to vote in favor of HB 5443 maintaining the provision dedicating 50% of the meals and beverage tax to the Tourism Fund for Arts, Culture, and Tourism. I thank you for the opportunity to testify.
Thank you for being with us. Seeing no questions, have a good rest of your evening. Next up, we have Carl Torella, sorry, need my glasses.
Thank you. Senator Funfar, Representative Horn, Senator Fazio, Representative Paletta, and distinguished members of the committee. My name is Carl Torella, and I'm the owner of Butter Cannabis, the Connecticut licensed equity joint venture operating 7 adult use and hybrid locations across the state. We appreciate the opportunity to express our support for HB 5109, which would replace Connecticut's current cannabis tax based on total THC content with a 10.75% excise tax on retail sales. Butter Cannabis supports this proposal because it would create more predictable, transparent, and competitive tax structure for both consumers and Connecticut businesses. The current potency-based tax system is complex and results in effective taxes often being higher than what they were initially intended. Further, this often makes it difficult for consumers to anticipate final prices at the register. A flat excise tax based on retail price would simplify the system and make cannabis pricing easier for consumers to understand. It would also help address Connecticut's relatively high effective tax rate on cannabis products, which currently approaches 30%, compared to approximately 20% in neighboring Massachusetts. As a result, retailers near state borders regularly see consumers traveling out of state to purchase less expensive products. Additionally, legal operators continue to compete with unregulated and illicit sales. Illegal smoke shops and the black market are our common enemies. A simpler and more predictable tax structure would help make legal regulated cannabis more competitive. As Connecticut's adult use market continues to mature, updating the tax structure to a straightforward excise tax would reduce administrative complexity, improve competitiveness with neighboring states, and help retain both consumers and tax revenue within Connecticut. Butter Cannabis respectfully urges the committee to support HB 5109. Thank you for your consideration.
Thank you, sir. Any questions? Being none, thank you again for being with us today.
Thank you.
Next up, Courtney Parkerson.
Good evening, chairpersons from Farah and Horn, ranking members Fazio and Paletta, and distinguished members of the Finance, Revenue, and Bonding Committee. I'm Courtney Parkerson, and I'm here on behalf of the Connecticut Project Action Fund, an organization that advocates to make Connecticut work for working class people. And we submit testimony in response to Senate Bill number 84, Enact Concerning Revenue Items to implement the governor's budget. Last year, Connecticut made a historic commitment to families with young children by establishing the Early Childhood Education Endowment. The endowment creates the opportunity to deliver what decades of research have shown. High quality early care and education is the best investment we can make as a state. It yields lifelong benefits for children, financial stability for families, and measurable gains for the economy. The endowment presents the possibility to reorient Connecticut's early childhood education system from one built on temporary, discrete, and fragmented funding streams to one anchored by a permanent state-owned and operated fund. Perhaps most importantly, the legislation that created the endowment emphasizes affordability as a key objective. It states that as of July 1st, 2028, families accessing childcare through the endowment would pay no more than 7% of their income, and families earning less than $100,000 will pay nothing. The legislation recognizes the reality that tens of thousands of Connecticut families face on a daily basis. Childcare is a significant and often overwhelming financial burden for working class families in every part of our state, and affordable, accessible childcare is key to children and families' future. To make good on the promises made last session, especially affordability for working class families, we as a state need to be clear about our continued investment needed to fund it. To cover the 7% cap on parent fees and 0% for families earning less than $100,000, the endowment must contain a minimum of $1 billion by July 1st, 2028. $100 million is needed to disperse to cover, and according to the legislation, up to 10% of the endowment can be spent in 2028. It is worth noting that this minimum will cover affordability only for the current supply of slots. It does not cover the cost for additional slots or rate increases that will meaningfully increase educator salaries, which are also incredibly important. Put another way, the endowment would need to contain $1 billion by July 1st, 2028 to cover and cap parent fees for only the current supply of early start childcare slots. To reach this $1 billion benchmark, Connecticut's legislature must deposit at least $300 million in the endowment this year to keep us on track. Without this investment, the state will be forced to walk back its commitment of affordable childcare 1 year after legislators and the governor made it. While the policy milestones accomplished last
You
legislative
have reached the
session
3 minutes. If you could please summarize.
to establish the endowment are worthy of celebration, the hard work of ensuring that we deliver on its promise is only beginning. We need the legislature to deposit at least $300 million this legislative session to follow through on Connecticut's promise to increase access to affordable childcare for all Connecticut families. By sustaining a commitment to the endowment, Connecticut can ensure that its promise to families will outlast fiscal cycles. Thank you.
Thank you. Representative Farrar.
Thank you, Madam Chair. Thank you, Courtney, for eloquently putting forward really the task that's in front of us. I did just want to follow up on some of your comments as representing an organization that really is a true philanthropic partner in supporting early childhood education. And I was hoping you could speak to really why, as a state, this ongoing sustainable and significant investment is so needed, and why, unfortunately, we can't rely on philanthropy to kind of fill the holes of these needs.
Yeah, as some of the speakers before me have discussed, I mean, the endowment was set up as an endowment, and so we are only spending a portion of that every year and really relying on that initial corpus to grow and then to benefit from those disbursements. And so in order to be able to cover the commitment made, that corpus needs to be significantly large, and it needs to be much larger than any philanthropic organization in the state would be able to cover. And so it really does rely on the commitment of public resources to grow that corpus to the size of $1 billion by July 1st, 2028, in order for the state to make good on this commitment that it made to families around affordability.
Thank you for that. And again, thank you to you and many other partners that are out there who are contributing in charitable ways to many of our children's needs. But as you said, for us to make the investment that is so dire needed in our children's future, it really is required on us as a state, just like we commit to K-12. So thanks for highlighting how those investments pay off, and appreciate your time tonight. Thank you, Madam Chair.
Thank you, Representative. Seeing no further questions, thank you for joining us. Next up, we have Jillian Webb.
Can you hear me?
Yes, we can.
Good evening. Thank you for the opportunity to testify today. I'm here regarding SB number 85. My name is Jillian Webb, and I'm the Senior Director of Developmental Services at Catholic Charities, Archdiocese of Hartford. Catholic Charities is a family and children's human services agency that employs over 370 human service delivery professionals, and we provide services to over 11,000 individuals and families without regard to race, religion, or economic circumstances each year. As a multi-service agency, we serve adults and children with significant mental illness, substance use disorders, physical and intellectual disabilities, and victims of domestic or community violence. Our services also include early childhood education, infant toddler care, elderly services, as well as family support and education. In the Developmental Services Department, we have 7 24/7 community group homes throughout the greater Hartford area, 2 day and vocational programs, and a recreation program for individuals with developmental disabilities. We're requesting state bond funding to repair and renovate our building and grounds at 652 Willard Avenue in Newington. The building is about 70 years old, and it used to be an old school. This former school building currently offers 3 important Catholic Charities programs serving individuals with intellectual disabilities. a day support program, a group supported employment program, and a community recreation program. The building is extremely spacious. It has a huge gym and a kitchen that would be renovated. In addition, it has a big parking lot and it is easy to get to and from the highway, and it is also on a bus line, so it's very accessible to the community. We would love to continue to provide services in this building. However, it is in need of significant repairs. Currently, we serve 53 individuals in our Newington site and continue to accept referrals for all programs. Many of the individuals we support have significant medical and/or behavioral challenges. Our staff work with them every day to build skills and develop coping strategies and to participate more fully in their communities. The building and grounds at 652 Willard Avenue require significant renovation in order to remain safe, functional, and welcoming for the individuals we serve. The proposed renovations would include a new roof, replacement windows and fascia, removal of asbestos and outdated boiler, sub-slab plumbing repairs, bathroom renovations, upgrades to security and electrical systems, repaving of the parking lot for safety, installation of drop ceilings, new commercial kitchen equipment, gym floor resurfacing, and general building improvements. These improvements will also allow us to expand our programming and increase our day program capacity by at least an additional 30 individuals. Renovating the gym and other
You've
spaces
reached
will
3 minutes.
allow,
Can you please summarize?
yes, well, renovations would help us to expand physical and recreational opportunities for participants.
One more.
These services are critical for the health and well-being of our participants. Replacing windows and fascia would help to regulate the building's temperature during the summer months. Occasionally, we have to close due to extreme heat. State bond support for this project would allow Catholic Charities to maintain a safe and accessible facility, expand services to more individuals with intellectual disabilities, and strengthen our ability to serve the Newington community for years to come. Also, we would expect that the Newington community could use the building for events and gatherings. Thank you for your consideration, all the work that you do for Connecticut. Thank you.
Thank you. Representative Farrar.
Thank you, Madam Chair. Hi, Jillian. Although I do not represent exactly where you're located in Newington, I certainly represent a part of Newington. I did just want to ask in regards to the potential expansion, is there an ongoing wait list or ongoing needs that you're aware of in the community that are really essential and part of why you want to improve the facility?
Yes. So right now we are accepting referrals. However, we do have a wait list for our one-to-one individuals and two-to-one individuals, meaning they require either one or two staff to support them. And our building just doesn't support those needs for right now.
Thank you. Thank you for that and for sharing that detail. I'll definitely look over it. Thank you, Madam Chair.
Thank you.
Thank you, Representative. Seeing no further questions, next we have Adam Kay. No. How about, yes, Kay Merrill. Merrill Kay, sorry, looking at you and calling your name in reverse.
Good afternoon, Senator Fanfara, Representative Horn, Ranking Members Fazio and Paletta, members of the Finance Committee. My name is Merrill Kay. I'm the Executive Director of the Connecticut Early Childhood Alliance. The Alliance brings together over 80 organizations dedicated to improving outcomes for young children through policy change. I want to thank you for this opportunity to talk about the governor's proposed revenue package. Last week, a child care center in Manchester closed, leaving 40 families scrambling to find care so they could go to work this week. Now, what does that have to do with the governor's revenue proposal? Let me explain. Last year, you passed SB 1. That bill sets us on the road to transformative change for our early care and education system. It holds the prospect of reaching universal preschool by 2032, I mean. It would make care affordable for families, raise wages for early educators, and expand the system to serve all the families that need it. The promise of this program is, the first promise is that in July of 2027, this program will be free for the families below $100,000 and affordable for everybody else by not charging them more than 7%. The system currently serves 18,420 children. And SB 1 also set out a novel way of paying for all of this through transfers of the unappropriated surplus. This year, the governor's proposal is that we would transfer $129 million from the unappropriated surplus to the early care and education, or the early childhood education endowment. Here's the problem. In order to make that first promise in July of 2027, that it will be free for families under 100,000 and not cost more than 7% for the roughly 10% of the families over 100,000 in the program, you need to have $100 million coming out of the endowment each year. And that makes this year's deposit into the endowment really critical, because when you've got money in the endowment, it can earn returns in the market. If you wait until next year to try and catch up, it's that much harder. So what I'm asking you to do is to purposefully reverse engineer the endowment deposit. You have various ways in which you are looking at the money that will be impacted by the volatility cap, other ways in which you count things to as to what ends up as the unappropriated surplus.
You please 3 minutes, if you could please conclude.
Accepting the governor's proposal as is a failure to be proactive, and it will have severe consequences. If there's not enough money in the endowment in July of 2027, there are two choices: either fund fewer slots or fund at a lower rate. And both are bad options. If OEC funds fewer slots, think about the phone calls you're going to get from the programs that have been funded for 25 or even 50 years in your district, and the calls you get from parents who've lost a subsidized slot. Alternatively, if programs are funded at an amount that does not cover the lost revenue, the money that they're going to lose from parent fees and from the Care for Kids program, then you just have a whole bunch of programs dying a slow death. And the havoc that we saw in Manchester last week will be repeated across the state.
I will, yes, allow you to finish so that, and I will ask you a question, and I know that at least somebody else will have a question as well. I wonder whether you could, we have obviously heard a lot of testimony, a lot of concern about our ability to continue to fund the trust fund at the level that we anticipated when we created it. And I wanted to clarify one piece of it that you mentioned, which is the commitment to, in 2027, that childcare be free to families earning less than 100,000 and limit of 7% for those above that. But there is a critical difference there. A critical piece of that obviously depends on how many seats are available. And that's it, as I understand it, it's not a guarantee that every family is going to have a seat available by then that they can then access at that. So I wonder whether you could just give a little clarity, a little more information to how many seats we anticipated having by then.
So at this point, the program is serving 18,420 seats. And the lost revenue from those enrolled children from the combination of the lost parent fees and the lost Care for Kids revenue that funds those early start programs, along with a few other things that are laid out in the law, like the money for a healthcare subsidy. Those things all add up to over $100 million. So without serving any more children, by 2027, you've got to have $100 million coming out of the endowment just to maintain the system, making it affordable and free. We all want to grow the system, and we all desperately want to raise wages for the early educators. That will be a critical step for any expansion, because programs are desperately trying to hang on to staff that they have now, who keep looking at, the second job is giving me more hours and I need to earn more so that I can keep up with the cost of inflation. So if we just rely on sort of the leftovers of surplus without being proactive and thinking about how do we make sure that we produce the surplus to have a deposit, we will fall short. I don't know if I answered the question.
Yes, I
Yeah.
think you did. Representative Farrar.
Thank you, Madam Chair. Merrill, you somewhat got at why we would need $100 million to fulfill the promises
Yeah.
next fiscal year, but I was hoping you could explain that in more detail, because I think all of those uses make clear why they're needed and why you couldn't have one over the other.
Sure.
If you could you
Um,
walk us through that a little
Yeah,
bit?
and there is a chart in my written
Oh, okay.
testimony if you want to go back to look at it. But since I'm sure you don't all have the testimony open in front of you, the estimate is that roughly 85 to 90% of the families in the Early Start programs are under $100,000. So their parent fee revenue disappears, and then some portion of the revenue currently paid by fees paid by families over $100,000. That'll also reduce. The estimate is that that's about $39.5 million based on the data that we got from OEC in a Freedom of Information request. And then the estimate is that roughly 15% of the Care for Kids money gets used in Early Start programs. We spend $288 million on Care for Kids, state and federal money, so that comes out to about $43.2 million. The healthcare subsidy I mentioned is $10 million. Then there are a couple of smaller things. There's $4.7 million for the local planning, the local governance partners that are in all the communities that have Early Start. There's a little bit for scholarships, $1.4 million, and then there's a little bit of money for OEC to administer all of this. That comes out to $101.8 million.
Okay, thank you, Merrill. And I will definitely look at the testimony clearer on that. Just one other question. I know certainly in putting forward this historic opportunity and passing it and looking towards the future with all the strategic goals that the Early Childhood Endowment would meet, we definitely put our stake in the ground as a state in making sure that we are starting to fund the early childhood care system and supporting families and businesses. Just to provide greater clarity, I know for me as a reminder is this is really also just one piece still of the investment that's needed around early childhood care and education. And I know you often are able to speak to how kind of just, kind of disparate and out of whack, our investment is in early childhood care and education versus K-12. And I was hoping you could put in context what we're doing here with the endowment and the other funding we might have for early childhood care and education, but the differential still between that and K-12.
Yeah, so the difference between what's spent on K-12 is, I wish I had the numbers off the top of my head, but you're talking in the neighborhood of 17 to 19,000 per kid in K-12. And first of all, we are subsidizing a small fraction of the children in the early care system. All told, we spend $200 million on Early Start out of the general fund, and right now about $19 million out of the endowment. and 288 million for Care for Kids. So that's it compared to something like 6 billion in K-12 education. Now, there obviously are a few more grades involved or cohorts involved, but there's a huge difference. And when you think about the cost of K-12 with a 1 to 20 or 1 to 25 ratio in a classroom versus in an early care setting where you can't have more than 10 children per staff in a preschool, and it's 1 to 5 for 2-year-olds, and 1 to 4 for children under 2. So that's just much more staff that's needed. It's why throughout the process, it's the early educators who've been probably the biggest subsidizers of the system because they've been working for really low wages.
Thank you. Thank you for making that comparison for us. Appreciate it. Thank you, Madam Chair.
Thank you, Representatives. Seeing no further questions, thank you again for being with us and for being with us for a while today.
Okay.
Next up, we have Matthew Streckle online, I believe.
Thank you very much. It's Streckle. I appreciate it. Senator Ferrara, Representative Horn, leaders of the Finance, Revenue, and Bonding Committee, and esteemed Connecticut General Assembly members of the Finance, Revenue, and Bonding Committee and the Connecticut Legislature. I'm Matt Streckle, resident of Lyme, also serve as Senior Director of Institutional Advancement for the Florence Griswold Museum in Old Lyme, and I'm speaking today in support of House Bill 5443. It would be wonderful if my colleague Pete Steer, the museum's director, would have been able to join us today, but unfortunately he is not, so I'm reading this as a joint statement. We speak only for our institution, but expect that our position is consistent with many others here today, particularly those responsible for preserving art and its historical context for future generations, and those whose missions include sharing rich cultural offerings and educational experiences with their audiences. Ours actually is a rather large audience, given the national recognition works created on our campus have within the context of American art. We know that there's no debate that this work is important, even when other priorities test the budgets and follow the whims of a changing collection of decision makers. Preserving art, history, and landscapes is an essential task of organizations like the Florence Griswold Museum, and we take that very seriously. Since 2010, Connecticut Humanities has supported close to 20 projects and programs at the museum, ranging from quick grants at $4,999 to implementation grants of $35,000. We simply could not successfully mount exhibitions, plan and explore historical programming, or provide important outreach for students without the support of CTH. Admittedly, since federal cutbacks with the NEH that CTH so heavily relies upon, we have not been able to receive our usual levels of funding from Connecticut Humanities. Support of HB 5443 will provide CTH with a sense of security to be able to more fully support museums like ours. Further, we receive funds from Connecticut Office of the Arts as well as the Connecticut Arts Endowed Fund. On average, this support is approximately $60,000 placed towards our operating costs. In addition, if preserving historic buildings, works of art, and the role that they have in reminding where we've all come from isn't already expensive enough, finding ways to make them accessible, intellectually stimulating, and advancing not only our own reputation, but that of the state of Connecticut as a place where important experiences are possible is even more so. We take this responsibility very seriously. We are a Connecticut destination. We're a reason that people drive hours to visit, eat, buy, learn, relax, and enjoy what we have to offer.
Your 3 minutes are up. If you could please summarize. Thank you.
All right, thank you. Connecticut is made better by our work, both culturally and financially. Each year, we serve approximately 20,000 school children across the state, both on our site and through our FlowGriz on the Go van. During the month of October alone, the museum welcomes over 10,000 visitors to our campus, an estimated 25% of whom are out of state, furthering our contributions to tourism and the economy. I appreciate the opportunity to share today and hope for your support on HB 5443.
Thank you for that. And you can be assured you have had plenty of company testifying in favor of this today. Representative
I appreciate
Rader.
it. Thank you.
Thank you, Madam. Hello, Mr. Streckle. I just wanted to take this little moment of privilege to thank you for the work that your museum does. And I have one of the most lovely memories of my children having a field trip there and painting along the riverside, and just the impact that it has had on one of my children who's now studying art in college. But I really want to thank you, as our good chair here inferred, is that we've had a lot of testimony today in support of this legislation. And just want to thank you for your testimony. That's all. Thank you, Madam Chair.
Thank you, Madam Vice Chair. Seeing no further questions, thanks again for sharing your perspective with us.
Thank you very much.
Next up, we have Sean Reel.
Hello, can you hear me?
Not very well.
Oh, how about now?
There we go. Now we can hear you.
All right, I will yell into the camera then. Thank you very much, and good evening, members of the Finance, Revenue, and Bonding Committee. My name is Sean Reel. I'm the Director of Sales Operations for Earthlight Technologies. We are a local residential and commercial solar developer based in Ellington, Connecticut. I oppose HB 5442 as drafted, but I would like to propose language that would permit the legislature to achieve its goals of enacting a uniform capacity tax throughout Connecticut municipalities. I want to start off with the intent of this bill, which is grounded in Public Act 25-173, which was passed last year, which broadly defined and created a uniform capacity tax for solar arrays deployed that met some specific criteria. Systems that receive permission to operate on or before July 1st of 2026, and particularly solar arrays that are not installed on state-owned land, brownfields, residential rooftops, commercial and industrial rooftops, and solar canopies. So it seems that the goal of this bill is to align the timelines of the uniform capacity tax with existing property tax exemptions. What this bill does, though, is take away exemptions granted for any systems that are energized before July 1st of 2026. So residential systems that have previously been covered under 57A of the existing property tax, as well as commercial systems that were previously governed under 57D. So this would in effect put thousands of systems that have been installed and deployed residentially and commercially through a mechanism by which towns could then enforce or bring in new property tax outside of the uniform capacity tax. What I'd like to propose, and this is echoing Will Herschel from Verigy, instead of modifying the language in 1281 57F that would impose new assessment rules for all systems, I would propose modifying the start date on the uniform capacity tax from July 1st of 2026 to 2025. This would then leave the current property tax exemption language in place for residential solar customers who've had systems deployed in excess of years ago, as well as commercial rooftop systems that are sized to load. I thank you very much, and I'm open to any questions.
Thank you. So I will, first of all, have you submitted written testimony?
I did, but it has not published yet.
Okay. Well, if you could just, email it to the committee and I will take a look at it. I will assure you that it certainly was our intention, and we had very specific conversation about continuing the exemptions that you mentioned. And so I'm happy to look at language that your suggestion to make sure that we have done that. But you can imagine we've had quite a lot of conversation, and the intent here really was just to correct a date mismatch that we had in the legislation we passed last year. So thank you. Any other questions? Seeing none, again, thank you.
Thank you very much for your time.
Next up, we have Nicole Burns. Hi, welcome. You've been around all day, I think, or most of the day.
I have been. It's been great. Thank you for having me, Rep. Horn and members of the Finance, Revenue, and Bonding Committee. My name is Nicole Burns, and I serve as the Executive Director of the Connecticut Cannabis Chamber of Commerce. We are an organization representing licensed cannabis businesses, operators, and stakeholders across the state. Our members collectively employ hundreds of Connecticut residents, invest tens of millions of dollars in local communities, and contribute significant tax revenue to municipalities and the state. We are proud to support the development of safe, responsible, and economically viable cannabis industry in Connecticut. HB 5109 addresses one of the most significant structural challenges facing the legal cannabis market in Connecticut, the current cannabis tax framework. Today, Connecticut's tax system is both complex and comparatively high, with the potency-based tax layered on top of the state sales tax and municipal tax. In practice, this structure can result in consumers paying effective tax rates of up to 35% depending on product potency. This creates confusion for consumers and adds significant administrative burdens for operators. The time and costs required to calculate cannabis taxes under the current system are substantial. Operators must spend considerable time each month determining the appropriate tax rates and reconciling discrepancies. This complexity also increases administrative work for the Department of Revenue Services. A simpler and more predictable tax structure would benefit businesses, regulators, and consumers alike. More importantly, Connecticut's tax structure places our legal market at a serious competitive disadvantage compared to neighboring states. States such as Massachusetts, Rhode Island, and New York rely on simple percentage-based excise taxes. These systems are easier to administer and result in more competitive consumer pricing. As a result, Connecticut is currently losing an estimated $150 million to $160 million in legal cannabis revenue to neighboring states, as consumers across state lines continue to purchase products at lower prices. At the same time, the current pricing structure unintentionally encourages consumers to continue purchasing from other states and from the illicit and gray markets, where no taxes are paid and no product safety standards exist. If legal businesses cannot compete on price, the regulated system cannot fully achieve its goals of consumer safety, product testing, and responsible retail. The solution is straightforward: establishing a fixed excise tax rate of 10.65%, aligned with Massachusetts, would help stabilizing price, increasing competitiveness, and ultimately grow both legal sales and state tax revenue. A more competitive legal market will attract consumers back into the regulated system where products are tested, tracked, and sold responsibly. Legalization has already occurred. The focus now must be on ensuring that Connecticut's legal market is structured in a way that allows it to succeed. By simplifying the tax structure and aligning with our regional market, Connecticut can strengthen its regulated industry while protecting public health and maximizing long-term revenue. Thank you so much, and obviously we are in support of the bill.
Always good to conclude with that.
It's a lot.
And under the 3 minutes too, so well done.
Oh, look.
Gold stars all around. Any questions? Seeing none. Oh, I think seeing none. Yeah, thank you for being
Thank you
with
so much.
Next up, we have Chris Reagan. Reagan.
Thank you, Representative Horn and committee members. I'm in support of 5443 for the tourism funding. I'm the chairman of the Eastern Regional Tourism District that represents 41 towns. I'm the second vice chair of the Connecticut Tourism Coalition and also co-owner of Old Mystic Village, where we have 53 tenants and we have 550 employees that work there. And we get 2.2 million people that came through our property last year. So funding really matters about tourism and advertising. And the state of Connecticut has lagged behind every other state. And to give you some example, a tourist in Connecticut, 52% of it is residents in the state of Connecticut. To give you an example, the average stay in Connecticut is 1.2 for a stay at a hotel. Rates, and comparable rates to Rhode Island. Rhode Island gets an average daily rate of 218. Massachusetts, 229 for an average daily rate. Vermont's $184. Connecticut is 152. That's because we don't spend money in marketing, and we need to spend the money. And if we do, you'll get a $9 to $10 return on every dollar you put in here. So if you put 25 million into tourism advertising, you're going to get 200 million back. And this could fund some of the stuff that they're asking for. And this, I mean, it's a big business, and it's frustrating because I've been working on this for a long time, and it's the same thing. Get 4.1, 4.2, 4.5, and it doesn't necessarily move the needle for us because you got line items you got to spend, and the actual spend on advertising one year was $1 million. That's not good enough, especially for an industry that does $18.5 billion in economic impact. And so I've commissioned a study that I'm working on right now with Fred Cartensen from UConn. And that's going to be done at the end of August, beginning of September. And it's going to be the most comprehensive study we've ever done on tourism. This is coming from the private sector. And I'm going to make sure every single legislator gets a copy of this. And I want it on the governor's desk because I want to make sure that they understand that we are big business in the state of Connecticut and we need to be treated that way. And it's very frustrating that we have to come up here and, you know, hey, we could be on my second drink at a nice restaurant right now instead of come up here and testify, you know, but you guys are only 2/3 through the list. So you still got another third to go. So I get to go after this. But, you know, it's very frustrating, but I don't think people take us seriously. And a couple missed opportunities that we're having that were missed this year, the 250th anniversary of the country. You can't advertise it right now if you're even going to try to get some funds.
Your 3 minutes are up. If you could
And-
please summarize.
And you missed the opportunity for World Cup. World Cup is international travelers are coming to New England. We're between two venues, Boston and New York, smack dab in the middle. Amtrak, Shoreline East would benefit from it, but we didn't have the foresight to put the money into it. And you guys need to really, really take it seriously. And I don't, you know, it's very frustrating for me. So.
I hear your frustration. I can
Yep.
assure you that I represent a district for which probably the major business is tourism and of various kinds.
Yep.
And I do, we talked about America's 250th, which of course is complicated for a lot of reasons.
Yep.
But there were people here earlier today who remain optimistic that we can still do something and that Connecticut is pursuing a constructive path forward. So I'm certainly hopeful that we can do that. But I hear you, and that's why we're having this hearing. Representative Rader.
Hi, Chris. Good to
Yeah,
see you. Thank
good
you
to see
for
you.
being here, and I understand your frustration. So
Oh, yeah.
it's well received. So I'm really interested in the study that you're going to put out, and I really hope that you will share that with us because I think it's going to be extremely valuable. I'm sorry that you had to go to the private sector to do that, but I think it's going to be really important to see what comes of that. And I really appreciate you connecting a couple of things, transportation, you know, and how we need to be investing in our transportation hubs and Shoreline East and Amtrak. We really need to be remembering that tourism only works if you can get people to and from as easily as possible. So thank you for highlighting that. And I'm curious, the impetus around this study, like what was the task at hand? Like if you had a directive around the study, if you could just share that with us.
So the directive around the study is to do everything. A town is in tourism. A convenience store is in tourism. A retailer is in tourism. A restaurant, a hotel, arts and culture, museums, marinas. They're all in tourism. We're all in tourism because we're selling Connecticut. And that's how the study needs to be done. Comprehensive, not in silos, and then get the multiplier, what it's going to be. I think it's going to be well north of $10 per dollar every you invest. So I think it's going to be a lot more than we think. And it's something that hasn't, the data that we've been using is 2012. So you're talking 14 years ago. And, you know, tourism's picked up significantly in our neck of the woods because we spent a lot of money on marketing. And, you know, on the district level, we do a public-private partnership. So you have to come in with money in hand and you get a dollar for dollar match. So you have skin in the game to make it worth your while. Because if you don't affect the bottom line of somebody's business, they all should be fired, bottom line. And at the end of the day, at the state level, we should be saying, where's the return on the investment? If we can get dollars in there and we can give you a significant, this is the only, I always say this, you know, if I turn around and say, give me $10 million, I'll give you 90 million in the same year. What governor in the country is going to say no, except Connecticut? And that's really, it bothers me because it's a revenue stream that could be very wealthy for the state of Connecticut. And, you know, we're trying to give you the path. We did it in the district and we raised $1.5 million in six years just to advertise to Eastern Connecticut. And that's where I think if we do it at the state level, do grant programs that are matching. So they have to raise some money, do some work to get the return on the other side from the state. And then you leverage your money. Now you multiply it. I tried to do a governor's challenge. I got all the way to the lieutenant governor, didn't get to the governor. And I asked for 5 million and we'd match it with the private sector and we would get 90 million back in the same year. We had some people in the private sector that were willing to put up some money to try to leverage state money to get more tourists here. So.
Thank you.
Yep.
Keep working on it. Don't go away. Thank you. Thank you, Madam Chair.
Thank you, Representative. I'm sorry, Representative Baumgartner.
Thank you, Madam Chair. And Chris, always a pleasure to see you.
Absolutely.
I would never question your passion for tourism. Certainly not after your hearing your just, I think, really pointed words. I think it is important to reflect on what we have done in the past. And you have come before this committee many, many times with the same message. And if there was ever a year to put our money where our mouth is, it is this year, given the World Cup, as you mentioned, and the 250th, so many really incredible events that will bring people from all over the world here to our corner of America. And my question to you is, obviously, we're discussing this because it is a revenue item. We're looking at diverting a portion of the meals tax to the tourism fund. And so in that vein, can you also speak to how, you know, in our area and certainly, you know, in Mystic, for example, the impact of the culture fund, for example, that was funded in large part because of those tourism dollars, and how you know, with obviously the reduction in federal funding that we've seen, how really that's created a huge hole and what we can do in the immediate term to kind of backfill it, maybe even outside of the, you know, with this meals tax revenue?
Yeah, I think regards to the, you know, arts and culture, you know, they get donors. They could take some of that money and use that as the matching grant program. So they raise some money and the state matches it, you know, and then they can, you know, have certain metrics that it has to go towards, you know, infrastructure, or it goes to marketing, wherever it is. But it has to have some metrics that can be met to move the needle forward, because you're not going to put money into something where it's not working, you know, because it has to work and you got to work that formula. And for me, I think with the marketing dollars, you know, is to try to get people to stay here longer. It's to how do you get the partnerships to all work together, you know, to make the stay not a 1.2 days in a hotel, it's 4 or 5 days, because the revenue for the hotels, the restaurants, the retailers is going to drive up the revenue for the state of Connecticut. And so if we can connect the dots where it's just not one region, you connect it throughout the state, and they make it a 4 or 5 day stay in Connecticut and not drive through us to go to Boston or go to New York.
And as far as the tourism fund is concerned,
Yeah.
as a board, right, Eastern Tourism Board,
Yep.
how do you leverage those dollars? And I guess how is that different from what the state of Connecticut would use as in kind of the Office of State Tourism, for example? What is I guess how does the state entity versus the more regionalized entity operate?
So we get
with those items?
400,000 for the districts, and we take out of that roughly about 80,000 a year as matching grant program. During COVID, we had more money, so we leveraged 180,000. So and they have to come back with metrics, and it works. And we just had on that grant program, we had 23 grantees this past year, which is throughout the entire region of the 41 towns, which was unheard of because before the districts weren't representing everything they're supposed to, but it wasn't being effective to get the dollars out there to promote the smaller venues, to try to, cultivate a longer stay. My big thing is it's heads and beds. Heads and beds should be the line that you guys use as politicians, that heads and beds means more revenue to the state of Connecticut. And, we should be looking at the metrics of what the hospitality is, because if they stay here, they're going to the restaurants, they're going to the attractions, they're going to the museums, and everybody benefits.
I like that, and I think with today's hearing with the hospitals, we're going to have to add meds to that. So
that's it.
But thank you for your time, and thank you, Madam Chair.
Thank you, Representative. Seeing no further questions, thanks for sharing your passion with us.
Thank you very much.
Next up, we have Mike Villette.
Good evening, Chairman Fonfara, Chairman Horn, ranking members Fazio and Paletta, vice chairs and other honorable members of the Finance Committee. My name is Michael Villette, and I am the Chief Financial Officer at Stamford Health, a hospital based in Stamford with a medical group in many towns dispersed across Lower Fairfield County. We are one of the few remaining independent nonprofit hospitals in the state. I am here to provide testimony in opposition to the governor's proposed hospital tax in Senate Bill 84. You do have my written testimony, and I'm really going to focus on 2 points, and I'm going to try to be especially brief. I do want to call out that I'd like to echo all of what you previously heard from Mr. Charmel and his verbal testimony regarding this bill. The CEO of Griffin Health. So there's many points that he made, and I don't want to be overly redundant. But I would say a couple of things and give back some time back to the committee, but happy to answer any questions. The governor's proposal, we feel, is inadequate and will exacerbate the cost shift that presently exists. As you heard, the present underfunding that exists between Medicaid and Medicare naturally forces us to put a greater burden on the commercial health care consumer. This will exacerbate that. We feel that the strategy and the approach in the governor's proposal is not optimizing what's possible in terms of procuring federal matching funds, and it's also not proportionate in how it's applied. It essentially unfairly picks winners and losers. The final point is that it is viewed as a stopgap approach. It does not cover multiple years. And as we know, Medicaid policies are changing fast in Washington, and the state needs to secure a multi-year agreement, or it may not have an opportunity to do that in the future. And with that, I close my comments.
Thank you. We appreciate you being here today. Seeing no questions, we return the rest of your evening to you.
Thank you.
Next up, we have Eileen Frank.
Good evening, Representative Horn, Senator Fonfara, Senator Fazio, Representative Paletta, distinguished members of the Finance, Revenue, and Bonding Committee. My name is Eileen Frank, and I'm the Deputy Executive Director of the Connecticut Museum of Culture and History in Hartford, a private not-for-profit museum which celebrated our 200th anniversary last year. Thank you for the opportunity to testify today in strong support of House Bill 5443. The Connecticut Museum of Culture and History is one of the state's leading cultural institutions, welcoming visitors from across Connecticut and beyond, while preserving and sharing the stories that shape our state. In 2025, we served close to 65,000 people through exhibitions, public programs, research, and collection access. Many of are funded in part with grants from Connecticut Humanities and Connecticut Office of the Arts. About 10% of our total visitation is from out-of-state visitors. Last year, those visitors came from 45 states, the District of Columbia, and Puerto Rico. Whether our visitors are from Connecticut or travel a great distance to visit, all visitors create economic impact through eating meals at local restaurants, staying in lodging, buying things in our state's shops, and supporting the more than 12,000 people employed in Connecticut in the cultural sector. I know there's been other members of my field who have come in front of you to testify. I don't need to repeat some of the particulars of the bill. I will just offer a real personal opinion if I can. I grew up out in Maryland, outside of Washington, D.C. I lived in upstate New York for about 15 years. While I was in upstate New York in the Albany area, I took vacations to every single New England state except Connecticut. And part of that was because of the lack of marketing of the richness of we have here in the state of Connecticut. I have been working in this state now for over 10 years, and I cannot believe the lack of funding we have to support our cultural institutions. As we are in a year where we are trying to celebrate and commemorate the 250th anniversary of the Declaration of Independence, we have the sites where battles were fought. We have the artifacts in our museums that talk about the impact that men, women, white, free Blacks, enslaved Blacks, Indigenous people in the land of Connecticut used to create our nation. And we have sorely underfunded our efforts to bring individuals across the state and from other states here to learn about the importance of our nation, as well as the role that Connecticut has played in the founding of our nation and for 250 years since. So I strongly support or encourage you to support the funding of this bill. And I really appreciate the time that you have given me to offer my testimony. Thank you.
Thank you for sharing your personal experience. That always is good for us to hear. Representative Farrar.
Thank you, Madam Chair. Hi, Eileen.
Hello.
Good to see you.
Good to see you.
Thanks for the great work you do. I did have a question. You mentioned, in your data, there's folks from 45 states who have visited from across the country. I was wondering if you also collect in your data how they might have heard of the museum, because that will, again, just help us greater understand how marketing is playing a role in that or not.
Yeah, we have noticed in the past, I would say 2 to 3 years, that ConnecticutVisit.com is increasing in the number of visitors that it's driving to our museum. And I really support the efforts that the state has made to enhance that website and then in general, the state tourism. Some of the marketing campaigns have also really worked. We do find that it is our marketing that still is one of the best drivers of visitors to our museum, whether that's our website, social media, and just other marketing efforts that we do. I love what Chris was saying about some sort of matching program to support marketing, because our marketing budget, while we have increased it in the 10 plus years I've been at the museum, if we had matching dollars, that would be incredible. We could do really amazing things to market.
Thank you. Thank you for that greater detail. Appreciate it.
Thank
Thanks,
you.
Madam Chair.
Thank you. Seeing no further questions, thanks for hanging in there with us today.
Thank you.
Next up, we have Drew Michael McQueenie. No? How about where are we? Mary Wick?
Yes, I'm here.
Great.
Hi, I would say good afternoon, but good evening, Senator Fonfara, Representative Horn, and the distinguished members of the Finance, Revenue, and Bonding Committee. My name is Mary Wick. I am the president of the Connecticut Lodging Association, and I'm a small business owner in the tourism industry, owning 2 inns in Westbrook, Connecticut. On behalf of our members and myself, I would like to share our support for SB 5443, dedicating half of 1%, sorry, of the meals tax for arts, culture, and tourism. I have to say that I just followed 2 very passionate people on this subject, and it is wonderful to see the diversity who have come out to speak about the value of tourism. A 2024 study showed that we had over 70 million visitors who spent over $18.5 billion in the tourism industry. And I think that what also has been very positive and encouraging is to hear not only the folks who are testifying, but that also hearing the committee talk about tourism as an investment, because whether you're looking at a 3-to-1 or 9-to-1, there's different information about what the return is, and it is a return within the same fiscal year. What you can agree is that for every dollar that is invested in tourism as an industry, you do get an immediate return. In addition, we have over 125,000 employees that are in the tourism industry. Those are all constituents across the state. And a strong tourism ecosystem is critical to these workers. I have 2 small businesses. I don't have a lot of employees. I have 10, but I can tell you that I have to go out of pocket to keep them working through the off-season. Having some type of statewide support to promote and market the state on a more balanced year-round position would be incredibly helpful. Many of these tourism employees need to go on unemployment, or they struggle through the off-season, creating incremental challenges with some of the other programs that you are talking about even today. I can also say that we have over 50% of our clientele are Connecticut residents. That means that we are not capitalizing on the tens of thousands of people who travel our roads to drive through Connecticut to get to other destinations that I believe, as Frank Burns outlined this morning, invest significantly more than we do as a state. In 2012, the occupancy tax for hotels was increased from 12% to 15%, with the revenue generated from that increase to be earmarked for tourism. Of the $20 million that 3% increase generated in 2012, fiscal year 2012, 15 million of it went to tourism. Since then, that money went into
You've reached 3 minutes. You could please summarize.
If you look at the total revenue over that time, from 2012, that 3% would have has generated $344 million. If you look at a return of somewhere between 3 and 9-to-1, we'd be looking at billions of dollars that could have been invested, or could have been reaped the benefit from the occupancy tax alone. So we just really encourage that you consider how tourism can be an investment to help fund the other programs that Connecticut so desperately needs to fund. Happy to take any questions, and thank you for your time tonight.
Thank you. I appreciate, again, the emphasis on the investment component of it. As we measure many things in the Finance Committee, as a legislature, we don't always do as good a job on the things that will pay off in the future that are investments. It's just the expense that shows up on the column of numbers. And so it's important to be reminded of that this is actually an important business in Connecticut and a substantial one. Thank you for joining us.
Thank you.
Next up, we have Emmeline. Oh, I'm sorry. Representative Carney, please.
All right.
Speak up.
Thank you very much, Madam Chair. No, I just wanted to thank Mary for coming on here and all the amazing work she does for the Lodging Association and her 2 inns, which are both fantastic in Westbrook. And she makes some excellent points, and we should be investing more in tourism. So thank you for coming on, Mary.
Thank you so much. I appreciate that, Deb.
You got a little free advertising there. How's that?
Yeah. Thank you.
Next, we have Emmeline Franklin.
Hello.
Hello.
Good evening, Senator Fonfara, Representative Horn, Senator Fazio, Representative Paletta, and members of the Finance, Revenue, and Bonding Committee. My name is Emmy Franklin. I'm a Public Policy and Advocacy Associate at the Connecticut Community Nonprofit Alliance. The Alliance is the statewide association of community nonprofits. Community nonprofits provide essential services to over 500,000 individuals and families in Connecticut every year and employ more than 118,000 Connecticut residents, improving the quality of life in communities across the state. The Alliance supports SB 85, an act authorizing and adjusting bonds of the state and establishing a supplemental graduate student loan program. Recent federal policy changes threaten access to financial aid for students pursuing careers in many of the professions that make up Connecticut's nonprofit and behavioral health workforce. Under changes included in H.R. 1, annual and lifetime federal loan caps for graduate students are being reduced. Most graduate students will be limited to borrowing $20,500 per year and $100,000 total. Students pursuing professional graduate degrees are eligible for higher limits, $50,000 annually and $200,000 overall, because those programs prepare graduates to enter licensed professions that require advanced training beyond a bachelor's degree. However, the U.S. Department of Education's proposed rules exclude many behavioral health and human service professions from the professional degree category. Graduate degrees in social work, mental health counseling, addiction counseling, marriage and family therapy, nursing, school counseling, occupational therapy, and related fields would not qualify for the higher loan limits. This exclusion could significantly impact Connecticut's ability to train and recruit professionals our communities rely on. Nonprofits already face unprecedented workforce shortages, particularly in behavioral health. Limiting access to federal financial aid may discourage students from entering these fields and further strain a workforce that is essential to supporting community well-being. A 2024 report from Connecticut's Office of Health Strategy found that 1.5 million residents live in areas experiencing shortages of mental health professionals. This gap exists while 1 in 5 adults in the state has experienced a mental health disorder. Given these potential federal changes, state-level support for graduate students entering nonprofit and behavioral health careers will become even more important. We encourage the committee to support SB 85 and other policies that expand student loan and tuition reimbursement programs in Connecticut. Thank you for the opportunity to testify, and I'm happy to answer any questions.
Thank you for being with us. Seeing no questions, thanks for spending your evening with us. Next up, we have John Wilson. Going once.
Thank you, Senator
there
Fonfara,
we go.
Representative Horn, and members of the Finance, Revenue, and Bonding Committee. My name is John Wilson, and I serve as the volunteer state president of AARP Connecticut. I also lead the AARP Connecticut Volunteer Fraud Watch Network team, which educates Connecticut residents about consumer fraud and how to avoid becoming victims. And I also volunteer with the National AARP Fraud Helpline, which receives 500 calls a day from victims of fraud. AARP is a nonpartisan organization with nearly 38 million members nationwide, including almost 550,000 in Connecticut. Fraud prevention is a core part of our mission and work. Most fraud goes unreported, and according to the Federal Trade Commission, fraud losses to older adults amounted to an estimated $81.5 billion in 2024. While fraud affects all ages, older victims often suffer severe financial loss, emotional trauma, and related health impacts. Strengthening state efforts to combat these crimes is essential. House Bill 5115 doesn't create a new tax rule. It simply allows Connecticut taxpayers to deduct the same fraud losses the IRS already recognizes, specifically unrecovered investment losses from cryptocurrency or wire fraud. The bill relies on federal definitions to keep the program simple and enforceable. It also provides meaningful relief to victims of cryptocurrency investment fraud by helping them recover financially from losses that are often devastating and permanent. Many victims lose substantial portions of their life savings and receive little or no restitution, and this deduction offers moderate but important financial relief that can help stabilize their long-term economic security. This bill represents a practical first step that acknowledges the real harm caused by fraud while operating within an existing framework that can be implemented quickly and responsibly. By limiting the deduction to documented losses, the bill ensures that relief is targeted to legitimate cases and maintains the integrity of the tax system. The legislation does not prevent broader action. Instead, it establishes a foundation that the General Assembly can build on to extend relief to all fraud victims in the future. While this legislation focuses on investment-related fraud, we strongly believe that all fraud victims deserve relief, including those harmed by romance scams, impersonation scams, and other non-investment frauds. Thank you for the opportunity to provide testimony on this important bill.
Thank you, John. I just want to add on a personal note that I really appreciate your lens on this. I will share that when I was a federal prosecutor, one of my first investigations was involved a group of people who had targeted seniors who had recently lost family, were lonely, had just enough finances that they were both insecure and had something to protect. And it was searing to learn that people, had intentionally targeted this group. It's a heinous crime. So I appreciate our ability to do whatever we can to help those who are the victims of that.
Thank you.
Any questions? Seeing none, again, thank you for providing your perspective on this one. Next up, Wendy Vincent. Then David Skolnick. How about Andrew?
David's on.
this-
He just needs to be promoted. He's joining the
Madam
panel
Chair,
now.
Yeah.
Okay. David, sorry. Yeah, David Skolnick, are you with us? Is that Tim
believe
Phelan?
so.
You're joining,
Yes.
David. Yes, sorry, I
Yes,
missed that part of my
Madam
note.
Chair, if it's okay,
Yes.
I'm further on the list, but David and I were gonna
That's
team.
fine. You're a panel. Well done. Go ahead.
Thank
Please
you.
proceed.
Well, thank you, Representative Horn and Senator Fonfara and Representative Paoletto and other members of the Finance, Revenue, and Bonding Committee for allowing David Skolnick, who is a board member and a business owner here in Connecticut, a member of our retail network, to testify tonight in support of House Bill 5443, which has a very long title. So we're just going to focus on the end of it, which says increasing the exemption amount for sales tax free week. I have submitted written testimony, so I won't go through that. Just to say that we greatly appreciate the committee's incorporating this idea, the increasing the exemption level for clothing and footwear back to $300, and the inclusion of backpacks we think will be a tremendous boost for consumers and for retailers. So thank you for doing it. I'm going to now defer to Mr. Skolnick.
Good afternoon. You can hear me okay, great? All right. Thank you for
can.
giving me, yep. Okay. Thank you for giving the opportunity to speak on behalf of the Connecticut families. I'm a third generation independent retailer of Mickey Finn's located in Berlin. Those of you who may not be familiar with Mickey Finn's, we are retail apparel and footwear for over the past 60 years. Being in Berlin, which is centrally located in the state, we have a broad demographic of consumers coming from Berlin, Wethersfield, Cromwell, New Britain, Hartford. And since we are a destination retailer, we draw from as far as Springfield, Mass. Since I oversee a small business, I am often on the selling floor and hear directly from my customers as well as my staff of their concerns. And one of the busiest selling seasons is back to school, which is when the current tax week occurs in August. During that week, families' purchases always have at least two items, we find. First are sneakers, and secondly are backpacks, book backpacks. Currently, most sneakers fall above that cap. Over 90% of our sneakers are marked now over $100. The recent tariffs, as well as the inflationary price increases from our suppliers, have increased our our costs dramatically. Therefore, our current tax-free week has become outdated. I'm hoping that we're able to raise the current $100 cap on apparel and footwear to $300 and also include book backpacks, which have not been included in the past. Connecticut families will really appreciate improving the affordability of back-to-school shopping. Thank you.
We'd be happy to answer any questions, Representative Horn and Senator Fonfara or other members of the committee.
Thank you. I know you are, and you are available in the building on a regular basis. Seeing no questions at the moment, we appreciate you highlighting this part of the bill.
Rep. Paletta is online.
Oh, I'm sorry, Rep. Paletta, please. Thank you, sir.
No problem. Chairman, thank you so much. Tim and David, thank you for testifying on this important topic. I think it's something that we've pushed for a number of years here. It's a very important week. We all hear from our constituents, about how important and so many families that utilize that week prior to school. I was just wondering if you could shed a little bit of light on that raising from $100 to $300, that threshold. I know you said, you wanted to include backpacks in there, but what would that get an average family? Like a pair of sneakers, I get it. It's very important especially for back to school, but what could like an average family be looking at if that threshold were raised to $300? Thank you.
David, you want to take that?
You're saying what, as far as backpacks go, that's pretty much a purchase that has not been included. So that's what we're looking to include in that sale.
So a family could expect, as the example that David gave, to buy a couple pairs of sneakers for their kids that are over $100 and save the tax up to $300 on that. And if they have multiple kids that need new backpacks to go back to school, they could save some money there as well. And then we've always felt, and I think is borne out, David and other retailers will attest to this, there's a dynamic effect around the sales tax free week as well, because you purchase some items and don't pay the sales tax on that. You feel like you've got a savings, and you may decide you want to either go to a restaurant or you might want to buy another item that is taxable. So we think we know it's had a real positive dynamic effect for the retail industry, and certainly consumers have responded to it tremendously.
The customer really gets out there. That week is very important to the consumer. They really get out there in the community. They're moving around, they're purchasing. The sneakers now, unfortunately, and I mentioned sneakers because that's pretty much an item that every single family buys. It's literally no one goes out the door without a pair of sneakers in their hand. Secondly, a backpack, as well as, of course, apparel. And unfortunately, our costs, it's unheard of now. It's unbelievable that our sneakers now are over $100. I can't believe I'm saying this now, but it's pretty much most sneakers now. So it's so important. That $100 cap is just, as you know, inflation and tariffs, just prices are just higher now on everything. So it's important to just increase that threshold.
Thank you both so much, and you answered my second question, which was that week also, I'm sure, spurs more economic development and growth throughout the state because folks feel, as Tim said, that they were getting a savings. So thank you so much for your time. Have a great evening.
Thank you.
It's really important for us to thank you, Representative Horn and Senator Fonfara and others on the committee for including this. This is a really important bill for our industry this session. So thank you very much for doing it.
You're welcome. And in the interim, I have to express that Senator Lopes reached out to praise how great your business is, Mr. Skolnick, and to express support for this. So he says hello.
We would encourage everybody on the committee to go to David's store. It's
More free advertising.
Thank you.
About it.
Word of mouth, my best kind. Yes, thank you.
Thank you. Okay. Oh, now we're going to return to Adam Kay, who was earlier on our list. Is Adam with us?
Yes, I'm here. Thank you. Thank you, Senator Fonfara, Representative Horn, and other members of the committee. I do really appreciate your flexibility in allowing me to come in here. So for the record, I'm Dr. Adam Kay. I'm a radiologist practicing in the greater Bridgeport area. I'm speaking today on behalf of the Radiology Society of Connecticut on Senate Bill 84 concerning revenue items to implement in the governor's budget. Our organization was part of a legislatively mandated working group in 2024 to look at, and actually I was part of the working group to look at workforce development in 3 key professions across the state, one of which was radiologic technologists. Rad techs are key to the effective operations of our radiology practices in our hospitals. They greet the patient, they explain to the patient the exam they're going to have, and then they're the ones who are performing the exam, acquiring the images, working with the patients and working with any staff available that they need to at the hospital to acquire the images, such as on an MRI scanner or a CAT scanner, and sending those diagnostic images to us, the radiologists, to interpret. One of the recommendations the working group made was to lift the initial license fee and subsequent renewal fee for this group of medical professionals. Sections 14 to 28 of the Senate Bill 84 does this for several professions that include physical therapists, dental hygienists, occupational therapists, among others. Rad techs are not included in this license relief, but we believe they're just as deserving of this benefit as are these other professions. We do commend Governor Lamont for proposing this bill. He's trying to provide incentives for professions that are in high demand in the healthcare system, professions like rad techs, where there is a shortage currently in the state affecting access to care. And we definitely agree with the concept of what the governor wants to do, and we ask that rad techs are added in as they're in short supply. Many practices, such as myself, are having difficulties hiring rad techs, as there's a limited supply of them. And so we believe rad techs deserve to be included in this bill to have license and renewal relief, and we hope you'll consider doing so. I'm happy to answer any questions about this issue, rad techs, that you may have, or anything related to it.
Thank you. Could I ask, did you submit written testimony?
Yes. Yeah, I
Great.
submitted this as written
I'm just
testimony.
trying to keep a list of the requests for other people to be included so we can look into that.
Mm-hmm.
Seeing no other questions, thanks for coming back and testifying.
Yep. Thank you for your time. I appreciate it.
Next up, we have Andrew Simino.
Chair and members of the Finance, Revenue, and Bonding Committee, my name is Andrew Simino. I'm the president of Crisp Cannabis. I respectfully submit testimony in support of Raise Bill 5109, which would replace Connecticut's current potency-based cannabis tax with a simple 10.7% excise tax. The current THC-based tax structure is complex, difficult for consumers to understand, and often results in a higher effective tax rate than neighboring states, putting Connecticut's businesses at a competitive disadvantage and pushing consumers towards out-of-state or illicit purchases. Moving to a straightforward excise tax would simplify compliance, improving pricing transparency for consumers, and help strengthen Connecticut's regulated cannabis market. A stronger regulated market keeps consumers safer by ensuring products are tested, labeled, and sold through licensed businesses, while helping combat the illicit market that operates without these protections. Companies like ours are also investing heavily in workforce development, job creation, and community support, helping generate tax revenue that funds social equity initiatives and local programs across the state. For these reasons, I respectfully urge the committee to support Raise Bill 5109. And thank you for listening.
And thank you for sticking around into the evening.
You're welcome.
Seeing no questions, we will return the rest of your evening to you.
Thank you.
Next up, we have Gretchen Richardson.
Hi, good evening. Senator Fonfara, Representative Horn, Senator Fazio, Representative Paletta, and honorable members of the Finance, Revenue, and Bonding Committee. My name is Gretchen Richardson. I do apologize, I have a very bad cold, but I am the Executive Vice President at Continuum of Care, headquartered in New Haven and operating in 60 locations statewide. Thank you for the opportunity to provide testimony in support of SB 85, specifically to request an appropriation of $150,000 in bond funds for the purchase of emergency backup generators to support 10 transitional and permanent supportive housing programs operated by Continuum that serve adults diagnosed with severe and persistent mental illness, significant developmental disabilities, or both. Continuum of Care provides housing, stability, basic needs, clinical support, case management, and life skills services to some of the most vulnerable adults in our state. These individuals strongly rely on consistent, safe, and fully functioning living environments to maintain health, stability, and dignity. Many of these residents depend on a constant trauma-informed environment that provides stability and familiarity, refrigeration for temperature-sensitive medications, medical equipment that requires continuous electricity, temperature regulation for health and safety, and communication systems to remain connected with staff and emergency services. So many of our clients are challenged with anxiety and effects of severe trauma. When power outages occur, having to relocate can be very damaging to these individuals. Staff are forced to employ emergency relocation plans, which disrupt routines and end up often with difficulty to maintain safety with inadequate resources. We are requesting this $150,000 to purchase the generator so that we can keep our individuals in the home during inclement weather and power outages. Thank you very much for your time and your consideration of this.
Thank you, and I hope you can go have a cup of tea and feel better.
So sorry. Thank you.
Do not apologize. We hope you are recovering, and we appreciate the remote option for those of us who aren't feeling well. So thank you for that too. Next up, we have Kapal Patel.
Yes. Before we get started, can I request to add my business partner, Jocelyn, with me as well?
Are they signed up as a speaker?
Believe so.
Do you know what number speaker?
I'm not sure, but we can proceed. That's okay. I would just like to first say thank you to the Finance, Revenue, and Bonding Committee for providing this opportunity to testify. I'm testifying today in support of HB 5109, which will simplify how cannabis products are taxed in Connecticut. My name is Kapal Patel, and I'm one of the owners of Shangri-La CT and Shangri-La Farms. We have 4 retail stores in Norwalk, Waterbury, and Plainville, a manufacturing facility in Waterbury, and a 40,000 square foot cannabis cultivation facility in Stratford. We're also planning to open and manage many more retail locations this year. Connecticut's cannabis market has developed really well, but industry data shows that Connecticut cannabis consumers are spending an approximately $160 million to out-of-state dispensaries in 2025 alone. This is all the money that has lost tax revenue for Connecticut. Higher Connecticut taxes are one of the primary reasons for consumers to go out of state. Connecticut's current total tax rate on cannabis product brings it to about 26%, which is 10% higher than compared to Massachusetts. And cannabis is now taxed at a rate that is also substantially higher than most alcohol. HB 5109 will create a fair and more competitive market by bringing cannabis taxes more in line with the neighboring state, and this will help more tax revenue here and remove the incentive for consumers to buy out of state or through the black market. So I just want to say thank you for introducing this legislation, and lower, fair, and more competitive taxes will keep our state's cannabis market growing for all our producers, retailer, consumer, and taxpayers. Thank you for giving me this opportunity to speak today.
Thank you for staying the course tonight. So I appreciate your testimony.
Thank
Seeing
you.
no questions, we will Ben Wade.
Ranking members Fazio and Paletta, Vice Chair and member of the Finance Committee. My name is Ben Wade, and I'm the Chief Strategy Officer at Stamford Health, an independent nonprofit hospital serving Stamford and many communities across Lower Fairfield County. Stamford Health is rated the #1 hospital in Fairfield County by U.S. News and World Report. We provide some of the most sophisticated services in the region and operate the largest and most comprehensive medical group in Lower Fairfield County. In 2024, we provided more than $170 million of uncompensated care, second only to Yale New Haven Health in the state. We are deeply connected to our community and committed to programs that meet community need, even when reimbursement is lowest, such as behavioral health. I'd like to start by saying that we're aligned with CHA's proposed approach, and I'm here to testify in opposition to the governor's proposed hospital tax in Senate Bill 84. Hospitals face a cumulative set of challenges that make it critical that any hospital tax adopted by the legislature is fair and sustainable. I'll highlight 3. The first challenge is Medicaid underfunding. Hospitals serve all people. 1/3 of Connecticut residents, roughly 900,000 people, are enrolled in Medicaid. Not all providers accept Medicaid due to low reimbursement rates, but all hospitals do. We are there 24 hours a day, 7 days a week. Medicaid currently pays hospitals about 65 cents on the dollar for the cost of care. As a result, hospitals collectively lose $1.5 billion per year caring for Medicaid patients. A recent Department of Social Services report found that Connecticut Medicaid payments are 27% lower than peer states nationally. The second challenge is the hospital tax itself. Over the past 15 years, the Connecticut hospital tax structure has generated billions of dollars for the state to help it meet its broader Medicaid spending while costing hospitals billions. At Stanford Health, we are in the hole $154 million over the life of the tax, after taking into account rate increases and supplemental payments. We just broke even on the hospital tax this year to the tune of $1 million. But that is not taking into account the money we lose on Medicaid reimbursement. The third challenge is growing coverage and stability. Upcoming federal Medicaid policy changes may result in significant coverage losses. DSS estimates that almost 130,000 residents could lose Medicaid eligibility due to new work and engagement requirements alone. Hospitals and communities are preparing for this. In Stamford, we're partnering with Mayor Simmons and local nonprofits to help residents maintain coverage whenever possible.
Your 3 minutes are up. If you could please summarize.
Sure thing. In closing, we would ask the legislature to adopt a hospital tax that maximizes federal dollars, lasts for at least 5 years, is enacted soon while federal rules are stable, and ensures that only hospitals that pay the tax receive supplemental payments. Thank you so much for your time, and I'm happy to answer any questions.
Thank you. As you know, the hospitals have been robustly represented this evening, both by CHA and the individual hospitals. And I think it is among the most serious things that we have to resolve this year. So
thank you. Thank you for taking
it's
it
complicated,
seriously.
but we see you.
Thank you so much.
Seeing no questions. I'll look online. Yes. We will go next to Liz DuPont-Deal.
Good evening, Senator Fanfara and Representative Horn, and all members of the committee. I am Liz DuPont-Deal, a lifelong resident of Connecticut and Associate Director of the Connecticut Citizen Action Group. I speak today on behalf of CCAG and our thousands of members throughout the state. CCAG is also a member of the Husky for Immigrants, Health Justice Now, and we support the legislative priorities of Connecticut for All and Stand Up CT. Connecticut has long had one of the most oppressive gaps between rich and poor. Inequality in the U.S. is the greatest since the Gilded Age, and Connecticut's disparity is unfortunately amongst the worst when compared to other states. H.R. 1 has made this far worse and represents the single largest transfer of wealth from low-income and middle-class people to the wealthy ever. Trump's illegal tariffs are making this even worse. Data Haven points out that people in the top 25% of income in Connecticut will pay $3.4 billion less in taxes every year going forward. Just today, 15 Connecticut billionaires are on a new list of the world's richest people. At the same time, H.R. 1 contains more severe cuts in funding for food, healthcare, education, housing, clean energy, along with other areas. Many of these cuts will be phased in 2027 and beyond. We appreciate that the legislature and governor has recognized the resulting emergency and responded, although in a very limited way. As CCAG has testified, much more needs to be done, and even more will be required as additional parts of H.R. 1 get implemented. Clearly, the resulting emergency will not end when the fund you created ends. Therefore, we would propose that you amend one of the bills today to let the expiration date of the emergency provide greater flexibility on what this could be spent on, give the legislature the ability to initiate spending, and finance it by recouping the income tax from the top 25% to finance the fund on an ongoing basis. The truth of the matter is that this should not be considered a tax increase since these people will still get their taxes reduced from HR 1. We need structural reforms to our tax and spending system, and fairness demands that we stand up to Trump's handouts to billionaires and take care of our people. Failure to comply with a policy like this is an endorsement of Trump's budget and HR 1. I welcome any questions and thank you for your consideration.
Thank you. Seeing no questions, we thank you and we'll move on to Amaris Williams.
Hello.
Hello.
Hello, esteemed members of the Finance, Revenue, and Bonding Committee. I thank you so much for the opportunity to speak to you about dedicating a portion of the meals tax to the Tourism Fund to support cultural organizations as outlined in HB 5443. My name is Amaris Williams. I live in Middletown, and I'm the Executive Director of the Connecticut League of Museums, our state museum association based at Central Connecticut State University in New Britain. We're a small grassroots organization with only 2 full-time staff members, but we serve a large and vibrant community of the over 500 museums that anchor towns across the state. I've submitted written testimony about what humanities and arts grants mean to us and to our members. And in my remarks this evening, I want to highlight the digital infrastructure we also provide through a project called Connecticut Collections. Connecticut Collections is an open source collections management system and public research portal that the League launched more than a decade ago. It helps museums of all sizes, especially those with small budgets, catalog their materials professionally and make them accessible to the public online. What started as a pilot project with a handful of organizations in 2015 now serves over 50 across the state, including the Sharon Historical Society, the Twain and Stowe Houses, Portland Historical, Mattituck Museum, the list goes on. And not a week goes by that we don't get an inquiry from an interested member of the public about an item that they found on Connecticut Collections. So this public portal really helps people in our state and around the world discover everything our museums have to offer, and it drives tourism. Connecticut Collections would not exist today without the grant funding we have received from Connecticut Humanities. They understood the project's potential from the beginning and have supported its expansion and improvement. Connecticut is one of only 2 states that provide this sort of service to museums on a statewide nonprofit basis. The Minnesota Alliance of Local History Museums came to us in 2017 to help launch their version of the project. In Minnesota, a dedicated grant line of state cultural funding from sales tax revenue has enabled broad participation among even the smallest of local museums. The Minnesota's Arts and Cultural Heritage Fund shows that dedicating existing tax revenue to the cultural sector as proposed in this bill can be a powerful engine that lifts up all museums and gives them equitable access to the tools and training that they need. Now, this is just one of many transformative projects that Connecticut Humanities and the Office of the Arts have made possible. And I want to underscore that now is the time to invest in the organizations that really make our state such a vibrant place to live, work, and play. I was recently in DC for Museums Advocacy Day, and one of the things that I discovered in my research for that is that between 2024 and 2025, the amount of federal dollars coming to Connecticut museums dropped from nearly $1.5 million to less than $100,000. So on behalf of our state's 500 plus museums, I urge you to support the provision allocating a portion of meals tax revenue to the Tourism Fund to support our sector. Thank you for your time, and I'd be happy to answer any questions anyone may have.
Thank you. Thanks for sharing your particular experience. That sounds really interesting.
You can check it out online at ctcollections.org.
Here we go. We are all about advertising tonight. Whatever we can do. Next up, we have Melvin Medina. Nope. How about Sharon Adams?
Good evening, Chair Fontana, Chair Horn, and ranking members Fazio, Planta, and distinguished members of the Finance, Revenue, and Bonding Committee. My name is Sharon Adams. I serve as the Eastern Regional President for New Vance Health Connecticut, now part of Northwell, which oversight of Danbury Hospital, New Milford Hospital, Sharon Hospital, as well as the Home Care Agency. Thank you for the opportunity today or this evening to be able to provide testimony opposing our SB 84, the act of the concerning revenue items. I also have presented a written testimony. While we recognize the good intention behind the legislation and the proposed budget adjustments, as well as remain committed to the collaboration of this team, we really look towards the policymakers to ensure state hospitals are financially stable and able to deliver high quality care. While doing that, we have serious concerns with the hospital's tax provision as it's currently drafted. SB 84 does not include an equitable sharing of federal match. With the burden of providing the tax dollars, it appears the state proposes to divert funds to state budget offsets and even non-tax paying hospitals. As currently structured, the SB 84 hospitals paying onto the tax could end up subsidizing hospitals that do not contribute to the tax at all. Looking ahead to the proposals in SB 84, we want to avoid missing the opportunities for what could be more innovative proposals. We look towards believing that our better ways fully aligning with the current Connecticut Hospital Association proposal, structuring the hospital tax program so that it maximizes available federal matching funds while ensuring that the hospitals contribute to the tax receive a fair and equitable return through supplemental and other payments. We are continued to working and collaborating all together and are committed to working with administration, the legislature leadership, and the Connecticut Hospital Association to develop a more equitable and sustainable solution that strengthens the entire healthcare system. Finally, as we separate but important matter, I want to support the governor's proposal to eliminate certain occupational license application and renewal fees as a way to help recruit and retain the strong healthcare workforce our state needs. And thank you for your time and consideration throughout this day and evening. Be happy to answer any questions. Thank you.
Thank you. And given that you are my hospital system, having you be the closer for the hospitals, not for the day. Don't get anyone get excited. I appreciate you sharing your experience here. And as you know, the hospitals have been well represented today. I wondered, given that I have a rural hospital as my hospital, if you have any particular concerns here with respect to the smaller hospitals or the more rural hospitals that are part of your system.
Well, as you know, Representative Horn, because you've been working with us, it is obviously already very difficult for Sharon Hospital. So the added burden to this tax, as well as what you've already heard from my colleagues on the Medicaid, funding, that it's already impacting the state, or overall the 1.5 billion, but the impact to us for a system for Medicaid is over, which includes Sharon, just so you're aware, is over in excess of 105 million. So if you think about that, you can imagine what that must impact for Sharon, as well as the rest of our hospitals within New Vance Health for the Connecticut.
Yes, I as I said before, this is a serious issue for us this year. So I appreciate you being here and
Thank
all
you.
of your
Thank you
colleagues.
once again for your support.
Senator Fonfara.
I don't dare to ask questions on a third rail with my co-chair sitting next to me here. I value my shins, but
give away my secrets.
Can you share with the committee what percentage, I don't know the terminology, I'm on the low end of the learning curve, but we'll get better on this subject. But what percentage, or however you calculate Medicaid as versus your commercial pay?
Sure.
And where are you in the continuum, if you will, of
Sure.
other hospitals?
So for us, for the New Vance Health hospitals for Medicaid, it's around 12 to 14%.
Is that considered on the high end or
I would say, I think it would be fair to say we're on the lower end.
you're on the lower end? Okay. But it still affects you,
It
obviously.
still affects us when you think of overall. And then when you look at the overall self-pay Medicaid as well then Medicare, it brings us up to more like a 65%. And then for the commercial is the lesser.
Thank you.
You're
Thank you, Madam
welcome.
Chair.
I'll spare your shins only because they're my hospitals. Being no further questions, again, thank you for being here tonight. Next up, we have Stephen Ranieri.
All right, good evening. Chairwoman Horn, Chairman Fonfera, ranking members Paletta and Fazio, and members of the Finance, Revenue, and Bonding Committee. My name is Steve Ranieri. I am a Simsbury resident and controller for Enterprise Mobility here in Connecticut. I am testifying in support of Section 1 of HB 5443. Enterprise Mobility is proud to employ 700 people operating in 70 stores who assist customers in Connecticut from all income populations and demographics. We also pay property taxes on all of our vehicles within those 70 cities and towns. We support efforts to codify the 2021 DRS ruling and join 20 other states, ensuring all companies who rent vehicles are treated equally regarding sales and use taxes. Currently, traditional car rental companies are subject to an elevated 9.35% sales tax, as opposed to 6.35% for other businesses, including peer-to-peer companies. In 2021, the General Assembly passed legislation regulating the peer-to-peer car rental industry, more in line with the traditional car rental. Part of that legislation included a request of the DRS to submit a ruling to the legislature on how these peer-to-peer car sharing transactions should be treated relating to taxes. The DRS ruling determined that through the Marketplace Facilitator Law, peer-to-peer car sharing rentals of 30 days or less are subject to the higher sales tax rate of 9.35%. This ruling was reinforced in DRS's testimony last year to this committee on a similar bill. HB 5443 achieves parity in the marketplace by requiring the 9.35% sales tax to be assessed to peer-to-peer rentals less than 30 days. It was suggested in testimony earlier that the additional 3% would burden Connecticut residents who rent from peer-to-peer companies, but I can assure you that our customers are the same and are already subject to that elevated tax. The same low-income customers mentioned also rent from our company. Lastly, I'd like to address the statement that we do not pay sales tax when we purchase our cars. We comply with all state and federal laws. Like any other wholesaler, we purchase our cars with the intent to rent them to customers, much like Best Buy purchases TVs without paying sales tax to the manufacturer and sells them to the public, who then pay sales tax at that point. We collect sales tax on behalf of our customers. We remit to the state monthly. And then when we sell our vehicles to local dealerships, we do not charge the dealership sales tax. The dealership then sells the cars to the public, at which point they collect sales tax from the customer and remit to the state. We respectfully request that you pass Section 1 of HB 5443 and ensure that the state maintains equal tax policy for all companies who rent cars. Thank you for your time.
Thank you. And excuse me if you included this, but I think we also heard, did you talk about property tax? We also heard testimony that you don't pay property tax on your cars. Is that correct?
No, that's not correct. We absolutely pay property tax on all of our vehicles. We are registered in 70 towns throughout the state. It is a bulk of what my team and I do. We spend a lot of time, as you can imagine, with different mill rates in the different towns, trying to plan and budget for that expense. And if you were to ask any, town assessor or collector, they for sure know who we are, because we are probably their biggest company or customer in terms of registering vehicles.
Thank you. Seeing no further questions, thanks again for being here.
Thank you.
Next, we have Marcy Russo. How about Diane Whitney? No. Jason Teal? He nodded at that one.
Hello, can you hear me?
Yes, we can.
Hey, Senator Fonfair, Rep. Horn, honorable members of the Finance, Revenue, and Bonding Committee. Thank you for giving me the opportunity to testify on HB 5109. I'm definitely in support of that bill. I had to step out. I coach my son's fifth grade basketball team, so sorry for the noise in the background. I had to step out. I would have had a lot of angry 11-year-olds if I missed this practice. But I thank you guys for your time. I'm not going to get into a long, drawn-out speech because I had a bunch of my colleagues already testify in favor of the tax provisions, that we desperately need. Having a high tax rate that's not in line with our competitors, it just drives sales out of the state and also just fuels the black market. I've heard reports already of, about $160 million going to surrounding states and also another $160 million that's going into the black market. And right now the black market, they have better packaging than us, which is more, which the consumers, gravitate towards more. And they also have no taxes and lower price points. So by us having all these obstacles, that is already, how we're highly regulated, overregulated, I would say, and a high tax, it just drives all the money straight to the black market and it fuels it. So everyone's already in line. The only thing I would add is that, I would think that we probably need to be a little bit under our surrounding states because the consumer habit has been already to go to the surrounding states. So I feel as though if we came in a little bit under the surrounding states, that would put us in a better position to, capture some of that market back. And it's a different animal that we deal with because we have a product that people are accustomed to already getting it through other ways. They're accustomed to getting it through the guy that pulls up at their house. They're accustomed to getting it in the black market already. So we have to drive people away from the black market and we have to drive people away from competitor states. In Connecticut, since we're so small, pretty much every dispenser operates under border, conditions. If you're in Meriden, it only takes you 45 minutes from Meriden to get to Springfield. So every single dispensary, is in threat of another state that our customers can just be driven to. So I'll just end it there if you guys have any questions, but I don't think I need to get into a long drawn out thing. I'd be more than happy to answer any questions or have any follow up, but it's just something that every single person in our industry is in favor of.
Thank you. We appreciate the specifics of what you're experiencing in your business. So I thank you for your testimony, Senator Fonfara.
Thank you, Madam Chair. Jason, can you tell us, you said that among other things that the underground market has advantages is they have better packaging. What do you mean by that?
Yeah, so because of, the strict rules around our packaging looks too medical, right? Because I know, a lot of it may be driven by DCP and they come with the medical mind frame, but consumer packaging is very important in any industry. And the restrictions that we have on packaging almost makes our products look fake. And it makes the black market products look real because they could just go out and do whatever they want on packaging. So they have a bunch of colors. They have, that things that we just can't have. So it just makes their packaging more appealing to customers. Now, I'm not talking about appealing to kids. I'm just talking about just consumer packaging standards that any other business would have, like alcohol. They have multiple colors on their packaging. We just need so things like that. So when someone walks into a dispensary, someone walks into a black market smoke shop, the products that they have at the smoke shop look more real than the products that we have in our dispensary. So a lot of times people walk into smoke shops and they think they're regulated. They think they're regulated dispensaries. I was the first dispensary to open up in New Britain. And when I opened up, I was having debates with people saying that I wasn't the first regulated dispensary to open up in New Britain. People thought that these other smoke shops were regulated just because of, it's a store. They walk into a storefront. There's lights. There's packaging on the products. So that's all I mean. And I'm not talking about anything that go ahead. I'm sorry.
I don't expect you to respond for law enforcement, but how do smoke shops get away with that selling?
I think that a lot of law enforcement don't understand that there was more teeth added to the legislation that helps them enforce it. I just don't think it's high on their radar. I've had conversations with the police chief here, and it hasn't really gone that far. I don't know if they need help enforcing it or whatever, but everyone knows they're there, and people just choose to just not do anything about them. I can name 4 or 5 smoke shops off the top of my head that are in New Britain that everyone knows is a smoke shop and selling illegal cannabis. So I mean, and that's something we have to compete. You go into New Haven, there's a bunch of smoke shops. All these cities, there's a bunch of these smoke shops, and this is actually where the kids are getting it from. They're not getting it from our regulated store. You gotta get your ID scanned. You go into a holding tank. Like, there's no way that they're even getting into our store. They're getting them from the streets and the black market smoke shops.
Well, maybe some of the tax revenue we're generating ought to go towards law enforcement. But Madam Chair, thank you, Jason. Madam Chair, if they're an example of the value of remote testifying, here's a gentleman who is with his basketball team and able to testify before the Connecticut legislature at 7:30 in the evening.
Indeed. Thank you for your dedication, and we wish good luck to your son's team.
All right, thank you. Seeing the guys in the back, we're going for a new Britton Rec championship. We got a good chance. So, guys, wish us well.
Get back in there.
All right, thank you. Yep.
Thank you. Next we have Michael Finley.
Yes, thank you. Good evening, members of the Finance, Revenue, and Bonding Committee. My name is Michael Finley, and I serve as the Senior Director of Government Affairs at Mystic Aquarium. Thank you for the opportunity to testify in support of Race House Bill 5443, particularly the provision dedicating additional revenue to Connecticut's Tourism Fund. I know you guys have heard a lot of testimony on this bill, so I will keep my remarks brief. Mystic Aquarium is proud to be one of Connecticut's most visited cultural institutions and a key driver of tourism in southeastern Connecticut. Each year, we welcome approximately 800,000 guests, with more than half traveling from outside the state. For many families, Mystic Aquarium is a reason they choose Connecticut, and Mystic in particular, as their destination. Those visitors support much more than the aquarium. They stay in local hotels, dine at nearby restaurants, shop in local businesses, and visit other attractions. When Mystic thrives, visitors stay longer, spend more, and return, supporting small businesses, generating tax revenue, and sustaining jobs across the region. The provision dedicating a portion of the additional 1% meals tax revenue to the Tourism Fund is a thoughtful way to strengthen Connecticut's visitor economy. Because visitors contribute significantly to meals tax revenue, reinvesting a portion of those funds into tourism promotion helps sustain continued visitation and economic growth. Tourism marketing is essential because Connecticut competes with neighboring states that make major investments in promoting their destinations. Ensuring that the Tourism Fund has stable resources helps our state remain competitive in attracting leisure travelers, cultural tourism, and family visitors. Mystic Aquarium reflects the strength of that visitor economy. We contribute more than $15 million annually in goods and services, employ more than 270 staff members, and engage over 900 volunteers and approximately 50 interns each year. Our impact also extends to the community. In 2025, we welcome more than 100,000 Connecticut residents through our complimentary admission program for EBT cardholders, representing approximately $4 million in community value. Mystic Aquarium's success is closely tied to the strength of Connecticut's tourism brand. On behalf of Mystic Aquarium, I respectfully urge the committee to support the provision in Race House Bill 5443, dedicating additional revenue to the Tourism Fund. Thank you for your time and consideration.
And thank you for being with us, Representative Baumgartner.
Thank you, Madam Chair, and just want to thank you, Mike, for all that you do to promote Mystic Aquarium, to keep it in line with the good chair's comments about free advertising. I would note we have Penguin Day coming up on April 22nd, and eagerly await the arrival of the South African penguins from our hometown in Mystic. So thank you again, Mike, and appreciate all you do to protect our aquatic species from throughout our entire planet.
Thank you, Representative. Always appreciate your leadership in the district, and I can argue that I believe Penguin Day is one of the best days at the Capitol. Thank you.
We will look forward to that. Thank you, Representative. Next up, we have Winnie Wong. Welcome, finally, to the desk in the front of the room. Would you please turn your microphone? There we go.
Can you hear me now?
Yes.
Good evening, Madam Chair, Senator Fonfara, and honorable members of the Finance, Revenue, and Bonding Committee. My name is Winnie Wong. I'm a resident of South Glastonbury and a transplant from California. I'm here to express support for HB 5443, which proposes dedicating 50% of the existing 1% meals tax to the tourism fund to support arts and cultural organizations in Connecticut. As the marketing and communications director for Real Art Ways, a 50-year-old nonprofit arts organization in Hartford, I get to witness the transformative nature of the arts on people living in and visiting Connecticut every day. Real Art Ways presents exhibitions, talks, festivals, screenings, performances, and social gatherings that welcome audiences from all ages, backgrounds, and cultures. As you've probably gathered today, we are part of a vibrant and collaborative arts and cultural ecosystem in the state. We're proud to be a third space that is accessible to all. Our youth program serves students who are curious about art, film, and creativity. Our patrons are people who live and work in Hartford, come to us from surrounding towns, and visitors from other cities and states. They're people who are surprised by our eclectic programming and somehow feel right at home when they come to our events. Time and time again, people tell me, I wish there was a Real Art Ways in my town. When people visit Real Art Ways from out of town, they dine in Hartford restaurants, stay in hotels downtown, and contribute to the local economy. Our cultural programming puts money directly into the region's small business ecosystem, with tourism being a major economic engine for the state. In order to continue our work of championing artists and underrepresented voices, commissioning public art projects, creating jobs for the next generation of teaching artists and arts administrators, and bringing people together from all walks of life, we need the continued support of Connecticut Humanities and Connecticut Office of the Arts. We're a physical space that's expanding and an essential resource and hub for many diverse communities, and we value this relationship with both organizations. Now, at a time when we're facing federal funding cuts, dedicated, stable, and strategic funding from the meals tax can empower arts organizations like ours to do much more. On behalf of Real Art Ways, I urge you to vote yes on HB 5443. Thank you for your time today and for supporting arts and culture in Connecticut.
Thank you, and thank you for sticking around into the evening with us.
Thank you.
Seeing no questions, we hope you have a good rest of your evening.
Thank you so much.
Next up, we have Noah Golden.
Hello?
You're on, sir. We can hear you.
Hi. Hello, representatives and committee members. Thank you for letting me speak today and for your service to the people of Connecticut. My name is Noah Golden. I'm here to testify in support of House Bill 5443, specifically the provisions dedicating a portion of the meals and beverage tax to the tourism fund to support arts, culture, and tourism programs on behalf of the Arts Council of Greater New Haven. I've been a member of multiple arts nonprofits in the New Haven area for the last 20 years. And as a recent board member and lead creative of Hughes Theater of Connecticut, the Arts Council has been instrumental in helping us support our work through grants and mentorship, helping us promote our productions through their community calendar and newsletter, led by the wonderful work of Lucy Gelman, and given us, as well as so many other nonprofits, free rehearsal space through the Sandbox. This is no small thing. As perhaps surprising for a big city like New Haven, rehearsal and event space is rare and free space is almost non-existent. For a company like ours, paying an hourly rate for rehearsal space would eat up thousands of dollars into our very small budget. And the Arts Council couldn't have been more wonderful or welcoming. They're a gem of an organization and do more to support and foster the artistic community in New Haven than anyone. New Haven prides itself on being an artistic place, from being the birthplace of the hamburger to the pizza capital of the country, from our museums and murals, from fostering the careers of August Wilson, Christopher Durang, and recently the Tony winner, Will Aronson, to our nationally known theaters and critically lauded community groups, from our underground music scene to the International Festival of Arts and Ideas. But that reputation of New Haven as a place that fosters creativity and innovation is only true if the state supports arts and the artists. These things that put New Haven on the map culturally, that draw tourists to our cities and make life here vibrant, do not happen in a vacuum. They need nourishment and support, which is almost impossible with the level of arts funding coming in nonprofits these days. Arts organizations are hurting and closing across the state. This money will ensure a new generation of artists will be supported and their work amplified. I know there is a lot of need in our state, and supporting the arts this time may seem like an afterthought. It doesn't keep food on our table or clothes on our back, but art does create a home. Ask any student about the sometimes life-saving community they find in their drama club, or how a place like Bergamo's Community Theater has brought together New Haveners from all walks of life in the intersection of art, community, culture, and politics. And art does feed us through the music that uplifts us, the shows that help us unwind, the poetry that stimulates us, the theater that entertains us, the art that ignites our political and artistic expression, the museums that educate us, and the books that help us make sense of the world around us. They are essential to the well-being and growth of our community. So in that way and many more, the Arts Council, the work the Arts Council does.
You've reached the 3 minutes. Please summarize.
Thank you. In that way and many more, the work the Arts Council does is critical to the creative work of everyone in New Haven, and I would say all New Haveners. Thank you.
And thank you. Seeing no questions, again, special thanks to those at the end of our list for hanging in there with us.
Have a good evening.
Next up, we have Christine Jewell. No. How about Bright Johnson? Okay. Anyone else that we've missed, Mr. Administrator, or anyone else who's in the room that we didn't call or online that we didn't call? No, it looks like we are good. Okay. Thanks to everybody who's here, everybody who's online, but especially everybody who's still here. And our next public hearing is next Monday at 1 o'clock. Okay, thanks everybody.